National anthem is there. Where is Vande Mataram last? Only Janganamana is there.
అరే ఇది మొత్తం సార్ ఇంత పెద్ద టేబుల్ ఇక్కడ వేస్తే మొత్తం
अभी तो खुला है इसीलिए मंगाया
లాస్ట్ ఇద్దరు మహేష్ గారు గోపాల్ This is mine. I want to. But I have to. No. I'm just thinking. Where is everyone? This is very small. The top side between one side of it. Yeah. They have to come. Because it will be
ಆಗೋಣ ಲೈವ್ ಒಂದು
Felicitation also I need to say something.
What you need to tell?
Because it will be very
I am telling already. Already I am writing now. Padma Bhushan recipient also I am telling.
Otherwise it will be very lengthy
No.
also.
Then here also.
So then for the lifetime also we have
If
to
I say deliver lecture, it won't be nice now.
yes.
Am I right now? No. Gerald Mahesh. Venkateshwar. Sharma, Krishna, Naveen India, souvenir.
Krishna is pink. I will give my Finally, it's the co-organizing secretaries of LASACON 2022, Dr. J. Mahesh, scientist CCMB, and Dr. Jayant Hole, scientist NAB. Can you please both join the dignitaries on the dais? Thank you. You can move. Shubham Karoti Kalyanam Arogyam Dana Sampada Satrubuddhi Vinashya Deepa Jyoti Namostute. This Sanskrit shloka translates to, I salute the one who is the lamplight that brings auspiciousness, prosperity, good health, abundance of wealth, and destruction of ignorance. So light is considered as a symbol of auspiciousness, prosperity, and abundance. With this, I now request the dignitaries on the dais to light the lamp and formally inaugurate the 10th International Conference of LASA. Thank you, everyone. I would now request Dr. Satyavani to take over for me. Thank you.
Good morning, all. Now I request Dr. Gerald Mahesh give welcome address and give the introduction about the 10th International Conference of LASA India, Animal Models for One Health Program, and Challenges and Future Perspective.
To our distinguished guests, ladies and gentlemen, very warm welcome to you all. On behalf of LASA, NIAB, NARBR, I, Gerald Mahesh Kumar, Co-Organizing Secretary, LASACON 2022, welcome you all to the 10th International Conference of Laboratory Animal Scientists Association India on Animal Model for One Health Program, Challenges and Future Perspective, jointly organized by NIAB and NARBR. It is my pleasure to welcome our Honorable Chief Guest, Dr. O.P. Chaudhary, Joint Secretary, Animal Welfare, Chairman, CPCACA. I am also excited to welcome our special guest of honor, Padma Bhushan, Dr. Krishna M. Garu, Chairman and Managing Director of Bharat Biotech International Limited. I am delighted to welcome Joint Director, NAM, Dr. Venkateshwar. I am delighted to invite Director, NIAB, National Institute of Animal Biotechnology. I am delighted to invite Dr. NARBR, Dr. Ramachandra. It is noteworthy that this year LASA received overwhelming response from researchers and students with more than 525 registration for the LASA Conference 2022. I welcome 12 eminent international speakers and 18 expert speakers from India to share their rich scientific speech of content in this conference. I hope that LASACON 2022 will be a successful conference comprising of informative session, fruitful of discussion and exchange of scientific knowledge related to animal model on One Health program. In addition to feeding information to your mind, please take time to explore the pleasure and excitement that Hyderabad offered to your soul. Thank you.
Thank you, sir, for your introduction and welcome address. Now I would like to request guest of honor, Dr. Venkateshwar, Joint Director of NORM, to share his significant remarks on this occasion.
Yeah. Good morning, everyone. Most respected dignitaries on the dais and off the dais. It's a wonderful feeling for me to welcome you all to the campus of National Academy of Agriculture Research Management of ICR. Little unusual feeling. I am guest of honor in our own campus. So thanks to organizers for choosing this venue for this important 10th international conference. So thanks to all the committee members of the organizing committee. So here, definitely, I'm not a researcher on laboratory animals and all, but I would like to share few things as we take many examples, great examples and great case studies while teaching in our academy or in our programs. So the most important thing always I remember the onco mouse. So Harvard onco mouse. So now the mouse not only helped in carrying out the cancer research and all, it also helped us to enter into new arena in the patent regime. I think that was the first patented animal by US and also opened a new window for protection of such innovation. I think that helped us to come to a conclusion. Any new biological material brought by non-biological process is patentable. So what I mean to say, laboratory animals not only help us in bringing new innovation, they also bringing new changes in our policies and in our regimes. I think another example always we remember the glowfish, the zebra fish, which has got fluorescence, invented or developed or designed to find some pollutants in vast water bodies. But considering its fluorescent nature, then a great entrepreneur realized, so it becomes a nice ornamental fish. So now today it is available in market. I think that has become a first commercial patented animal in the market. So here a great journey from laboratory animals, Drosophila, Cinerobrites, mouse, and so many other things. And I wish this particular conference bring few more dimensions, particularly in this arena. So once again, I thank the organizers. And special thanks for bringing Dr. Krishna to our campus, because when our request, yes, please give a round of applause to Dr. Ella. We wanted him on this same podium on our foundation day, but because of his other committed assignments in Delhi, we could not have in person, but we could have only in passport size through virtual delivery. And thanks to sir, you gave address to all our employees, all our fellow beings of entire ICR system as a part of Azadi Ka Amrit Mahotsav. It was so fascinating address. I think one of the addresses I can remember and cherish for my lifetime. Really, I was looking at his mesmerizing and really wonderful. And for some time, I felt like I'm Arjun and listening to Krishna. I think many Arjuns are sitting to listen to Dr. Krishna. I think I wish a wonderful time everyone in this 10th conference. Thank you for gracing this particular beautiful campus of NARP.
Thank you, sir, for your warm welcome to your campus, NORM campus, and mentioning various research innovations and mentioning about Dr. Krishna Ella. Soon you are going to listen him his mesmerizing talk. Thank you once again for on behalf of our local organizing committee. Now we are pleased to have Dr. S.G. Ramachandra, Director, ICMR NARF, as a guest of honor with us. He is one of the pillars for this conference to conduct this in our city. We welcome to share his views on this day. Thank you.
Good morning to all of you. respected dignitaries on the dais, and dear delegates. So on behalf of Director General of ICMR New Delhi and NARBR, I wish you a warm welcome for this 10th International Conference on Animal Models for One Health Program, Challenges and Perspectives, Future Perspectives. Actually, so we are proud to be associated with LASA in co-hosting this event. LASA is actually doing a great work to disseminate the knowledge, advances in laboratory science through conferences, workshops, and journals all these years. So really, they are doing a wonderful job, and also they are creating platform to interact with scientists, laboratory personnel, and experts in the subject, and helping a lot the younger generation. So I'm really overwhelmed by the huge number of participants. I heard just now Dr. Mahesh telling that more than 500 people have registered for this conference. I think this is highest in the LASA history, I think, really. So thanks to Dr. Mahesh for his outstanding effort. And also thanks to the organizing committee for meticulously designing the scientific session with relevant topic and experts in the subject. I'm sure so we all will get benefited by the interaction with these expert speakers in the next 2 days. So I wish you all a great learning. Thank you.
Thank you, sir, to bring briefing about LASA, and thank you very much. Now I request today's guest of honor who had this conference, Dr. G. Taru Sharma, Director, NIB, Hyderabad, to share her remarks on this occasion.
Thank you very much, madam. Very good morning to one and all. Esteemed dignitaries on dais, professionals and dignitaries of the dais. When DBT and IAB and the ICMR Institute meet LASA at NARM, this happens. And the way it is happening, I think the vibrant professionals over there, and the number has already been shared by Dr. Mahesh. I don't think there's much to really be told about the successful ignition of this important international meeting. This is the best place, the academic hub of the country, Hyderabad, where this could happen. It is starting. As was discussed, that laboratory animals, and as a theme is animal models in One Health program. Yes, true. But it's not only the One Health program only. It starts from the health of child. We all grew up watching Tom and Jerry, you know. So the laboratory animals are very important since beginning. So I really wish this meeting a great success, wonderful interactions. We look forward having good deliberations. And I really appreciate official appreciations to the organizing team. Dr. Mahesh is organizing secretary, Dr. Jayant and Himanshu. Besides them, there is a very vibrant team. I personally know because when we were organizing different meetings, Dr. Hari Shankar is here, and we really, there are many, but we really thank, so this successful event which we are starting is really a very sincere professional effort of this team. Thank you very much. We look forward.
Thank you, ma'am, for your wishes. Also mentioning about animal models, importance of animals in the research. Now I would like to request Dr. Krishna Ella, Chairman, Managing Director, Bharat Biotech International, leading scientist and successful entrepreneur in the field of human vaccine, especially in the development of Covaxin, recipient of Padma Bhushan, to share his experiences to us. Thank you, sir. Welcome, sir.
First, I don't want to be treated as a businessman here. I'm a scientist. I still live as a scientist. I'm at the age of 67. I live, I breathe oxygen as my science. That's all. I believe in science. And India has to innovate. There's no choice now we have left. And I think our Honorable Joint Secretary Chaudhary Saab is here, and Taru Sharma, and all the friends, Ingle, Ramchandra, everybody, Hole, Mahesh, everybody, I think they've done a great job. And I can tell you, CPC has done an amazing job in the pandemic time. Vaccine field, without animals, we will not survive. I think the only field which requires laboratory, I was not knowing much about laboratory animal meeting and all that. This is my first meeting. I didn't know that you have laboratory people so many in the country. I was not aware of it. It's glad to know that now. And I think, the vaccine field cannot survive without animal. I'll tell you why. One, you want to show, to get into clinical trial, unless I show the efficacy in the animal model, I will not get confidence. If you show the animal model efficacy is good, your success of vaccine in the human is almost 95%. So the animal model has become very critical for the drug discovery type. And coming to the final finished product, and when you release the product, again, for testing purpose, every batch, like a rabies vaccine, when we release, we have to do the potency test in animal. That's again a critical part. So both side of it, drug discovery type and the post-approval of the product line, both are very critical stage. Animals are crucial. But I have a concern in the country. We have a Swiss albino, we have a Wistar mice or whatever it is, Wistar rat and all that. But we don't have Indian rat and Indian mice. Okay, and I think that's something now we need to think as a scientist now. Can we call I rat, I rabbit, I mouse, I guinea pig, India guinea pig? And I think, we need to think as a scientist now, not using this animal importing and doing all those things. But today, sequencing analysis is so easy. You can sequence both genomes and see where the differences are, and you can pinpoint that and make one animal model, our own rat model, our own mice model. There's nothing is impossible. We have all the expertise in this country. But what is needed, one goal to achieve. As a scientist, what we do is, we reach 9th mile, but we miss the 10th mile. The last mile is very crucial in the life, in a scientist, to achieve. That last mile we miss. So we always focus on publication point of view. But I can tell you, when you make a mice, you will also get a publication, you also get a patent, you also get a royalty. All three are coming in. And I'm telling you, as a company, we have more than 140 publications. Nothing less than Cell and Nature and Lancet and New England Journal of Medicine. Nothing less. So as a commercial company, we have more publications also. What I'm saying, as a people, as a scientist, don't think that we are doing a translational research, you will not have any publication. You will have tremendous, much more impact publication than a basic research. And I think what we need as a scientist, as a collaboration, we don't think, we as individually Indians, we are great people. But as a group, we are dangerous people. Okay, we are politicians. As a group, we are politicians. That is a major problem for us. In science, nobody is a competitor for us. For us, the competition is from other part of the world, not India, within the India. We need to partner, collaborate, and understand how we can together make a I always think simple thinking. We can make 1 or 2 success stories in the laboratory animal model. We are through as a country, because that 2 will spin off a lot of other things in the country. And that is what the vision we should have it. And I wish you all the best. I think the organizing committee member has done, has had 500 people. I didn't know that 500 people are there for laboratory animal technology. I didn't know that. I think you have a human research, clinical research, compared to clinical research, laboratory people are more now. That's great to hear that. And I wish you all the best. Thank you. Honor.
Thank you, sir. You are the inspiration to many young scientists, as you said in your beginning of your speech, and also mentioning the importance of animals in potency testing and to have collaborative studies in India. Thank you once again for your encouraging words. Now I would like to invite our chief guest today's function, Dr. O.P. Chaudhary, IFS Chairman, CPCSA, to address the participants. Welcome, sir.
Dignitaries on the dais, friends in the hall, and friends online with us. First of all, I want to thank the organizers to give me this opportunity to be with you. Uh, I also want to extend my best wishes to Laboratory Animal Scientists Association, LASA of India, National Institute of Animal Biotechnology, Hyderabad, ICMR, National Animal Resource Facility for Biomedical Research. Very important key organizations in our country. So all the best and best wishes for them. For conducting this 10th International Conference on Animal Models for One Health Program, Challenges and Future Perspectives. You know, animals are being used globally to find biological basis of diseases and development of drugs. Without animal experimentation, treatment of diabetes, polio, cardiovascular diseases, and development of anesthesia to avoid pain during any surgical procedure would not have been possible. Hence, it is very difficult to discontinue the use of animals. You know, world over, there are pressures and trends that let us replace animals with alternative means of doing research. But my friends, scientists earlier, they have spoken, it's very difficult, and that confidence doesn't come. That confidence which is required doesn't come through other ways of doing research or making life for the humanity better in the time to come. I understand that this conference would provide a platform to share the views of the research community belonging to various academic and R&D institutions, including pharmacy colleges, biomedical and veterinary institutions, and pharma industry across the country. I hope this conference will be good exposure about animal ethics, guiding principles, and regulation to students and scientists doing experiments on animals. And we, from our side, as CPC-SEA, we have tried to make things simple, to be very, very accessible to the organizations who are using laboratory animals for research. CPC-SEA recognizes science, and we believe that science in our times is the only way to come closer to the truth. There is no other way, there is no other procedure to come closer to know the truth other than science. That is the most authentic way to know the truth. So we value science, and we are very balanced in our approach, despite all kind of push and pull from other sections also, because you know, animal cruelty is also an issue, and we have to look into that, and we have to reduce that, because that makes us better human beings. Reducing pain of animals is reducing pain of humanity also, because you know, from my young days as a small child, I started understanding that where from this ability human beings developed to experience the pain of others. And later on, when I studied biology, then I understood that this is the process of reflection, that you put yourself in place of the person who is going through the pain or the animal going through the pain. Then you realize that, yes, had I been in the place of that animal, had I been in the place of that human being, I could not have allowed this to happen. So the reflection offers us that let us not hurt others, let not hurt animals. I share this with the officials of CPCA also, because I am chairman of Animal Welfare Board of India also. So that side is also pressing me from different angles. So that is a very rounded experience. I share with the friends in Animal Welfare Board of India that humanity, two kind of cruelty. One could be with the animals, another could be with the human beings. And this development in the world will always remain human-centric. So it's a balancing act in a way, that for larger human welfare, you have to pass through the smaller pain. So we at CPCSA, Animal Welfare Board of India, look at things this way, to balance things. And our officials are trying to give permissions and other related services from CPCSA at the earliest possible. And you might have realized that we have streamlined things. Now we are on the track. And we see that we are not different. We are all working together for the country. So you, me, and others, we are all same people. We are working for the country. With this, I again want to thank organizers that gave chance me to interact with you, to share my thoughts with you. Thank you very much.
Thank you, sir, to elaborate to conducting animal experimentation in a human way to other alternatives for the drug development, to follow the animal ethics, not cause much pain to the animals and humans also. Thank you once again, mentioning the importance of animals and their ethical use in the research. Thank you, sir. I request Dr. Arvind Ingle, Scientist H at PRAC, the President of LASA, to give his presidential remarks now.
Dignitaries on the dais, eminent scientists, online, offline, speakers, online, offline, and dear participants. Formally, on behalf of LASA, I welcome you to all this August gathering. I also welcome the Chairman CPCSA and Dr. Yella for gracing this occasion in spite of their busy schedule, and highlighting the importance of laboratory animal science and encouraging us to work in this field. LASA is almost 15 years old, but in these 15 years, 1.5 decades, LASA had made tremendous impact on the laboratory animal science industry. And we have been upgrading the human resources in the country to work in this era of the COVID. With our efforts, we are not only training the scientists, but the veterinarians, technicians who are working in the animal facilities, and also we are generating the interest in the students, pharmacy colleges, veterinary colleges to work towards the welfare as well as the experimentation of animals, so that the academics as well as the research can be world class. Towards our attempts, I am proud to say that we have established the Indian College of Laboratory Animal Medicine, wherein we already have 13 diplomates and 3 are registered who are likely to take the exam in by end of this year, and they will also be inducted in the diplomates. India will have sizable board certified veterinary laboratory animal veterinarians, and I request the Chairman CPCSA, like in all other developed countries, the laboratory animal medicine is taken by the board certified veterinarians. Until today, we did not have the board certified veterinarians, but now down the line 5 years, we will have sizable number. So I request the chairman to make it mandatory for the established animal facilities at least to have these board certified veterinarians recruited as a mandatory requirement. as the program is going late, I thank you again for joining this August gathering, and I request everyone to be very much participating and taking advantage of this 2-day deliberation. I'm sure at the end we will be all benefited, and ultimately the industry and the Indian population. Thank you very much.
Thank you for your presidential remarks. Now I request all the dignitaries on the dais to release the conference souvenir. Please. Give them, they'll open it. Give. Tray, she kept it there. Give it in tray. Bring them. Thank you. Now I request Dr. Pranjali to continue this program.
Thank you, Vani Madam. Respected all dignitaries on the dais, dear all my colleagues, the participating teams from different universities, and all of you gathered here for a LASA conference today. A very good morning to all of you. Now we will move towards the felicitation program. I would like to request Dr. Taru Sharma, Director NIAB, to felicitate our chief guest, Dr. O.P. Chaudhary, the Chairman of CPCSCA. This mementos will be accompanied by food basket also. Yeah. Again, I would request Dr. Taru Sharma to felicitate Dr. Krishna M. Ella, CMD of BBIL. Now I request Dr. Mahesh Kumar, scientist CCMB, to felicitate our Dr. G. Taru Sharma, Director of NIAB. I would request Dr. Mahesh Kumar to felicitate our chief guest, Dr. S. G. Ramachandra, Director NAV PR. Now I will request Dr. S.G. Ramachandra, Director, NARF PR, to felicitate Dr. Venkateshwar, Joint Director, NAM. I would request Dr. S.G. Ramachandra, sir, again, to felicitate Dr. Arvind Ingre, the President of LASA. Now I would request Dr. Arvind Ingre, sir, President of LASA, to felicitate our Organizing Secretary, Dr. Mahesh Kumar, sir. I will request Dr. I will request Dr. Arvind Ingre, sir, one more time, to felicitate Dr. Jayant Thole, Organizing Secretary for this LASA conference. He's a scientist in NIV. Thank you, all the dignitaries. Now I will hand over all these dais to Dr. N. Harishankar, sir, for the next continuation of the program.
Respected dignitaries on the dais and the respected dignitaries of the dais, my respected seniors and my colleagues and the young veterinarians and the other students, please accept Harishankar ka pyar bhara hua namaskar. Now, for the more than 4 decades, I had an opportunity to work with Dr. Suresh. And Dr. Suresh, I think our association started from 1984. At the time, he used to come to the animal house. He never allowed staff members to relax during the office hours. Whenever we used to relax, he used to say, "Oh, Babu, live. Asalina, the delicate mind. Oh, Babu, live." So that's how he used to continue. So the basic post he joined in ICMR, National Institute of Nutrition, and Anchalaga, step by step, he moved forward. And moreover, he's the one instrumental in establishing the virology lab in our institute. And he's also instrumental in establishing the microbial kit and everything from our institute. He is also instrumental in encouraged us to create the state-of-art small animal physiology lab. When he joined our Dr. Ashok, please put the chair there. So, and the second thing is Dr. Suresh. He is established the, what do you call it, the right from Laboratory Animal Information Service Center to the National Center of Laboratory Animal Sciences. From there, in a small room, he had a vision about the establishment of a National Institute for the Small Animal Sciences. And Dr. Suresh, he published several manuscripts in book chapters in international and national peer-reviewed journals. He also visited several places as a PDF, and also he has interacted with several eminent personalities. And secondly,
In our India, wherever you find a government animal facility, government institutional animal facility, you will see a stamp or a chap of Dr. Suresh in that animal facility. For that, he deserves a round of applause. And secondly, హృదయంతో చాలా మంచి మనిషి. He never hit below the belt. అలాగని చెప్పేసి he never compromises wherever the work has to be done. And he had been to Seattle to carry out his PDF work. He also interacted with the Dave Anderson in terms of the primate facility. And his vision is right from mice to monkey and equine facility under one umbrella. That was his vision and he fulfilled it. Now I request Chandu to put the first slide. So dear friends, you please see there, కాకతీయుల సామ్రాజ్యంలో పుట్టినటువంటి డాక్టర్ సురేష్ గారు, తర్వాత 400 సంవత్సరాల వయసున్న చార్మినార్ ఉండే ప్రదేశంలో పనిచేస్తున్న సురేష్ గారు, 110 acres land లో he constructed a animal facility that's called ICMR, National Animal Resource Facility for Biomedical Research, with 400 crores. That is the symbol of our Charminar. You can see there the Kakatiya Toranam and Charminar and our present Lab Animal Scientists Association logo also. I request Dr. Vivek Tyabi sir to accompany Dr. Suresh onto the dais with all your round of applause. మీ అందరికీ ఎవర్ గ్రీన్ హీరోస్ చాలా మంది తెలిసే ఉంటారు. You know that Dr. Ashok Kumar, our legendary film actor, and in English, Mackana's Gold hero, Gregory Peck, he is also known as a evergreen hero. I am very much younger to Dr. Suresh, but he looks like an evergreen hero of our lab animal science. Now I request our guest of honor, Dr. O.P. Chowdhury Saab, to honor him with a memento. And also I request Director Taru Sharma Madam to honor him with a shawl. And I also request Dr. Krishna Ella sir to honor him with a fruit bouquet. And I request all the dignitaries with blessings to Dr. P. Suresh. Thank you very much, sir. Dr. Ashok, you please put another chair there. And now I request Chandu to put the second slide, please. So recently we had a very bitter experience of corona pandemic in our country. Several people died. ఆ కరోనా మహమ్మారి విలయ తాండవం చేస్తూ కరాల నృత్యం చేస్తున్న రోజుల్లో ఎంతో మంది వృద్ధులు పెద్దలు చనిపోతున్న రోజుల్లో ఆ సమయంలో మేమున్నామంటూ డాక్టర్ కృష్ణ ఎం ఎల్లా గారు అలాగే సుచిత్ర ఎల్లా గారు తమ ఆపన్నహస్తంతో మానవాళిని కాపాడినటువంటి మన కృష్ణ ఎల్లా గారు ఇక్కడికి వచ్చినందుకు గాను సంతోషంగా మీ అందరి కరతాళ ధ్వనుల స్వాగతిస్తున్నాం. And Dr. Venkateshwar garu memento to satkaristaru. Dr. Ramachandra will honor him with a shawl. Dr. Arvind honor him with a fruit bouquet. Dr. Arvind Kumar Ingle will honor him with a fruit bouquet. So, these two legendaries, they have served the humankind like anything. And these two legends, they have helped us to develop. And they are also concerned with the animal welfare sciences, and they have taken care of the welfare of the animals also. I want all the audience to give a round of applause and a standing ovation also. Please, let us cheer them. Welcome them with a standing ovation. Thank you. Thank you very much. Whatever the science we have done, it will be exposed, it will be, it will be realized, recognized by the publications only. But, this type of honors, we will get very rarely. So, once again, I want Dr. Suresh to accept our invitation and accept the felicitation. I want him to say few words on this occasion. Please come, Dr. Suresh.
Respected members on the dais, Chairman Sir Chaudhary Sir, Padma Bhushan Dr. Krishna Sir, Dr. Ramchandra, Dr. Venkateshwar Sir, Madam Dr. Taru, Dr. Arvind and Dr. Mahesh, Jayant, Harishankar, and other organizing members of this LASA. I would like to express my sincere thanks to the organizers under the leadership of Dr. Ingle and Secretary Dr. Shetty and other members, EC members, giving me this opportunity and giving me this felicitation and award. Indeed, it's a memorable occasion for me in my life. And I consider this as an honor and recognition for my services and contributions to laboratory animal science in our country. I take this opportunity to inform the youngsters how laboratory animal science has been originated in our country. And it was how it was progressed. As you all know, old timers talk about the past only and history, and which sometimes the youngsters will be keen to know that. About the origin of laboratory animal science, I mean systematic laboratory animal science and its development in the last 65 years. How it was propagated and grew over the years. It does not mean that the laboratory animals was not there, nor the experimentation was not there. Today's improvements that you are all seeing is the hard work of many of the stalwarts in the last 65 years in our country. Formation of the college is also now, it has also been there. And so much of improvement has been there because of the efforts of the many youngsters and old people. So formation of the ICLAS was one of the first steps. ICLAS, as you all know, International Council for Laboratory Animal Sciences, was the first organization to improve the laboratory animal science in our entire globe. In 1955, the first formal action was taken in international levels when the International Union of Biological Sciences, UBS, expressed the problems existed within the scientific community, and live animals were having problems and experimental procedures also. There are so many welfare issues also. because of the time constraints, so I will reduce this one. So in the year, in this particular year, UNESCO, United Nations Education Scientific Cultural Organizations came up with a request for information on the production condition of the laboratory animals. And it was led by Council of International Organizations for the Medical Sciences, CIAMS. So CIAMS, IUBS, and UNESCO have met in Paris on 3rd, 4th in 1956 to discuss. So in this meeting, it was agreed to establish an independent non-governmental scientific organization with an aim to raise the standards of the laboratory animals on a global basis. It was in this way, under the auspices of the CIAMS and IUBS and UNESCO, that the International Committee for Laboratory Animal Science was established. The first founding ICLA Executive Committee chairman was the MICIN. And one of the decisions was to make a survey and see the conditions all over the world. So in India too, as part of that campaign, to gather the information on the production and use of the laboratory animals, UNESCO established a unit called Laboratory Animal Information Service in the year 1957. In the Indian Cancer Research Institute premises, Mumbai. Currently, it is known as ACTRIC Mumbai, where Dr. Ingle is there. Dr. V.R. Kanolkar, Director, Indian Cancer Research Center, was responsible for getting the survey, and the survey was undertaken by B.K. Batra, the scientific in charge and animal facilities, and the 3 members appointed in the unit were Mr. Hariharan, Dr. Giridharan, and Mr. Varghese. More than 130 biomedical centers in the country were surveyed in our country, and in 1 year, the exhaustive report was submitted to the UNESCO. The results indicated the conditions of the laboratory animal care, breeding, experimentation were appalling, and their survey brought out the fact that the laboratory animal science was one of the most neglected areas in many of the institutions in our country. And the data was published in the 2 bulletins. It was felt that there is a need for educating the biomedical fraternity on the proper care, breeding, and maintenance of the laboratory animals for improving the standards of animal experimentation in our country. However, UNESCO contract was over in December 1958. In this point of time, ICMR, which is one of the members of the CIAMS represented by Dr. C.G. Pandit, DG ICMR, knowing the importance of the issue, taken over LASC in 1959. LASC carried out its function from premises of Mumbai Cancer Institute under the guidance of Dr. Batra for collecting the data and various species and strains of laboratory animals. They bred in different institutions in the country, and the data was published regularly biannually. So in 1967, a 6-week training course was initiated for the lower staff of Animal House and conducted annually. In 1976, the unit grew in stature and was shifted premises of National Institute of Nutrition, Hyderabad, 1976. 2 minutes. Was made permanent. It is a history I wanted to tell you because many people may not be knowing how the laboratory was, and it was improvement was there. So made a permanent independent center under ICMR by Dr. Gopalan, then DG ICMR. It was called as Laboratory Animal Information Service Center. In 1980, a 3-month supervisory training course was initiated for graduates, postgraduates, and veterinarians with the laudable efforts of Dr. Bamji and other colleagues who took their pains and responsibility to organize this training course without any breaks. At this time, 1983, myself and Dr. Harinarayan Rao, we were appointed. And around this time, the demand for good quality animals and increasing, and new strains of rats and mice were needed for supporting of the research. And country does not have sufficiently technical trained people, and the government of India, especially DBT, took the challenge to take the task and undertaking the responsibility. And they established the national infrastructural facilities in 2 different places. One is in NIN, LASC, and the other one is CDRI Lucknow, where another dedicated legendary worker, our beloved Dr. Bharadwaj, was keen on improving the standards of the laboratory animals in the country by training people at all levels and by breeding animals under SPF conditions. Both institutions were given a mandate to fulfill the responsibility of meeting the demand. And in 1988, a new building was inaugurated by those in the same campus. In 1996, financial management convenience के लिए they merged LASC and NIFLA. Both were merged and named it as the National Center for Laboratory Animal Sciences. This center has been recognized as the reference center by ICLAS and WHO for the training and also extending the technical support. In 2002, a primate experimental facility was added. And in 2002, we acquired 100 acres of land in the Genome Valley for the expanding the activities as per Vision 2010 document. On 18th November 2015, the establishment of the new institution, NORF, was approved by the Cabinet Committee headed by our beloved Prime Minister, Shri Narendra Modi ji. And in 2016, the existing NCLS was merged with this institution, NORF. And this institution was proposed in 2nd August 2001, and it took almost 15 years for getting this one. So in between what has happened in 15 years, I'm not going to tell you, it's a big story. Thank you so much.
Now I request Dr. Jayant Hole to propose the vote of thanks.
Once again, thank you, the organizers of LASA, and thank you. It's an honor for me that Krishna sir is also there, that Chaudhary sir is there, and members. Thank you so much.
Thank you so much, sir, and thanks to all for your patience. It is a very good morning, all. Namaskar, Andarki Namaskaralu. I deem it's a great pleasure and honor to me that I am presenting this vote of thanks, very important part of this function. The story started in the year 2019 when there was a ICER Pune LASA conference. You all remember if you attended. And then we dreamed, me and Dr. Mahesh, myself, that we will be hosting the conference, next conference at Hyderabad, and the year was 2020. Dr. Suresh sir was the director at that time, and then we planned, but sir, unfortunately, Corona started. And after that, again we planned, again we postponed, and ultimately, finally, yesterday we have done very successfully the pre-conference program, and today we are almost done with the inauguration. Thanks God, thank you so much. I express my sincere thanks to Dr. O.P. Chaudhary sir, Joint Director, Animal Welfare Board, Chairman CPCSA, for accepting our invitation and for his presence in the event, along with his representatives, Dr. Kripali and Dr. Vivek Tyagi. I express my sincere thanks to Vaccine Man of the Country, sir. Thank you so much. You can see we can sit here without mask now. That much daring we can do. Thank you so much. And sir is Padma Bhushan, Shri Dr. Krishna, sir. Thank you, sir, for your presence. And we are really delighted and honored that you are here. Thank you, sir. I express my deep gratitude and thanks to my our guest of honor, Dr. Taru Sharma, madam. She has really, supported this conference. She has given a lot of liberty to me also to make this event successful. Thank you, madam. Thank you so much. I thank our next guest of honor, Dr. Ramchandra, sir. There is no introduction is needed for the Dr. Ramchandra, sir. He himself is a, inspiration to all the laboratory animal scientists. He's a man who started LASA. He is one of the founder member, and now also he's continuing. He's a director of the NARF-BR Institute. I must thank Dr. Venkateshwar, sir. Sir, you witness we have a tough time here. We, Mahesh and myself, we are crying, but with your interference, we could be able to doing and managing the things. And you see, sir, this is the crowd. Happily, we are now celebrating LASA. Thank you, sir. Thank you for all your support. Thanks a lot. I thank Dr. Arvind Ingle. He is our president LASA, and under his flagship and leadership, we are holding the flag of LASA. Thank you, sir. Thank you being here. Thanks for your support also. And then at the last, hope I have not forget anybody. Ramchandra sir, acha. My sincere thanks to Dr. Mahesh. He has taken really immense painstaking efforts. We all witnessed. It was a very tough time. You all can see, because holding a conference or any event, especially the kind of pandemic or national emergencies kind of situations, we have so many things. We have to follow the regulations. We also afraid that something goes wrong. What will happen? Who is responsible? And all these questions comes to our mind. but he has taken the daring. We have the passion. We committed, if you remember, in the year 2019, November, LASA ICER conference, that we'll host this conference at Hyderabad. After 2 years, please have a huge round of applause that now we are sitting here, we are celebrating this LASA. So many efforts, so many people they have done. Thank you, Dr. Mahesh. And your efforts will not be, wasted. It is remember for many years, because people, they will be going with the good memories. Once again, I welcome all the fraternity present here for their presence. Deep sense of thanks from my side. All the sponsors, without sponsors, national, international, it is not possible to generate the funds and arrange the venue for different arrangements. Thank you so much for all the sponsors, students, scientists, my friends, colleagues. And I shall fail in my duties if the thanks is not delivered to the administrative and the technical staff of NAM, NIAB, and the NARF-BR, auditorium arrangement team, event management team, catering team, everything, every people who are present here, I say, and myself and Dr. Mahesh, we are very much thankful to you for all your supports. Delicious food we are enjoying. Thanks to Dr. Harishankar, sir. He might be there somewhere. Thank you, sir. Thank you. Thank you. Thank you so much. Special thanks to LASACON team. Dr. Balaji must be here somewhere. He sponsored the dinner, so he has taken our 10%, 20% load. So he's taking care of the dinner, sir. And thank you, sir. Thank you so much for beautiful arrangements. Then other committee, scientific committee, our transport committee, accommodation committee, food committee, and everybody, the list is so long. If I keep taking the name of each and individual person, the whole day we have to spend on this only. So I will not take the names. Please excuse me. But all has given immense contribution. That is how we can see the success of this conference. And everybody deserves the vote of thanks. Thanks to my wife and my children, they allowed me to stay for these many days outside. Thanks to them also. They are not here, but hope they are listening to me. Thank you. And at the last, I request, even though we all are vaccinated, let us be careful, follow the COVID appropriate behavior, wear mask if it is possible, and try to sanitize the hands and wash your hands most of the times when you can see or doubt like you touch somewhere or you are in contact with some sick person. Follow COVID appropriate behavior. This is our request. And now, once again, I, along with my colleague in the organizing team, myself, Dr. Mahesh, welcome all you for this conference with the heart full of the love and lot of respect, and wishing you all for the great success and sweet memories of this conference. So enjoy your stay at the city of Hyderabad, enjoy scientific knowledge and sharing scientific knowledge. The last request, any concern, any issues are there, please come to us. We both are there in your service. Thank you so much. Thank you so much. I request all to stand your place for the national anthem. Thank you.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।
भारत माता की जय हिंद, जय हिंद, Jai Hind. Thank you so much. So now we are breaking for high tea and we'll be coming back in 10 minutes. So I request all can go to the tea complex and food complex. Sorry, there is small change. Please be seated. Please take your seats. We'll continue with one lecture and then we'll break. Yeah, then we'll break for tea. Sorry. There is change in program because we are running short of time. So please, please be seated. Thank you. Thank you so much. I request all who are staying there near the registration desk, they can come inside. Huh? Again, there is a small change. I am very sorry. This happens with the organizing and this is happening from so many days, right? So anyway, we'll go ahead. We are breaking for the teas and I request you all to gather again after 10 to 15 minutes. Thank you so much.
Krishna.
Your laptop, sir? So you want to connect your laptop?
I can do that. I also have it.
Connect your pen drive, sir. Follow me. You want to roam here and talk? Chandana? Which one? This one? Third one, no? It will be LASACON.
There is a small request and announcement. Please do not carry any water bottle inside the auditorium. You can pass on this message to the others also. Please do not carry any edible items or drinking bottles like this. Anyway, this is for the guest. But for participants, delegates who are sitting there, please do not carry anything from outside to inside. This is NARM administrative information. Right.
Oh, sir. But again, the picture needs to be changed. So no problem, you do it and bring it back. Do it now. You want to do in this? Then do it.
నాకే ఇచ్చిన లైట్ పట్టుకుని ఆడుకుంటా.
కళ్యాణ్ స్క్రీన్ పెద్దగా వచ్చిందా చూడు ఈ ల్యాప్టాప్. కళ్యాణ్ ఏమైంది కొట్టుకుంటుందా? ఏం సేమ్ అట్లానే ఉందా? అరే ఆగి ఇప్పుడు చూడు. సైడ్లు పోయినాయా? సైడ్ పోయిందా? ఫుల్ వచ్చింది. కళ్యాణ్ ఎక్స్టెండ్లు వస్తుందా? ఏది ఇప్పుడు చూడు.
I have to get dried. So you can take this one. That's nice, man. Thank you. Oh, you want it to order? Yes. These type of things. We need again. You would think? Yes, these are all our stuff. Okay. Yeah. This one. This is
सिस्टम में लासाकान बुक फोल्डर है सर, वो फोल्डर के अंदर ही मैं इधर ही रहता, मैं भी आ जाता।
so nice. Start that now. No, if you keep like that, often they take photographs. Pictures. No, they all have to exactly keep it practical photography.
మేడం ఎన్ని తీసేయాలి కదా మేడం
ఒక వాటర్ బాటిల్ పెట్టాలా సెల్ ఫోల్డర్ నాకు ఇచ్చారా
ఇది బాగుంటుంది Yeah, sure.
welcome back again. I hope you all are eager to hear Dr. Ella. So as we are going out of schedule, so I straightway request the keynote speaker, Dr. Ella, to come and please enlighten us.
I really do not know what to talk, but certainly I'll give a little stories. You look at neglected diseases. The neglected diseases are always prevalent only in Asia and Africa. Whether it's SARS, yellow fever, malaria, tuberculosis, Zika, yellow chikungunya, everything, both in the Asia and Africa. Now Americans want to help a neglected disease. It is not that they want to help us, but basically what they want is the starting point of the all pandemic, neglected disease which turned into pandemic, starts from the Asia and Africa. So if you don't control from here, then you're not going to control the world. And that's a simple story. So one of my teachers told me one thing: think science in simplest language, you will find the best solution. But if you think science in a complex manner, you will never find a solution, you will never understand also. And you will never make others to understand also. So think simple. When we started hepatitis B vaccine, we started with the technology development by Government of India help. We started manufacturing, but India was not made a single new product in the country. That's all the game was. So I looked at it, I should focus on two things as a company. One, innovation. Second, how do I work on neglected disease, which are very critical for any part of the world, where I can differentiate myself from the US and other multinational companies. Because multinational doesn't want to work on neglected disease. I looked at that strategy game, simple strategy game, and focused on that. And we worked on the rotavirus. And now in the clinical research was an absolutely basic level in this country. What they do clinical research in this country, you inject one vaccine here, another one inject another competitor, you look at the immunogenicity of 100 people. That's all that science in this country that time. When we came efficacy trial we want to do in India, that is rotavirus vaccine. Just imagine now how many ladies are here. If you are pregnant, you want to give your baby for a clinical trial. How many people will give can you lift the hand? You see, we are now scientists in laboratory animal research. We want to kill more animal, but we don't want to do clinical research. You see the perception, how simple ideas, even if you have a good product, you want to do clinical trial in a pregnant lady, 6 months lady, has to give a baby for their baby once born for a clinical research. It was the toughest challenge in the country. That helped us a government partnership. That's where they really helped the Department of Biotechnology joined. My friend Dr. M.K. Bond joined. And we built 10,000, we have screened 25,000 pregnant ladies. One of the conditions Gate Foundation put us on us, because they funded the project, I should not bribe the mother. I should not exploit the economic condition of the lady. Okay, so no financial incentives for anybody, any pregnant lady. So that was a challenging for us. I'm talking about 2001. So we said, okay, we'll give health insurance to an entire mother and a child. And for the 3 years of healthcare, entire healthcare we are taking care of it. So entire 25,000 screen, and we have recruited 10,000 pregnant ladies in Vellore, Pune, and Delhi, suburbs, Delhi slums area. We recruited no financial incentive, but we given a mobile phone that if she pressed the button and within 10 minutes, an ambulatory vehicle is there, mother and child will be taken to the hospital, major hospital, and taken care of the health. Why I'm saying this one, how a new entrepreneurship changing the game in the country, which was not existing before. It was more of a generic country. We were a generic country. Nothing was made a new vaccine. That one. So we made that, and then we made a typhoid conjugate. The many rural area, 6 months, 9 months baby, who licks the floor and who get a contaminated water, the child gets a typhoid. And then typhoid, if it's there, usually the baby gets a serious, and mother cannot go for work also. She has to stay. And that was a major problem. There was no vaccine that time. Typhoid was given a polysaccharide only about 2 years. And the efficacy of that existing vaccine was only 65%. So we should make one. So we made a typhoid conjugate first time in the world. We made a vaccine. We done all the phase 1, phase 2, phase 3, went to the Gates Foundation. We said there's no animal challenging model for typhoid. Wrote also, there's no animal challenging model. There's one of the challenging. For the vaccine field, when there is no animal challenging model, we need to work only in the human clinical trial, human efficacy trial. Typhoid also, there's no animal challenging model. We did that. Gates Foundation challenged us. You've done a clinical trial in India where antibiotic abuse is so much, so you can't differentiate between the vaccinated person protected from the vaccine or vaccinated person protected from the antibiotic. That was challenging again for us. We are the first time when India develops a vaccine, it gets into a lot of questions on the clinical trial also. So we took a challenge. The Gates Foundation funded us. We took the Oxford University. We did a human challenge studies. In the Oxford Human Challenge, we got 87% efficacy in the human challenge. How many people will drink a typhoid, oral typhoid? Bacterial, real bacteria will cause us a typhoid. How much lift can lift? So men doesn't want to lift, woman doesn't want to lift here. Nobody wants to lift, but they want a product here. You see how our mindset, we don't believe in ourselves in the science. That's a major problem with us. We don't believe in science. I think we don't believe in Indian company. We don't believe in Indian company because, oh, India may be cheating, companies might be cheating something. So I don't know whether I can take it. It comes from the multinational, oh, it must be safe. It must be good technology. The perception is very dangerous in the country. And that is challenging for us. And we challenged that. We did Oxford challenge and it got 87% efficacy. It published in Lancet. And then the question is, okay, efficacy works, but will it work in the entire villages? You vaccinate all the school children. Will it work? Then we partnered with University of Maryland, Oxford, Cambridge, all of us partnered. We did in 6-7 countries clinical trial effectiveness called effectiveness trial in Malawi, Burkina Faso, Bangladesh, Nepal, and two other countries, Ghana and India, Bombay. Okay, we did almost 3 lakhs babies, 300,000 babies in a school, not babies in the sense, school-going children, 5 years, 6 years, 7 years old children. Vaccinate 2 years, the children should not get any typhoid. We will get vaccinated one school, another school will not be vaccinated. So we've seen that how, because there's no animal challenging model. So we need to do human trial. That's what the challenging was. You know, why I'm saying this, how you have to think science differently. The perception has to be changed in the country. And then Zika, even US was not aware of it. My colleague Hegde is here, he's aware of it. And Zika, we were the first one to work on a Zika spelling and then made a vaccine candidate with filed the first global patent. Even US CDC was not aware of Zika. Ahead of the game, but ahead of the game from Indian side. The chikungunya, we were working from 2006 when Kerala incident came, we made a vaccine candidate. We went for the funding purpose and nobody wanted to fund the chikungunya. They said it's useless vaccine. Why do you want to work? We cannot fund the useless vaccines. They rejected, but we moved phase 1, phase 2 with our strategy, our game. And then came the phase 3 efficacy. Now CEPI funded $14 million. Now we're doing efficacy trial in Colombia, in Latin America, Guatemala, and Philippines, Thailand, and India. Efficacy trial. That's now the DBT and CEPI is funding the project. It's going on right now, phase 3 efficacy. Zika is now phase 1 completed. We are looking at that, what will happen next. Why I'm saying this, my initial vision of working on neglected disease and a pandemic disease is not because of COVID now. We have been working for long back. When we were working on that time, we created a BSL-3 production facility. I think we are the only, BSL-3 R&D labs are there all over the world, including CCMB, NIB, everybody has got BSL-3 lab, not the production facility. And we were the first one to create a BSL-3 production facility. That's how it came exactly, COVID came. Okay, and 2019, December 5th. And when I was in Bangalore meeting, Carnegie Mellon meeting, I told them pandemic will come one day or other. You can look at the YouTube on 5th December 2019. It was not even announced COVID. Nobody knows about COVID that time. The reason we predicted, the nature is giving a signal, whether it is Ebola, whether it is cholera and rabies, everywhere the nature is giving HIV and Nipah and all these viruses giving a signal to the world, to the nature that, hey, I'm here, I'm going to come. Sort of giving a signals. But in our policymakers and companies, researcher, we neglect, oh, it's just comes, it doesn't go. Don't worry about it, it will go away. That's how we ignore. And that's how the COVID came. Then what we did is we need to work strategically because we need animals, and particularly large animal. As I said in the beginning, if I get a good efficacy in animal, that gives me 85%, 90% success in the human trial. That COVID came in, we partnered with ICMR and National Institute of Virology, thanks to Bria Abraham, Balram Bhargav in ICMR, and Pragna Yadav, who is a scientist, animal challenging studies in this thing. Then they had to go and catch the monkeys in forest. And then you have NGOs here. And people who are, doesn't like NIV, they write a letter. And you know, the letter goes to level, when we want publishing in Nature, it gone to Nature for publication. Our here, the animal challenge studies of monkeys, you know, people wrote to the Nature, to the Nature, not to publish the paper. They have not followed some ethical guidelines like that, all sort of, you know, fabricated stories. And it created doubt in people's mind and belittle the Indian science. Just bring down the prestige and image for the country. That's all they've done. So our own people, so we don't talk about outside, we are our own people. They've done that. But you know, we went battle and then it came in publication in the Nature on monkey challenge studies. And then we've done hamster challenge studies in again. She did monkey hamster. We got 100% protection with the COVID, our Covaxin with the dose. With even 3 microgram gave a 100% protection. 6 microgram also gave 100% protection. There was a debate for us whether we choose 3 microgram or 6 microgram. Then we said the human population is varied in the country. Population ages are different. So let's look at a 6 microgram as a safe bet and let's move it. And then we've done a phase 1 and phase 2 and then phase 3. And I'm happy to say that we've done 26,000 people trial. This is the third, it's probably second largest clinical trial in the world. Next to in the US, Pfizer, Moderna. Next is ours. Ours was the largest clinical phase 3 efficacy trial. The fourth was Oxford, which has done 5,000 to 8,000 people. Efficacy trial, both in South Africa and UK. So we are the largest clinical trial. And you have seen so many controversy in the country. And that is because some of the foundation from other part of the world fund the journalists in this country to write against Indian science, to belittle the science. There are people bought out in a way. And how do you defame? This is where the geopolitics plays. So how do you put the down India down? We got into bigger issues in some other countries where the fight was intensive at other part of the world. So not only doing science, but when you're at a global level, you're doing geopolitics, is a very dangerous thing. And our own people are being purchased by some of the foundations, some of the people, and then right against questioning this. You know, one person died in Bhopal incident, one of the places in Bhopal clinical trial. Somebody said we killed them. And the person, he did illicit liquor and he died. Not because of us. And you know, they asked us to open the trial. We said, according to GCP, we can't open the trial because we don't have control. It has to be a principal investigator who is doing the trial center. Has to be done that. So the trial center finally not agreed for that. We finished the trial and then we opened that and turned out to be the person who died was a placebo. I mean, nobody wants, no vaccine company wants to have hurt somebody's individual. Nobody. Nobody would like to hurt. Okay, and actually, this Covaxin, I'm the first one to take a vaccine in the company, and not my other people. First one I have to take in my vaccine. When I given rotavirus vaccine, my grandchild was the first one to take the vaccine, rotavirus vaccine. My grandchild. So I think what is important is the Covaxin has proven 2 things. We have more than 23 publications. I'm telling honestly, India doesn't recognize the science very well, and the company does the science, still not recognized. The company thinks, oh, they're making money. It is not the money making. It's a passion of doing a science in a way, the cleaning. And we have 5 Lancet publications from Covaxin, 2 Nature publications, and 5 are iScience and some other journals. Okay, almost 23 publications with a partnership with, some of them are partnership with NIV, some of them are our own. Or the clinical trial, all the 5 Lancet publications is our own trial publications. So why I'm saying this, industry can do a good science, good research, clinical research. And as I said in the beginning, the drug discovery needs first animals. Particular vaccine, if you can show the efficacy model right in the beginning, it gets a lot of confidence for us to go for the human clinical trial. And you're sure of hitting a human trial unless some adverse reaction happens due to some other adjuvant. And also, we put from NIH, we licensed one of the adjuvant, TLR78. The reason we licensed it, very simple. I looked at simple angle. Child gets a 3 dose of vaccine, injectable polio vaccine, which is inactivated vaccine. And 3 dose of inactivated vaccine gives lifetime immunity. Yes or no? Lifetime immunity. You don't give a vaccine polio, injectable polio every 6 years or 3 years. One time life immunity. That means you are getting a cell-mediated response. Memory is created. I said, if you are doing inactivated vaccine like Covaxin, we need some TLR 7 or 8, an adjuvant, which can stimulate the more of a T cell response, which are lifetime, long-term immunity. That was a strategy we put in right in the beginning. Okay, and I took the risk. I said, if somebody, so a lot of people questioned me, what happens to the, somebody pregnant lady gets it, she will abort, what will happen to you? I said, I'll die myself. Don't worry about it. Let me take a risk. So we have taken a risk, and TLR 7-8 has really helped us to putting a long-term immunity. So what you need, people, in this Hyderabad, some of the VIPs, they take our vaccine. They go and test in the diagnostic lab how much IgG I have. Okay, every VIPs, they go and test by night and then ask tomorrow morning, midnight, 12 o'clock, they call me. I have IgG only this much. What do I protect? Okay, I told them IgG is not an important. We are looking at the more of other TLR, TH1 responses. That is important. Okay, not the IgG. When I said that in the beginning, even my policymaker in the country also not believed me. Now you see mRNA vaccine, you get immune response, high immune response with IgG, and then drops in 25 days. Zoom, it goes up, boom, down. And that's why you're getting a reinfection again. So what I predicted, what I hypothesized in the beginning was turned out to be true. Now, the mRNA vaccine also makes the liquid nitrogen particle, now it's going to come out publication soon. The liquid lipid particle are reaching various organs. Why it is going to different organs, nobody knows, science. But it's a good platform, new platform technology, a wonderful platform put in the game. And you look at only 3 platforms has been put in the marketplace. One is the mRNA platform, second is vector-based vaccine, and third is the inactivated vaccine. Okay, and I think it's the bigger game in the STEM. And I think India, if suppose India didn't have a vaccine, then you imagine how much we have to import. And what would have been the cost? Not less than at least $35, $40 per dose. Okay, you're talking about $100 per 2 doses, with including cold chain calculation. Okay, so it would have been a disaster. Today, I think, the COVID software, I'm really happy to say that. Today, the COVID software has been put in by Government of India. It's a phenomenal software. I'll tell you why. 100 crores, that means, the 100 crores population database is in the COVID software. Who has taken the vaccine, their Aadhaar card, their mobile number, everything is there. I was even telling the Government of India how to use that for future pandemic point of view. Now, suddenly in Guntur, some disease appears, and you can track back who are all taking the vaccine and their mobile number, and track back, trace back, and then identify the person and who has got the infection, and from that person pinpoint, and from there how the disease will progress. You can even predict that more. But I think India has done the COVID software is going to revolutionize in the future next 5 years, and the database is going to big data is going to be phenomenal for the country. And I think what laid the foundation for digitalization of this sort of COVID software, I don't think any country has done it in the world, including US has not done COVID software. And I think thanks to our policymaker, one of the IAS officers, Sharma, and all they've done that COVID, those sort of leadership really going to have an impact on the long term for the country. And I think, we also done NTS for Africa. How do we help Africa? When Thabo Mbeki, South African president, came to our plant, he said, you Indian company want to exploit African market all the time. You don't want to help Africa. You want to exploit you want only market, not help the African continent. That hit my mind when he came to our plant. So I said, okay, let's do something. So we looked at it, what is the major problem in Africa? So we looked at one of the non-typhoidal salmonella. That means poultry typhoid is going to the humans. And that's a severe disaster in Africa. They said the major problem for them is the NTS, non-typhoidal salmonella, poultry typhoid going to the human, and people who got less immune response, they almost die. So when the US has said that this is one of the important, CDC has said this is one of the major problems, and also they're also concerned the meat that is going from India, US, Africa to India, or any poultry going to US also will carry the multi-drug resistant salmonella also. That was another concern. I said, how do you tackle this? So we said we partnered with University of Maryland and we made a 9-terpidal conjugate vaccine, 3-valent vaccine. We made a conjugated vaccine here in India, in Hyderabad. And Wellcome Trust, grateful to Wellcome Trust, they funded the project. We did IND approved by US FDA. And we done phase 1 trial in Baltimore and phase 1. And this is the first vaccine going from the developing world in US for phase 1 trial. Nobody has done so far. No Indian vaccine has gone to US at all. Okay. So I think this is the first one done, the phase 1 done in Baltimore. Now the data was extremely good. So now the Wellcome Trust and Gate Foundation joining and funding us now to African trial, phase 2 and phase 3. So what I'm saying is, you don't go behind money. If you go behind money, money will not come to you. Trust me, many startups are here, many young generation is there. You go behind money, you will never get money. You solve a society problem, you will get automatically money. Anything, a pinpoint, a small issue, what your society facing, take that issue and solve that issue, that becomes a startup, that becomes a business, that becomes a revenue. And think simple, okay? My suggestion always, one thing I'm telling honestly, the government is different today. Honestly, I'm telling you, it's not that because Dr. Chaudhary Saab is here, I'm telling you. Today, government is different. Government is working more efficiently than the private industry. I can write a book about the private industry, the corruption in the purchase department also, in the private companies, okay? There's so much corruption in the private companies, at a top level, at the middle level, at the junior level, at the purchase departments also, okay? So I think, if you compare that, I think government is more efficient today. I think it's a change scenario of the country, okay? And I think, I think we should be lucky. I was telling one of my friends right now, I wish I am now 25, 27 years old, that I can start my PhD program now, because biology revolution is starting now. Biology revolution is just starting. The chemistry is gone. Now it's over. Now the biology revolution is starting. I met just last week one girl in Chicago. So she said, what are you doing? I start up a company. 25, 26 years old. What is your qualification? She said, I'm a chemical engineer. I said, what are you doing? I'm going to make a palm oil in a fermenter by using synthetic biology. So where are we in science? That means she says, if I make a 200,000 liters fermenter, I make palm oil, it becomes more cost effective, not to be imported. And also I can use it in all cosmetic industry because no mixture of anything. So pure. I mean, so the young kids are thinking very differently today. And I wish now I'm back, any vaccine can go back to my age to 25. I love to do my PhD again and get back. And I think science, life science is giving a lot of opportunity for you people. Don't go BIRAC grant for the sake of unemployment purpose. Don't go for grant. That will spoil your career. I've seen some of them just putting a grant purpose to get a money for this unemployment point of view. But don't do that. If you do that, you'll ruin your life for the future. You be passionate about what you want to do. Whatever you want to do passionate. Don't think about money. Automatically money will come. I think India is a different level today. And I'm in not only in the human vaccine, I'm in the animal vaccine. We have recently even, actually BSL-3 production facility, when Chaudhary Saab is here and Madam Sharma Madam is also there. We are the only country having we have 2 BSL-3 production facility in Hyderabad, 3 BSL-3 plus AG. That means almost like BSL-4 production facility in Bangalore. And we recently acquired MSD Animal Healthcare in Pune. That has got this thing, and has got 2 large animal and small animal challenging facility in Pune. 3 animal viruses can be challenged simultaneously in Pune. And 2 animal virus strains can be challenged in Bangalore BSL-3 animal challenging facilities. And now we are working with IVRA. The IVRA wants help from us, and their vaccine strain sent to us now in Bangalore, and DBT funded the project. We are doing the efficacy trial in the large animals in Bangalore. What I'm saying is, it's not to make a duplication of a lot of facilities. It's a waste of, see, I'm telling you, many facilities I've seen created and not able to manage it also after some time. You're not even having a fund allocation even for maintaining the electricity bill. It's not worth it. Creating is easy, but maintenance is very tough. I think the guidelines are also changing. The best is a partnering. It's a now academic, as our Chaudhary Saab has said very clearly, all of us are working for the country. That should be met in the mind, in both in academic people and industry mind. We are not working for money. Academics should not think that I am working for themselves. All of us should work for the country and society at large. If we do that, and we'll all succeed as a country. And I want India to be innovative, not copying the drugs. Thank you very much.
Thank you, sir. Thank you for the igniting speech and highlighting the importance of science and that to Indian science and that to the perception about the life-saving drug of Indians, about Indian drugs. You have touched very nicely about the Zika path-breaking stories and the neglected diseases in India and the licensing about the vaccine story. You are also concerned about the African diseases which are prevailing in the African continent. And finally, about the story of struggle for your contribution to COVID vaccine, Covaxin. I understood from you, you are about the PhD in the agriculture science, but your knowledge about this science is very remarkable and it is very different from us. And that is what the entrepreneurship is about. And you also think about the partnership. And with this, Dr. Ella deserve a big applause from us. Thank you. And I hand over the stage to the organizer. Thank you.
Good morning, everyone. So we'll be starting now with the first session of the day. The topic is animal models for research on One Health. To chair the session, I invite Dr. Suresh Majumdar, Distinguished Professor, NIIB, Hyderabad. As co-chair, I invite Dr. Nagarajan, NII, New Delhi. The first presentation will be crucial role of laboratory animal models in stem cell research and regenerative medicine by Dr. G. Taru Sharma, Director, National Institute of Animal Biotechnology, Hyderabad. I invite Dr. G. Taru Sharma onto the stage.
Thank you. "25 minutes. I'll respect the time. So do I move on, actually? Where I have to point?
So if those big lights come, not be clear. Reduce the light, no problem. Everybody can focus on the slides here.
So thank you, Mr. Chairman. And thank you, Mr. Chairman. And at the outset, I really thank the scientific committee of this LASA meeting, having given me chance to share the work which I have done. And when I was thinking, what exactly should I? So when I was thinking, what exactly should I present in this conference, actually most of the work, rather more than 90% of the work, before it goes to the host animal, it was all done in the small animals itself. So I decided to put it this way, that how crucial are these lab, be it rodents, rabbits or whatever, for us. And since of late our laboratory where I was working was focusing on stem cell biology, so I thought I'll share a data one work and give you a small preamble what all the laboratory was doing. So the work which I'm going to present over here was done at IVRI. I came to an IAB a little more than 5 months ago. So the data is all shared from the lab of IVRI. As I said, lot we were doing with the small animals. When we were doing ART, IVF and making embryonic stem cells, buffalo origin embryonic stem cells. So pluripotent embryonic stem cells we are working. And the time came when we had to tell that these are embryonic stem cells, pluripotent. So we had to prove it besides the in vivo model. We had to, besides the in vitro model, we had to prove it in a skid mice whether these cells are able to generate teratomas. And this is a picture wherein once you give the clones you generate from the blastocyst or morula and give it to animals. So do they make the tumor? And the small animals we worked. When, like so much on IVF ARTs, before it goes to the animal, we were doing it with buffalo and goats both. And when we switched on to the stem cell biology, so right from treating the simple wound healing, it's not that simple as we think, or using it before using it to the as an adjunct therapy in the OPD clinical cases at IVRI, or be it evaluating either bone fracture or nerve repair or ligament rupture. Animals, we use different animals, hamster model, guinea pig, rabbits. Rabbits we use specially for the radius bone repair, because the other animal, lab animals, it becomes very small and data generation and observation was a limitation. And not only this, a student who was working at NRC Camel, when we had to do the work on the basic physiological details of camel milk, then we had to generate a diabetic rat model, again, small animal research. Also, people who do the in vivo tracking work, we know it usually takes rat, mice, guinea pig, and hamster. So anything and everything to do with small animals, and so we were doing. Also, when you think of generating different scaffolds, rabbits, as I said, this was a work which we took up with the titanium scaffolds for radius repair, rabbit model we used. So today what I will share a detailed study wherein we used guinea pigs, and we used both cells as well as its secretome. And we did the work wherein we generated a mesh membrane. The same work I'll share in detail. Before I go for that, just to keep audiences with me, why exactly should really we be focusing? What the veterinary sector wants is that for tissue modeling, also for early embryonic development, besides drug and immunity screening, endangered species conservation, or pharmaceutical. People really want to do away with the animals and want to have a cells and stem cells. A lot of things one can think of doing. However, this talk shall focus on cell-based therapies and using a small animals. The laboratory, while working, did put a couple of reviews at place for an understanding how exactly it goes. So that's a work. We really wanted to generate a mesh material which is having the stem cells into it, and also its secretome. Well, this is all what stem cells do. They are immune compromised cells, and they help in tissue repair with a couple of ways. They themselves secrete all the growth factors. They also allow and pinch the niche area cells to go get differentiated and correct the clinical condition. And they also, in turn, they also make the niche cells to secrete all the mitogens. A paper came which really elaborated a lot that why exactly these cells will be good. I mean, all the learned group sitting out here, scar formation is a very big issue, not only in large animals, but small animals. And why is this good to use, and how it gives you scarless or minimum scar repair. So with this, we got a lot of insights. Well, I will not read this wound healing. we all understand. So the important phases are the blood coagulation, inflammation, proliferation, and then eventually the remodeling. And what exactly do? They can migrate to the site of an injury. There is a chemotactic response which modulates all the three things. And they also play an important role when they do repair all the three phases. And they would definitely retain a very high degree of flexibility. And as I already said, they would ignite the progenitor cells as well. Then there were a lot of references which came wherein surgical mesh was being used, plain or coated with stem cells. Couple of references out here. And that time we were working with biological membranes. So we were using the biological membrane, decellularizing them, and again recellularizing using adult stem cells. And when the mesh idea came, then before I really moved with the mesh, another paper of 2013 in Cell Biology International, which really highlighted what all the secretome of these stem cells is rich in. And a list is long. We really, when we think of the cells or the secretome, we really need all this group of factors which are self-explanatory in the slides, which are required, and angiogenesis remain an important thing. So it gives a whole bunch of things. Experiment we planned in mouse model, diabetic mouse model using the secretome. And later, much later, this was just in 2018 we started, 2020 we published a detailed work, of course, with a quality wound healing only. Using the mesh material. Precisely, this is the one, we used canine origin cells and guinea pig origin because we wanted the allogenic cells also, because our experimental model here was guinea pig, and we really wanted to generate SOPs for canine origin cells. So we have had both cells, and then we had to generate mesh enriched with these cells as well as lyophilized conditioned media of these cells. And then we thought that anything, if we do not put in our containers, liquid nitrogen containers, it's very difficult when the patients, owner bring the patients, they don't have so much of time to wait. So we wanted to generate the cryopreservation SOPs also for it. And then we did a in vitro, in vivo assays for fresh as well as for frozen thawed. And after that, we did animal experimentation, as I said, using guinea pigs. So this is all what exactly it is. Marrow origin cells, we do with many cells. Here I'm only focusing on the marrow origin cell for this work. And you really need to go for the isolation, do all the basic part and generate the cells. In our laboratory back there at IVRI, we were using cells from PESACH 3 onwards. The reason being, it would have a contamination of hematopoietic stem cells as well. So we didn't want to have it. So anything which I'm showing by default, PESACH 3 onward cells. Did a trilineage differentiation for both the cell types to say that, yes, they are the ones which you can go ahead. And then what we did is, since we had to ensure that they are CD34 negative cells, so all the times when we were, whether we were generating the ICCs or Westerns, we always ensured, or I think I have the facts data also here, we always ensured that the CD34, it's a negative marker for our cells. MSCs we were using. So HSC marker should be negative for this. And the conditioned media, as I said, the secretome, which we obtained from it, for that, whatever the paper said, you had to have your own data from canine as well as from guinea pig, which says that you have all the factors into it. Actually, there are many factors. I just got a couple of pictures of the data which we have showing that what all it is there. So once you show the protein there in the cells, your task is simpler. Besides we generated ELISAs also, we developed the Westerns also. So what we did, having known all these things, the conditioned media which was with us, how do you use it? Liquid can really not be used. So one has to go and lyophilize it. So we developed all the lyophilization, measured protein into it, how much each milligram has, and so on and so forth. Then we picked up a mesh of our interest, but this was a very difficult task because this mesh, when we procured it are commercially available. So whenever we'll put it in culture, it won't work, it'll turn. So then we have devised another strategy. We took some glass beads, sterile glass beads we used for it, decorate them with sterile beads before you put them in culture, and you then go for putting your MSC culture into it. Before that, we also found if you coat it with poly-L-lysine, then it does better. So all through we have been doing it. These are the pictures, how your mesh appears when it is having nothing. And this is how when you're seeding, they simply float. And day 4th onwards, day 4 for MSC is a very good time. So day 4 onwards, you start getting the typical fibroblastic character, but this is not sufficient. You have to understand for yourself, because you're going to place the mesh on that clinical situation. It could be wound, or it could be nerve repair or ligament injury, whatever it is. Here it was wound. So what we did is we used acutase, not trypsin. Acutase, trypsin becomes very harsh. We used acutase and we filtered out the cells and we counted how many cells are there in that particular size of mesh. And that gave us an insight. If you're using this bigger piece, how many cells it will house in it. After that, we also went and generated the cryopreservation protocol, which were earlier there at place in the laboratory, which we were doing for cells, for different adult cells, embryonic cells, as well as the fetal cells. Now we wanted to do a complete cryopreservation of the mesh, which is augmented with the cells. So we use the same protocol, and after we have done the thawing, we did all the growth kinetics, characterization, homing properties. Otherwise, you will not be able to understand how different are they from the fresh cells. So this is a picture. It is very simple trypal blue exclusion test for that. And what we found that we have had more than 60% viable cells with this. So accordingly, we calculated, and that was a piece, that was the size of our mesh which we used as per the cells. This is a picture just to show like what all we got the picture, not much different. They were doing very well, post-thaw as well, both canine and guinea pig data I'm sharing simultaneously here. After this in vitro work, we also wanted to do the tracking of the cells. So are they really doing good as the fresh cells? So we generated these transfected cells, went for the luciferase assay in vitro first, and then used this small animal model, track the cells every 6-hour interval first. Then actually we wanted to do it for 12 hours, but it was very essential and crucial for us that we know from 0 to 6 hours what's happening. So we did that. I think I should talk little about here. Once we understood that the cells are moving the way we wanted them to move at the site of the injury, after that, we have designed an experimental model of a wound healing, same guinea pig model, and our laboratory protocols were all at place. So we just replicated those protocols. The only difference was here it was mesh material. My clinical colleague, surgeon, Dr. Amarpal and his team, for all the clinical work, they would take care. So this was also at place in our laboratory. This is a kind of a group to share so that I can keep you with me. So what all we did, we have had all these controls with us. I think I did something wrong here. No, okay, thank you. So we just kept a mesh, and we also kept a laminin, because laminin is the one, it's a gelation material into which we will mix our lyophilized conditioned media and when we coat. And we also we did in both fresh as well as frozen thawed. Also, I like to bring to your notice all the cells which we used. We did all the screening for important pathogens, especially Mycoplasma, CDV, and adenoviruses. This was the evaluation protocol as we were doing for others, the same laboratory protocol. And biopsy we would take, it's a 28 days SOP is fixed. Take them and fix them and do the histopathological examination. Just one picture I'm sharing here because it's too huge a data, but this graph should be good enough for us to understand. What it gave us a clue that post-thaw and fresh, not much of a difference. That was a good thing for us. And conditioned media laminin was not doing as good as cells. But I like, this is a very important and a right group where I say, till date, country does not have any stem cell guidelines. Dr. Mohan Wani is right here. Hello, Dr. Wani. We really struggle for this. Last more 1 decade or so, we are struggling. And we hope CPCSA people are right here. And most important person who sit for these guidelines, Dr. Subir is here. We have put a request. The moment it comes, we may not do more work using other things. But as you say, it's a blessing in disguise since the guidelines were not there. So we got the sickle tome for us to do the therapeutic work. So when a lot of histopathological data was generated, and what the picture I have shared and showed is not different here. In a nutshell, the point I'm trying to make, one can really take these frozen thawed mesh material augmented with adult stem cells, as well as if it is not to go to any outsider for commercialization, one can think of doing it with a conditioned media. This is what is my conclusion. One paper, a part of piece we published because a student, Mukesh, he is now at BHU Veterinary College, and he's now assistant professor, but he has to publish some data. So we very strategically published one paper out of it, and rest of all we have put it, filed a patent out of it. Some related work we were earlier also doing with the using different gelation material. Here we were not doing only for the wound repair. Here we were doing for ligament rupture and nerve injury work. Same model, but no mesh, but cells as well as conditioned media. So this is, it is a big team. So people who were working with embryonics, because making IVF buffalo embryo in itself is a task, and adult stem cell marrow origin work, this we were collaborating with the surgery from the referral veterinary polyclinic of IVRI, and all the clinical work and all the OPD patients, our clinical colleagues were taking care. But all the cell business was done here in the stem cell laboratory which is housed at physiology division. And that time when I was doing a tracking, now IVRI has an imager, I was using the facility of Dr. Rath at CDRI. So I would really like to acknowledge him. Now the fax is there in the lab. That time we were using in biochemistry, and all the funding. The DBT gave a lot of funding. UPCAR gave a funding especially for the secretome origin work. And later ICR gave a big flagship program to address this clinical repair in different OPD cases. And without that, because a lot of antibodies, lot of work which we just have to do it, we had to do. So I really thank all of them. And from NIAB's side as well, I thank these audiences, because we have started some work here, and we are planning, we already shook hand with the Telangana Veterinary University here besides others. So we look forward to move on. And at NIAB, the best part is that the scaffolding which we were doing there we were only using electrospin for a generation of different, you're saying something, Jayant? So here at NIAB, there is a very strong group which can do 3D printing for various scaffold generation. We have already printed a very big scaffold. Ultimately, why are we doing all this? Everyone sitting over here understand that long bone fracture in large animal is a very big concern for all of us. So the small work which is getting out using these small animals and getting translated, we were doing mainly with the canine, and lot of adjunct therapies using a caprine model, and especially the canines when, or even the goats, when they jump the barbed wires, there's a big patch, and simply, shifting the skin patch from one place to another was not doing as good, and started doing better when we started infusing laminin gel mixed with our cells. There was a magical difference of more than 20-22 days, which is a very good time for any farmer if it is having that problem with the animal. So scaffolding, we plan at NIAB to take this work ahead. Different nano scaffolds, different nanofibers, and also we are just planning, we haven't yet started doing it. Quantum based tracking also is being discussed and planned with the scientists here, and 3D printing, as I said. So with that, I thank one and all and thank the chair.
Thank you, madam. And it was a very interesting presentation of the canine stem cells from the bone marrow region and how it would help in wound healing. And we all know that polylysin and laminin as basement membrane, matrix membrane component, but she has used it wonderfully to increase the efficiency. If anyone has any question, raise the hand. Dr. Pandey.
Yeah, Dr. Amit, thank you very much.
Hello.
Very species specific. Do you see antibodies against interspecies cell? So in my opinion, cell-free with some kind of, what you said, secretome won't that be a better choice?
Yeah, I think it's a very good and important question, but I'll answer your first thing that we used, that's why I showed you that we used canine cells also in guinea pig model, and we have battery of such experiments, no antibody formation. That's one thing. So it's a, it's only the expression of MHC class 1, class 2 molecules over there. And that's a immunophysiological studies. We have one that separate data over there. But yes, what you say, anytime secretome, it's otherwise a trash, but it's such a rich cocktail. So one should really go for, that's why I said it's when you are not having guidelines, so you look for other ways and that's how you have it. However, in my opinion, giving the cells would have its own advantage. What I was showing in one cartoon, if you give secretome, it will be only secretome based things which will help. But if you give cells, you'll have 2 to 3 advantages. These cells getting differentiated of their own and secreting, and they are pinching the niche cells. So they also do their physiological job. So it's a double advantage. So I'll say that yes, giving secretome is fair enough, but ultimately if you give the cell rich mesh, surely that would always be better. Yes, please. You were raising hand.
Yeah.
No, that we have not done. We have not done. Of course, for antibody detection, as he said, that, but we have not designed any such experiment of that because it was simple. No rejection was happening. Animal was doing good. And sometimes we were using, you need to have a CPCSA, IAEC clearance for all our experiments. And when we take it to canine, the CPCSA will give you only for 5 dogs or 7 dogs like that, which is good. Okay, fair enough. But here, the animal numbers, whatever we were getting, we were only doing the clinical trials. We have not done that detailed data with us.
Thank you.
But I think if one does it, it will be good.
Thank you, madam. Thank you very much. And if anybody else has any question, they can interact with madam during lunchtime. And we thank on the behalf of organizers for giving a wonderful presentation. Thank you so much.
Thank you.
So I will invite the next person. And हाँ आपने चश्मा पहन रखा है, please you go ahead.
Madam, just
हम दोनों को तकलीफ हो रही है, दिख नहीं रहा कुछ.
I request Dr. Subir sir to present memento to Madam, please. For the next presentation, the topic is animal models to evaluate the neutralization by broad-based antiviral antibodies. Dr. Shravan Sherawat, Associate Professor, Department of Biological Sciences, ISER Mohali.
You will have 20 minutes to speak.
Okay.
As the new thing from the organizers, because we are running very late. And I think whoever is running the show, they should put 18 minutes here so that he finishes by 18 minutes, keeps 2 minutes for interaction, etc. है ना 18 मिनट रखना शुरू करते वक्त when he start हिंदी समझता है ना नहीं कभी कभी मैं यहाँ के लोगों को बोलता हूँ वो हाँ बोल देते हैं बाद में पता लगा समझा नहीं 18 minutes yes when he starts and then he will have a warning to stop in a minute. Thank you.
Okay, thank you for the opportunity to speak here. So what I'm going to talk about is these antibodies that we generated using the phase display technology, and we tested their neutralizing potential ex vivo as well as in animal models, right? So that's the crux of the matter. As is always the case, I tend to rush towards the end. So it's very important to acknowledge people who actually did the work in the very beginning. So these are basically all my lab members. The data that I'm going to show here is predominantly done by Sudhakar, Surbhi, and Yuviana. Okay. All other students, either they have left the lab and joined postdoc in US or Europe. And some of these students who did MS with me, so they are doing PhD abroad. Okay. Obviously, the data that involves working with animals. So I have to acknowledge the facility, the small animal facility run by Chandrasekhar, very nicely, very meticulously. We don't have to worry about anything about the quality of animals that we use, right? Am I audible back there? Yes? Okay. We also do have actually multiple collaborators, both from within India, from Delhi University, Dr. Rajiv, Professor YP Khasa from University of Delhi South Campus, and also from abroad, from US, Dr. Joginder Tushir from University of California, Davis, Dr. Stephanie Dugan from Harvard Medical School, and Professor Karthik Chandran and Rohit from Albert Einstein College of Medicine, New York. And none of these things can be done if you don't have funding. And obviously the funding is provided by intramural source through ICER, Ministry of Education through STAR project, through PBT, and DST. DST actually has recently funded us the Center for Antibody Engineering. Okay. We have actually named this center as CIVET, Center for Immunodiagnostics and Immunotherapeutics Engineering Technologies. Okay. I have to rush through many of these slides for the sake of that I don't have much time. So very briefly, I'll talk about what we did, some background and the data that we have generated. So essentially, if you talk about the immune system, so you have three lines of defenses, first, second, and third. First is mechanical chemical barrier, then innate, and then adaptive. Most of the immunologists these is actually focused on this third line of defense, where you generate these antibodies through B cells or the activation of T cells, right? If you talk about T cells, so these T cells come in two different flavors, predominantly CD4 and CD8 T cells, depending on what molecules they express on their surface. Apart from that, they have this antigen-specific receptor on their surface, which actually is stimulated through these peptides coming from these antigens. And these cells get activated, they release a lot of these cytokines and effector molecules, and eventually you get the killing of your infected cells. And with the demise of these infected cells, you clear infection, right? On the other hand, so if you talk about antibodies, so they don't have to recognize these peptides. So they actually can recognize the antigen whole as a whole. And through a complicated process of activation, so they start making these antibodies by converting into plasma cells. You make these antibodies, and these antibodies work in extracellular spaces much more efficiently, and they try to neutralize different infectious agents, as I said, in extracellular spaces. Okay, the antibody molecules, so we all know, so basically it consists of these two heavy chains and two light chains, and the antigen binding portion actually is focused at the tip of the Y-shaped structure. And for many of the practical applications, you have to make these shorter version of these antibodies that can be done by proteolytic precision or genetic engineering approaches. But many a times, these products that you generate from conventional antibodies are not very stable, not soluble. Much more needed impetus to the field of antibody engineering actually came from the discovery of these so-called heavy chain only antibodies, which do not have light chain in the structure, right? And because they don't have light chain in the structure, so the antigen binding actually fraction is only a single domain, okay? Now, once you generate the single domain through different approaches, and the approach that I'm going to talk about is phase display approach. So you can label these antibodies as single domain antibodies, VHH, or nanobodies. So then you can modify them in whatever the way you want to make it bivalent, bispecific, multispecific. You can conjugate with drugs. You can actually use them as detector antibodies, right? The approach actually is very simple. So you actually try to display these antibodies as a fusion product with one of the coat protein of these M13 bacteriophages. You generate these libraries with a lot of these antibodies displayed on the surface. And once you have the library, So then you actually have to come up with the antigen of your choice. You immobilize this antigen on the surface of these plates. You probe your library against this antigen, and through iteration of 3 or 4 rounds of biopanning, so you select specific antibodies, right? Once you select these antibodies, so then you can basically put them into a bacterial expression system, and you actually make these protein products. You characterize the specificity, biophysical characterization, biological activity of these antibodies. The antigen that we focused on, obviously, SARS coronavirus 2. We selected 2 of those antibodies. One of them actually was binding to the cleavage site, and another was from a peptide which actually is present in the receptor binding domain. So you know that this receptor binding domain interacts with ACE2 and facilitates the internalization of this virus. And the idea is if you actually have an antibody which binds to receptor binding domain, so it is going to actually inhibit this interaction, and virus infectivity is going to be reduced, right? We also actually generated these antibodies against dengue virus envelope protein, again, to achieve the neutralization. If time permits, I'll show some data, otherwise I'll skip that part. Okay, so this is against, pardon me, because this is actually heavily data studied slide. I'll just walk you through these slides saying that for these 2 peptides, we generated the single domain antibodies. One was against the cleavage site, and cleavage site actually come into fashion when people were talking about whether the virus actually is natural or it's a lab-made virus, right? So what we thought was, let's generate an antibody against this cleavage site and see whether or not it's able to block the infectivity of this virus, right? The second was one of the peptides which actually came from the receptor binding domain. This is actually the receptor binding domain of the spike protein present on the surface of the SARS coronavirus. In middle panel, what is shown here is an immunological assay to establish the specificity of these antibodies against those peptides as well as spike protein. In the lower panel, what I'm showing you is some of the biophysical characterization of these antibodies, how efficiently they bind to their antigen, right? And sure enough, so these antibodies tend to show an affinity which is close to 26 to sometime 8, sometime 26, in that range, nanomolar concentration, right? So then we also checked whether or not these antibodies are stable if you vary different pH. Okay, and what we found out was that from a range of 2 to 12 pH value, so these antibodies are pretty stable, but they start losing their structure when you increase it up to 13 pH value, right? We also tested whether or not these antibodies actually are stable at high temperature, and their TM value was found to be more than actually 62 degrees centigrade, pretty robust reagents, right? Now, in this panel, what is shown here is if you actually boil these antibodies, so that means all these structures are going to be lost, and then you bring the temperature down. So do they recover their structural features? And that actually is shown here. To a large extent, most of these products which were heated to denature completely, they actually regain their structures. Okay, once we generated these antibodies, established their specificity, then we tested whether or not these antibodies are able to neutralize these viruses. And obviously in IISER Mohali, we don't have BSL-3 facility. We cannot really work with SARS-CoV-2. So what we resorted to a system that we call a pseudotype lentivirus-based system. In this, what you do is actually you generate these pseudotype lentivirus, which are actually expressing either SARS coronavirus spike protein on their surface for facilitating the internalization, or dengue virus envelope protein to see whether or not this virus infects the susceptible cells. Right. Once the virus particles are produced in culture supernatant, so basically you are trying to incubate these particles with your antibodies and see whether or not they are efficiently able to block the infectivity in these cells. So this is basically showing this slide, which shows the scanning electron microscope that more or less the pseudotype lentivirus actually show all these kind of spike on the surface. And if you put them into susceptible cells, they start turning green. And as a control, so you are using as a vesicular stomatitis virus expressing G protein expressing pseudotype lentivirus, right? So then we tested whether these two antibodies are able to block infectivity or not. And this is actually a summarized data slide. What you are actually measuring is the level of green turning positive cells. So more green positive cells mean more infectivity. And if you can reduce that by pre-incubation with the antibodies, so that means these antibodies are neutralized, right? You can clearly see that both of these antibodies are able to actually block the infectivity in a dose-dependent fashion. While the control antibody, while these antibodies, they do not work against vesicular stomatitis virus, which actually is the control virus here. We also tested those products which were boiled to denature all the protein structures, and then basically cool down to regain the structural features, so whether they are also able to neutralize or not. And fair enough, we were actually able to find neutralization by these antibodies also, but to a lower extent. I'll just skip through this slide, so I don't really have time to talk about it. What essentially what this slide is showing is when we express this antibody intracellularly and look at the production of these pseudotype lentivirus from these cells, so that actually is dramatically inhibited by these antibody expressing cells intracellularly, while the control virus is produced normal, right? So essentially, this is what I'm showing with the coronavirus experiments. You can block the internalization of this virus by using these two antibodies. They are working in a different mechanisms. You can also reduce the output of this virus by expressing these antibody intracellularly, and they somehow act onto the spike protein, degrade it, and this virus, whatever you are producing out of these cells, it's not producing a lot of spike proteins, and in so doing, it's not infectious anymore. Okay, now, particularly focusing on the cleavage site-specific antibodies. So we thought whether or not this antibody actually can also work against other viruses. And the simple logic is this cleavage site is not only present in SARS coronavirus. Okay, so this is a partial list of these viruses which actually express these polybasic cleavage site. You have this in herpes virus, you have in gamma herpes virus, this is alpha, this is the gamma herpes virus, this is PPRV, the virus that causes a disease in small ruminants, and then Newcastle disease virus, the Ranicate disease that you get in poultry. So all these viruses can be efficiently neutralized by this antibody that we prepared. And the data that I'm showing here is with one of the human virus, the herpes simplex virus 1, and another is with PPRV. So it actually can bring this virus titer quite dramatically down. Then we also tested whether or not these antibodies are able to work in vivo. And for that, we use this animal model that we call as RAG1 deficient. So in these animals, actually, you do not have T cells and B cells. And whatever the virus you are injecting, so that actually is going to propagate. And if the protection is mediated by T cells, so that will not be offered. And eventually these animals are going to die, right? So what we did was, so we pre-incubated these antibodies with herpes virus, injected this animal, and as a control, so only the herpes virus was injected. And the data that actually shows here is when the antibody was given, so none of these animals died in this group where the antibody was given, and only herpes virus, so almost all the animals died by 15 days. So pretty efficient antibodies in neutralizing. Although it was selected against coronavirus, but this is also able to block herpes virus infectivity. And same actually is the case with the reduction in the body weight of these animals. Now, one of the things that will come into mind is, if that is the case, if these antibodies are able to block herpes virus infection, so can it be that if someone is infected with herpes virus before, so those individuals are going to perform better in dealing with COVID-19, right? And in order to show that, the first thing that has to be shown is whether or not herpes virus induced antibodies are able to neutralize coronavirus. And that data actually is shown here, that depending on the dilution of these antibodies from the serum from herpes infected animals. So these antibodies actually can block infectivity by coronavirus. Right? Now, what is the implication of this? So, for example, if someone is infected with herpes viruses, probably they already have some antibodies which will specifically neutralize coronavirus. And as a result of it, probably those individuals are going to control this infection better, right? There is no data to support or refute this hypothesis. But what we did was, so we collected data from WHO website and looked at the number of cases of herpes virus and correlated it with COVID-19 cases and the death rate. And fair enough, we actually find a very reciprocal rate. So in regions where you have a lot of herpes virus infection, the corona cases were very limited throughout world. So this actually could be one of the reasons why individuals who have prior exposure with some of these viruses, and herpes is one of them, they protect themselves better than those individuals who did not have the exposure to these viruses. Okay, then the next few slides are going to talk about PPRV, but essentially I don't really have too much time. So we got more or less the similar results with PPRV as well. Okay, and this we tested in a recently developed model in our lab for PPRV. This is basically is this interferon knockout animals. If you infect them with different doses of this virus, these animals die at different time. Virus gets into CNS. You can find a lot of viral antigens. And how does this virus transport to CNS is through infected neutrophils. That actually is shown here. Okay. And using this model, we showed actually these antibodies are also able to provide some protection in PPRV infected animals. Okay, so I think I can skip this dengue virus thing, so because I'm running out of time. And essentially what it means is that the antibody we have generated against dengue virus envelope protein is also able to neutralize pseudotype lentivirus expressing dengue envelope protein, as well as in animal model that we have developed, so they can extend this survival of these animals by at least 1 or 2 days. Okay, thank you very much.
Thank you very much. Don't be annoyed with me because I'm just representative. So let us maintain our relation. If you want to be angry with the organizers.
No, it's okay. It's
So it's a wonderful, really wonderful talk by Shravan. And I think he has talked about the antivirals or antibodies which are used by making genetic engineering fetch display. And he has B stomatitis he used as control. And the beauty is that he says that these antibodies can cover range of diseases in this particular animal models. And these kind of things are really very much important for eventually going to human beings. So I congratulate for your work. You're a youngster and you have done very good. And I make it open for questions.
Yeah, thank you very much. And one thing I want to point out is we actually have filed a patent and it's in the process. So we are going to get patent on at least the anti-cleavage site specific antibody.
Mike.
The PPRV which you have shared over here, so working with dengue and SARS-CoV-2, I don't know, this could be what made you so interested to work with this PPRV?
Well, the genesis of this whole thing is that we wanted to do something for animal viruses because of my background, and we actually gathered a team from IVRI, from Delhi University, and myself. All of them, all of us actually are veterinarian. We thought, can we do something about PPRV? So we got this project from ICR. We developed this animal model in order to find out immunogenic epitopes of PPRV. And that animal model actually we use for showing here that these antibodies can also work to neutralize PPRV infectivity.
So they were the field samples you used here, or you just showed?
No,
the
so this
proof
was
of
this was one of the vaccine strains, Sunguri PPR. Yeah, yeah.
Thank you.
So anybody else has any question? Dr. Hegde, expecting, yes.
Very nice work. I
Thank
just
you,
have a
sir.
little question on the cleavage-specific antibodies. Several other viruses also have these specificities. Mostly they are, basic residues.
Yeah, polybasic sites. Yeah.
Polybasic residues, and they're cleaved by, enzymes like furin and others.
Yes.
Do you anticipate any side effects, because these are very short residues, and there are also plenty of cellular proteins that have these residues?
Well, that actually is a very good point and very obvious one. But what data I showed, at least with the cellular analysis, that when we make these pseudotype lentivirus expressing this SARS-CoV-2 or the dengue virus or vesicular stomatitis virus expressing pseudotype lentivirus, we don't find any defect in production of irrelevant viruses, but only those that actually are having the polybasic residues in their entry mediators. So obviously, we have not really established whether these peptide sequences, if you inject in animals, what kind of response you are going to induce. But what data I showed was we collected serum from herpes-infected animals and PPRV-infected animals, and they were actually able to neutralize coronavirus and the homologous virus that we are testing, right? Toxicity part we have not really looked at yet to the extent it should be looked at, but we are going to do that obviously at some time point.
Last question.
Very nice work. How long these antibody last in the mice?
Well, again, these are very small antibodies, 1/10 of the size of a conventional antibodies, so which is like 150 kilodalton, and these are only 13 kilodalton, right? Clearance actually has to be very fast. And one of the things that we are doing now is we are making these bivalent or bispecific antibodies so that at least they are staying in the circulation for a little longer. And second is it will also increase the affinity of the interaction. So now we are getting in nanomolar range. So we hope that we can achieve a picomolar range with the bivalent preparations, right? So, and that is enough for inducing neutralization of acute infections, right? And probably for chronic viruses, so this actually might be a problem because virus is never cleared. But for acute infections where you have infection and after some time virus is gone, right? If you can neutralize, if you can target that window of time, so you actually can achieve better protection. And you can actually avoid all kind of cytokine storms, which are mediated actually by viral components.
Okay, Shravan, good luck. And I think Nagarajan, you can give him some comment.
Thank you very much.
Thank you, Dr. Shravan.
मुझे thank you नहीं बोला देखा, he's angry.
No, I'm not. Thank you very much.
Welcome
for accommodating me here.
आप हरियाणा से हो? हाँ, हरियाणा की राजस्थान? हरियाणा. तो क्या कहते हैं घनी मेहनत करिए छोरिया ने, बहुत अच्छा काम. Very good. Impressed. So next we will call.
The next presentation is by Dr. Amit Kumar Pandey, Associate Professor TST, New Delhi. He'll be presenting on the topic Animal Models in Tuberculosis Research, Disease Biology and Preclinical Studies. Dr. Amit, please.
So, shall I start? So, very good afternoon or good morning. And first of all, I would like to thank the organizer and of course the scientific committee for giving me this opportunity. And again, without saying, it goes like I'll be skipping few of the slides The good part is, there's the audience don't need an introduction on tuberculosis for sure. So, so my talk would be divided into basically three different portions. Firstly, there will be introduction and challenges in TB, what exactly my lab is currently addressing, and how I'm utilizing the animal model to address some of the questions that I want to address in my lab. Do I have the control for slide? It's moving here, but it's not moving there. No, I can move here, but somehow it's not working. Oh, is that the reason why? So 2 minutes extra.
तुम्हें बोनस मिलेगा 10 सेकंड. So those who are online, please wait for a minute. There is a problem in moving the slides. So we'll be there in 1 minute.
It's working here, but somehow if I press button, I can move these slides, but not.
Okay, wait.
Okay.
We'll be just having a break for a minute. We'll start in a minute's time.
Yeah.
Right?
Yeah.
Can go back. Chandu.
How to go back? This red one. And backward. Pointer.
Okay. So
I think it's working. So historical perspective, I think I can skip.
timer you can reset for it.
Sir, आप भूले नहीं हो, मैं सोचा भूल गया. So, historical perspective, I will really go fast. TB, in archaeologists found TB in like 17,000 years back in bison bone archaeological samples. In humans, it dates back to 9,000 years. So, you can understand how old this disease is. In 1600 to 1800, almost 25% death was because of TB in Europe. And then 1882, everybody knows Robert Koch identified the causative agent. And then in 1921, we had the only vaccine that's still working for some countries at least. So some of the WHO reports, recent reports, TB has climbed down to position number 13, and it is no more the highest number of death with single infectious agent. I think after COVID, the respiratory infections has taken over. But I would like to point out just one important data in the WHO TB report, wherein it says that there were 1.2 million deaths from TB in 2019, but in 2020, it rose up to 1.3 million. So it's not a big rise, but let me tell you, after 2015, this is the first time we are seeing more deaths because of TB, and thanks to Corona. I hope the numbers will go back to the earlier figures. So we are now 3 years back with respect to TB deaths. But more importantly, you can see the drug-resistant TB. The last 5-year data clearly indicates that the number of cases are going up. And in the last this figure, you can clearly see in normal TB cases, the success rate is almost 85%. But when it comes to drug resistance, you have only 50% success rate in TB therapy. And then the red ones are the failures, the orange ones are TB death. But surprisingly, the white ones, the yellow ones are, I guess, people they fail to report back. So in US, it will be a crime. If you are suffering from multi-drug resistant TB, you need to immediately report. But in India, surprisingly, few of these cases just disappear, and God knows where those patients go and how many new infections they cause. So it's a warning for people. Briefly, pathogenesis, as you all know, TB gets inside through aerosol route. It gets into the airways, and the typical fibrotic granuloma is seen. And during immunocompromising conditions, this cavity breaks up, and then you don't want to be sitting next to a person which is just coughing out TB. So animal models, again, I will be really quick here. Zebrafish, has produced some very good papers in TB basic research. But as you all know, zebrafish is infected by Mycobacterium marinum. That is actually not TB. So there are some pros and cons in this model, which again, due to lack of time, I won't be able to cover. But certainly zebrafish, rabbits, and bovine models, they don't show typical clinical manifestations. The reagents are not enough to study the host site, but the bacterial pathogenesis, these models are really good. But the challenge, again, being large animals, you need infrastructure, building a large BSL-3. Dr. Suresh and Dr. Ramchandra know how intensive that effort is, and it's not economical at all. The three most important or widely used models are right here. Mice, as you all know, is a very common model used for many diseases, and the advantage being you have all the reagents to work on the host side. The TB granulomas are not typically seen in humans, but then you have to, so the bottom line is you pick model based on what questions you want to answer. Guinea pigs are more susceptible. So for bacterial pathogenesis, we invariably in my lab use guinea pigs, but then when it comes to host side, we switch to mice because of the ease of work and availability of reagents. Primates, you all know, is one of the best models, but as I said, challenges is the infrastructure, and this is, by the way, the only model that shows clinical manifestations, and you indeed see latent TB in primate models. Coming to the challenge that we have, over the years, the identification of newer drugs, the pipeline has dried out. And then, we are in this vicious cycle of identifying new drugs. And the moment we believe that we have a drug, then suddenly the drug resistant comes up. So I think that doesn't mean that this arm is less significant. This new drug identification is very important because it gives us a band-aid approach to buy time. But eventually the drug resistance is neutralizing all our efforts to eradicate TB. So the next arm that my area of interest would be, we need to, it's high time we need to address the AMR in TB problem. I think one of the major challenges being extended therapeutic regimen, and this could extend from 6 months to 2 years based on the strains that you are infected with. And then that leads to, a non-compliance and suboptimal exposure to drug, which eventually we believe is one of the major reasons why you start seeing high frequency of MDR-XDR-TB. So my lab, when it started, my focus was to really see if we can make a significant effort in identifying mechanisms, newer mechanisms of drug tolerance, and something like antibiotic and disease persistence, which I will be constantly referring to. So any newer target with specific focus on targeting AMR or drug tolerance and persistence bacteria would certainly add up if added up as an adjunct, will certainly help reduce the treatment regimen time, efficiency of clearance of the pathogen from the humans. So this is the long-term target. So with this, basic introduction, let me move to the two major statements that I made: antibiotic persistence, and which is commonly being referred to as drug tolerance bacteria. So basically, this is explained by this kill curve experiment. So when you start TB treatment or killing bacteria, the resistant bacteria, they show there's no effect on them because they are genetically twined to be not responding to the drug. Then there are very few people know that after drug treatment there can be three different outcomes. If the bacteria is susceptible, you see a flat black line. The bacteria is immediately cured off, but that is not always the case. The devil lies in the gray area. So this black line with extended x-axis is the drug tolerant population. So this is the different populations that you see when you treat a population of bacteria, TB or any other pathogens with drugs. So my interest is on this yellow line. So this biphasic curve is what you see in most of the time when you treat a bacterial culture in vitro. So this biphasic curve indicates that you can get rid of the most, there's a subpopulation that exists in the culture which becomes tolerant, and eventually I believe these are the bacterial population that needs to be targeted if you really want to address AMR in TB, and this is what is referred to as persistent population. So in my subsequent slide, I will be referring this persistent population. When I say persistent, it really means this yellow curve and a subpopulation in the culture that are the culprits, main culprits. And this is not only a cartoon. When you start doing a CFU with the sputum sample from patients, you can clearly see that it plateaus out after, say, treatment of two weeks treatment. That shows that this population, which is slowly becoming resistant, I won't use the resistant word, it has slowly become tolerant, leads to extended therapeutic regimen in TB. So if you can understand the mechanism of how the bacteria becomes tolerant or persistent, and identifying inhibitors in the long run will definitely help add more drugs into already existing regimen, and better efficiencies and shortened treatment regimen will make a big difference in the area of TB therapeutics. So basically you remember people when they are not around. So this is what very simple principle we apply. We knock out genes in wild type virulent MTB and try to do a reverse genetic approach to see what phenotype changes we are seeing. In that process, I've identified one gene, which is a antitoxin gene in MTB. So the whole talk would be in now 3 different phases, how in vitro experiments I built up the data and then moved to the animal model to prove what I have found in the in vivo. So again, this is disease versus, so disease persistence is, as the name suggests, MTB has then extended a phenotype of persisting in the host for longer duration, and this could happen because MTB has the ability to persist inside the host, and not many people appreciate that MTB doesn't want to kill the host. So manipulating host immune system is again an additional feature that TB has that makes the host survive for longer duration, and that causes disease persistence. So together, antibiotic and disease persistence, they add up and are very critical for understanding AMR in TB. So my hypothesis of the lab is if I can find novel mechanisms and target genes very specific to antibiotic and disease persistence, maybe it will help the field. If given as adjunct, will definitely help TB therapy in the long run. So the strategy would be identify new mechanism, drug targets, design high throughput assays, and maybe find small molecule inhibitors, which when given an adjunct will specifically target this persistent population. So with this, let me go through some of the data that my lab has generated. So very briefly, toxin-antitoxin systems, they always come in pair. There are almost 90 pairs of these toxin-antitoxin system in MTB. So they always are together under stress and under very specific conditions. The antitoxin degrades and the toxin does its work by inhibiting the growth of bacteria. So basically, they act as brakes and they ask TB to slow down metabolically less active, so that gives an advantage for that particular bacteria to, so fast growing bacteria are more susceptible to TB. So this is the mechanism that I will be showing some data on. Further, this in vitro kill curve experiments will be complemented by guinea pig pathogenesis data. And finally, I have done some studies on host side as well. What are the host correlates of disease persistence and tolerance, which again can be utilized for host-based therapies in conjunction with what we are doing for from the bacteria side as well. So coming to the data, in vitro data. So cholesterol is my media of interest because MTB, as we all know, resides in a cholesterol-rich environment. So I thought, how TB is behaving if I start feeding TB more of a cholesterol. So as expected, the TB grows slow in cholesterol, metabolically less active. And, as the surprising thing was, if you grow TB in cholesterol, you see an increase in the population of drug tolerant bacteria as depicted in the kill curve here. So we did some RNA-seq analysis and indeed found that electron transport chain and ATP synthesis was playing a very big role. So MTB grown in cholesterol slows down, and we hypothesize that this is one of the ways that MTB tries to, combat the drug effect. So we, as I said, identified this toxin-antitoxin system. There's a long story behind how we identified it. So in the interest of time, I'm skipping that. It is all published. You can go and have a look. So we found that this mutant is no more slowing down, and it is metabolically more active in comparison to the wild type in cholesterol media. And then the ATP levels were significantly up. So now actually we found a break that MTB was utilizing. Once you remove the breaks, now the MTB is happily growing irrespective of the carbon source you grow the bacteria in. And, we believed that this could be, these mutants could be cleared out faster, which I'll be showing up in the subsequent slide. And in vitro kill curve assays indeed demonstrated that, when you remove the genes, you see the curve, the line becomes so flat. So all the drug tolerant persistent bacteria numbers, they came down drastically. So these were all in vitro experiments. There were a lot of other experiments that, it's all published. So the model that my lab is proposing that bacteria culture is a very heterogeneous population. Some bacteria are actively growing, some bacteria are slow in their growth. So based on their growth levels, the toxin-antitoxin accumulations are different in different bacteria. And when you grow these bacteria under normal condition, you basically don't see any growth difference. But in our lab, when we did the same experiment using cholesterol as a carbon source, we again, as you can see, based on the growth levels, the accumulation of antitoxin, they differ. But the key here was the antitoxin degrades in presence of cholesterol. So when we grow this bacteria in presence of cholesterol, the antitoxin degrades, and based on the levels of toxin that remains in the bacteria, the whole population is become so heterogeneous. So you see all the phenotypes. There are slow growing bacteria, the bacteria with high levels of toxins, they die. So we believe that MTB utilizes host cholesterol in a way to enrich the drug tolerant population as depicted in the in vitro experiment. So this was all in vitro, all and fine, but then I was always asked the question, is this true inside the animal models? So we initially studied the bacterial pathogenesis of wild type in comparison to mutants, and as expected, the mutant grew really fast in the guinea pigs. It demonstrated a very hypervirulent phenotype. The lungs were full of granuloma in guinea pigs when in mutant infected groups, and it was very well complemented. And you can see the granuloma score was very high. So the whole up to this data, it shows that there are breaks that MTB employs to slow itself down to really become tolerant against any presence of antibiotics. And this phenomenon holds true when you infect this host with these mutant strains. Again, so This was all from bacteria side. We really were interested to know what is happening from the host side as well. Do host contribute to this bacterial persistence? So for that, we have to switch the animal model now because we don't have enough guinea pig reagents to study the host side. And the first experiment we did was we replicated the guinea pig experiment in mice, and everything that we saw in guinea pigs was very clearly replicated in mice. The mutant strain was still hypervirulent, was growing better than the wild type. So the next question that we wanted to ask was, is that going to lead to better clearance? So this was the reviewer questions when we submitted the paper. So this was in the guinea pig paper. So the guinea pig story is all published. So we did the clearance experiment in mice, wherein we treated mice after 4 weeks, and the data clearly suggests that the mutant strain was more susceptible to now treatment. And trust me, these mutants MIC is pretty same. So as such, in vitro experiments, the drug sensitivity is very similar to wild type. But for some reason, when you inject this mutant in animal model, the susceptibility to antibiotics goes up. And again, we believe this is happening because this is more metabolically active and has better responding to drugs. So the question is now, can this inhibitors against this potentiate the existing regimen? Actually, currently we are looking for inhibitors. We are trying to design assays. Right now, we don't have any molecule that we can test. We hope to find some inhibitors, and then quickly go through the host side. So as you said, as I said, when we increase the dose of infection, all the mutant infected mice, they die. Usually mice infected with TB will survive for years, for at least 1 year. And then we use this model to understand the host side of the story, wherein we isolated RNA from the wild type versus infected mutant infected mice, and we did some immunophenotyping experiments to know what are the cells that are going up and down, and what is the main difference between mice infected with these two strains. And quickly, the data I will show, we got almost very stringent statistics. We got 311 genes that were differentially expressed, and to our surprise, these were mostly belonging to two pathways: neutrophil migration and inflammation. We believe this is one of the major techniques MTB uses to modulate host. And IL-1 pathway was up. Shravan, I will discuss some of these data with you because I need some input from the immunology. So this is where it is. We are trying to analyze these data and hope, long run, hope to find some molecule that can be targeted from the host side as well. Finally, I'll go. This is the same pathways that I don't want to skip. I will quickly go through this M1, M2 thing. So we found that mutant switching from M1 to M2 phenotype, and this M2 phenotype is immunosuppressive. We confirmed with real-time data and fax analysis. We see the mutants upregulate M2, and these M2, as we know, induces TS2 response, which is good for the bacteria, then bad for the host. Finally, I think this would be my last slide, wherein we are still trying to understand the major populations we believe are neutrophil and MDSCs, that are difference between these two animal groups, and we are still analyzing some of this data and see if we can find some molecule from the host side that can be targeted. And again, a lot of immunology here, different cell population. We are T cell, so CD4, CD8 were all down in mutant infected mice. So there is some M1, M2 switching happening, and that is affecting the TH1, TH2 axis, thereby helping the bacteria to grow better. This is all conclusion. I don't want to repeat myself. And I think I don't want to talk. I wanted to talk about other projects that lab is working, but trust me, the whole focus is AMR and TB. We have very interesting leads, and I don't have time to talk all about. Finally, COVID, we contributed a lot. We developed these hamster and ACE2 mice model, and we collaborated. Now I'm talking as a small animal facility in charge. So I think it was a big contribution, and Dr. Subir Majumdar was heading our institute during those times. And we all know how much pressure he had and phone calls he had to go through. And finally, with able leadership, we could collaborate with a lot of industries. And trust me, any vaccine in India that you're using has gone through our facility, including the vaccine made by Bharat Biotech. So I think with this, as Shravan said, we don't rush through the acknowledgements. I will not, at least the collaborators needs to be thanked. Dr. Avasthi Lab is helping us with immunology part. We are trying to do some mathematical modeling as well. And then computational and proteomics are being held by groups from IGIB and in-house proteomics and metabolomic experiment. I don't have time to show because we have more data here. And then I acknowledge the funding agencies, our director, and of course, all the small animal facility team, without which, we won't be able to run our facility. And they are indeed contributing in a big way towards institutional objective of achieving and doing good science. So thank you. And I hope I have not exceeded much.
No.
I'm sorry.
No. Thank you, Amit. Very good work. And we talked about the VAP-C12 gene's importance, also importance of M2, that how it helps the bug to grow, and also his wonderful animal models for testing his drugs or forthcoming ways to inhibit tuberculosis. So we can take one or two questions now. Yes, Mohan.
Yes, sir.
Nice work. I just wanted to ask the model which you are using, inducing TB in mice and other models. So they are sensitive to antibiotics. And do you have any other animal model which is AMR TB model?
If I got the question right, these mice are sensitive to antibiotics, you said.
They should be sensitive. They are not AMR like humans.
No, they are not AMR. There's no such as AMR model. We look for the clearance rate to see which bacteria is more sensitive inside the host. There is no model as such. It is the efficiency at which the bacteria gets cleared tells us that this is more susceptible or less susceptible.
Okay, and do you see population of M2 macrophages is increased in all your animal models, or what is the status?
No. Actually, surprisingly, MTB increases the M1 population. So there is a notion that M1, TH1, so why TB is doing it. I think I have a different hypothesis. I think MTB is deliberately doing it, and that enhances granuloma formation so that MTB can hide inside the host. But the mutant that I am working on did the opposite. So wherein most of the switch happened towards M2, the MTB could not able to stick to M1, and that's where the TH2 arm took over, and MTB the host failed to control the infection.
Thank you.
So yeah, go ahead. Last question.
Yes. So
Oh, okay.
thank you, sir. It was a very wonderful talk. So I wanted to ask, via which mechanism the cholesterol helps MTB to escape the host immune system and it makes it more resistant to the drugs?
Actually, resistant is the word I deliberately didn't use, because resistant means you have a lesion in the gene. But here, whatever you're seeing is a phenotypic resistance, which means it is not genetically resistant to that drug, but it is more tolerant to that drug. Cholesterol, during my postdoc, I got interested in cholesterol because I showed during my postdoc that MTB utilizes host cholesterol for long-term disease persistence. At that time, the mechanism was really not known. When I started my lab, I took up this challenge, and in vitro experiments that I demonstrated clearly, you can see that for some reason there is a signaling pathway difference. I think MTB, when it sees cholesterol, the slowdown happens immediately. And our RNA-seq data clearly demonstrate that the ATP levels, the electron transport chain, everything slows down. And a slow-growing bacteria is more tolerant to antibiotics than a faster-growing bacteria. So it's all about growth rate. That MTB modulates. I hope I answered the question.
Thank you, Amit. And
so I thank the chair and the co-chair.
Sure. Welcome. And I think, wait, they will give you something.
Thank you, sir. I request Dr. Subir to present a memento to Mr. Dr. Amit. Before we go into the next presentation, small announcement. The poster presentations are on, and the judges will be visiting the stands during the lunchtime and at the tea time. So please be ready for the clarification and the presentation at that time. So the next presentation is a recorded one. The topic is the One Health approach, current and future opportunities for laboratory animal research and welfare. It's by Dr. William S. Stoke, Assistant Director, Animal Welfare Operations, USDA, FS USA.
Good afternoon. I am Dr. William Stokes, and I would like to thank the organizers for the kind invitation to speak at your meeting today and apologize that I cannot be there with you in person. Today, I want to discuss the concept of the One Health approach and talk about how the approach is vital to advancing animal research and welfare. My objectives today are for you to understand the One Health concept and its benefits, the imperatives for One Health, recent One Health collaborations in the US and globally, and to discuss the relevance of One Health approaches to animal research and welfare. So what is One Health? In 2007, the American Veterinary Medical Association convened a One Health Initiative Task Force, and its charges included defining One Health. I served on the task force along with several other veterinarians, physicians, scientists, and students. Our task force report was published in 2008, and in it we defined One Health as the collaborative efforts of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and our environment. The One Health concept is based on recognition that the health of people, animals, and our environment are inextricably linked and interconnected. So what does One Health involve? Greater transdisciplinary cooperation, collaboration, and communication. This is especially needed for government organizations and professions that have evolved into organizational silos of different missions and experts, which have become barriers to collaborations across disciplines. I would like you to think of the One Health approach as a holistic, integrative, and collaborative approach to problem solving that leverages the knowledge within and connectivity across the three domains of people, animals, and ecosystems. One Health is a proactive scientific paradigm for health. By better understanding the current relationships between the health of animals, people, and the environment, we can proactively predict the impacts of adverse changes in the health of one domain on the other domains and focus on health promotion and disease prevention. One Health emphasizes the synergies that result from the collaborations across organizations, disciplines, and professions, and encourages integration of these collaborations and research efforts. And One Health builds on the concept of one medicine, an approach that recognizes commonalities across human and animal species and uses medical or veterinary knowledge gained in one species to benefit all species. These cross-species commonalities are especially relevant to animal models of human diseases and human safety evaluations. So what are benefits of the One Health approach? Most importantly, it will allow us to better address and solve the growing threats to the health of people, animals, and ecosystems. One Health approaches will provide improved efficiency and effectiveness in tackling complex cross-disciplinary challenges. The One Health approach will build beneficial synergies across professional specialties, organizations, and sectors by leveraging transdisciplinary knowledge, experiences, and innovative approaches. This is often referred to as a multiplier effect. An incorporation of the One Health approach into many sectors and levels will be beneficial, especially in education, research, public health practice, human and veterinary clinical practice, and ecosystem monitoring and protection. There are many compelling imperatives for adopting a One Health approach. The link between animal health and human health has never been so obvious. Consider that 60% of all known human infectious diseases are zoonotic, meaning they can be acquired from animals. And 70% of recent emerging and re-emerging human infectious diseases are zoonotic. Just in the last 30 years, we have seen the emergence of bovine spongiform encephalopathy from consuming prion-infected beef. And the first SARS coronavirus in 2003 that killed over 700 people in 37 countries and was linked to infections in masked palm civet cats. But this has now been dwarfed by our current COVID-19 pandemic that has killed more than 6 million people and most likely evolved from viral infections in bats that spread to pangolins or other animals before spreading to humans. And then there was monkeypox, which emerged in 2003 in the United States and has now reemerged globally in just the past month. In the 2003 outbreak, pox lesions were found in 47 people. And this was especially concerning because these lesions are indistinguishable from smallpox lesions. These cases were all linked to American pet prairie dogs that had become infected after exposure to Gambian rats imported from Africa. The ongoing current monkeypox outbreak now involves over 250 human cases in 23 countries and risks becoming endemic in countries outside of Africa. And there are many more 21st century examples of zoonoses that have spread to people, including avian and swine influenzas, Ebola outbreaks, and the Middle Eastern respiratory syndrome in people. There are many other imperatives for the One Health approach. Climate change is changing and adversely affecting not only our ecosystems, but human and animal health. Increasing global mobility of people and animals is speeding the spread of infectious diseases and the spread of invasive plants and animals. Increasing globalization of trade, especially food, is spreading foodborne diseases and toxic contaminants. Increasing obesity and chronic diseases are adversely affecting the quality and length of life and creating increased demands on healthcare systems. Increasing global population is increasing the need for food and has dramatically increased demand for meat, which has led to increasing deforestation for livestock and grain production. And there is a critical need to prioritize sustainable development that minimizes impact on ecosystems and plant and animal biodiversity. In order to address the many urgent areas impacting health, it is important for One Health to be considered and appropriately applied broadly to all human activities. This clearly includes basic and translational research. Another area that especially needs to be incorporated in One Health approaches is public awareness and communication. For example, despite the truly incredible achievements by the research community to quickly develop vaccines and therapeutics for SARS-CoV-2, it is estimated that 300,000 of the 1 million COVID-19 deaths in the U.S. occurred because people failed to be vaccinated after the vaccine became widely available. This is a terrible tragedy that largely resulted from misinformation and disinformation. I would like to mention a few of the organizations and efforts that have arisen since our 2008 task force on One Health. Among the many report recommendations was the establishment of a National One Health Commission, which was incorporated in 2009 and continues to serve an important role in facilitating One Health efforts in the U.S. and globally. The One Health Commission seeks to sustain an integrated national strategy for improved public health based on One Health principles. To do this, they seek to create a national awareness among all stakeholders through education, to help connect stakeholders, to illustrate the value of One Health principles, and extend the One Health initiative globally. They have excellent resources on their website to assist with these efforts. A long-standing One Health organization is the U.S. Public Health Service Commission Corps, in which I served for over 26 years. It is a multidisciplinary One Health workforce with 11 professional categories, including veterinarians, physicians, scientists, pharmacists, environmental health officers, and several other health professions. The Corps is headed by the U.S. Surgeon General, currently Vice Admiral Vivek Murthy. The Corps supports interagency and cross-sector collaborations by having officers assigned to over 20 federal agencies in over 800 locations that includes all 50 states and many international locations. The veterinary category was added in 1947 as a result of efforts by Dr. James Steele, who established the first veterinary public health program in 1946 at CDC, shortly after it was formed. Corps officers deploy for national public health emergencies, which have recently included natural disasters, the Ebola outbreak, and most recently, the SARS-CoV-2 pandemic. A recent government collaboration is the One Health Federal Interagency COVID-19 Coordination Group, which includes representatives from over 20 agencies listed on this slide that are concerned with animal, human, ecosystem, and global health. The group meets regularly to exchange information and to coordinate interagency collaborations, especially on investigations of COVID-19 infections transmitted between animals and humans. The CDC also established an Office of One Health in 2009, and a One Health Federal Interagency Network was established shortly thereafter, which now has over 20 federal participating agencies. Collaboration among the Federal COVID-19 Coordination Group has contributed to documenting SARS-CoV-2 infections in many different animal species, which now total over 20 different animals. These include several pet species, native wildlife species, and captive exotic wildlife species. Transmission from animals to humans has now been confirmed in hamsters and farmed mink. This raises concerns about the potential development of variants that may arise in infected animal reservoirs that may pose new risks to humans. Obviously, proactive ongoing monitoring in different animal populations is very important for early detection of such variants. At the global level, the World Health Organization, the Food and Agriculture Organization of the UN, the World Organization for Animal Health, and the United Nations Environment Program just last year established a joint One Health high-level expert panel with 26 experts. This panel is charged with enhancing cross-sectoral collaborations and advising the four organizations on risk management activities at the human-animal environment interface. Shortly after the COVID-19 pandemic emerged, the WHO convened an ad hoc expert international panel to develop animal models for COVID-19. The goal of this effort was to identify animal models necessary for research and to accelerate the preclinical testing of vaccine candidates and therapeutics. The panel published their report just 7 months later in the fall of 2020. Clearly, this is an excellent example of global One Health collaborations. This slide summarizes the animal models identified by the WHO panel and subsequent models that have served as useful models for COVID-19 treatments and vaccine development. With the exception of some transgenic mice, none of the models recapitulate the severe fatal disease observed in humans. This has necessitated the use of non-lethal endpoints and biomarkers of therapeutic and vaccine safety and efficacy. In contrast to many infectious disease models that involve severe or lethal endpoints, collaborations among numerous disciplines helped establish, validate, and collect data for these non-lethal biomarkers, including radiologists, pathologists, virologists, clinical laboratory animal veterinarians, and clinical pathologists. Again, I want to emphasize the importance of further incorporating One Health in biomedical research and testing. Research has benefited tremendously from transdisciplinary collaborations, and there is a good track record of this in biomedical research. But clearly, the many diseases that continue to cause significant suffering and premature deaths demand collaborations to urgently find new and better ways to tackle both infectious and non-infectious diseases. We need to not only find more effective treatments, but we also need earlier detection methods to allow for earlier intervention and ultimately strategies to completely prevent these diseases. Animal models have and will continue to support critical research needed to advance human health. Not only normal animals and animals with spontaneous mutations, but also animals genetically engineered to more closely emulate the human condition of response. These include transgenic models since the 1980s, and more recently include humanized animal models and CRISPR gene-edited models. Transdisciplinary collaborations are absolutely essential for optimal research progress. Veterinarians, animal scientists, animal technicians, and many others are vital and integral members of the animal research team. Their input should be included in selecting, developing, and using animal models, especially in the phenotyping of new genetic models. They have skills and knowledge that can provide valuable assistance in animal research and drug and vaccine development. Again, a collaborative approach is recommended for development and selection of the most appropriate animal model for a study. This includes using all available information and data about each animal model to ensure that similarities and differences to the human or other species of interest are considered. This especially includes careful consideration of the comparative anatomy and physiology of the proposed models. Molecular and genetic profiles should be determined where feasible and considered in selections. For example, the animal model for SARS-CoV-2 should ideally have the same or similar ACE2 receptor as the human. And finally, information from comparative in vitro and in silico models should be considered. These may include comparative data from microphysiological systems, sometimes referred to as organs on a chip, as well as three-dimensional organoids and more traditional cell cultures. Existing data should also be mined using machine learning and artificial intelligence. The One Health approach can be used to improve animal models by using multiple disciplines to address challenging issues. One such challenge is the poor reproducibility and predictability of some animal research, which has gained attention in recent years. Good reproducibility demands that we minimize experimental variables to the greatest extent possible. This means standardizing and reporting husbandry factors such as diet, bedding, environment, pathogen status, genetics, and many others, and working to improve the accuracy of animal models. Another area where we need much more effort is avoiding or controlling pain and distress. Pain and distress can cause considerable physiological and immunological changes, and their presence is a confounding fact that can alter experimental outcomes. We need to align treatments and care that a human patient would receive so that these are also being provided to the corresponding animal model in which the experimental treatment is being evaluated. Otherwise, we risk results that may not be predictive of the human effect. To reduce pain and distress, we need to seek earlier humane endpoints that avoid overt, severe disease or death. These may include more sensitive serum or blood biomarkers, non-invasive imaging, or even simple changes such as measurements of changes in body temperature, oxygen saturation, behavior, and body weight. I want to leave you with what I see as future opportunities to apply the One Health approach to improve animal research and welfare. First, we will always find differences in response of the animal model to the human response. We need to investigate and try to understand the basis for these differences. We have the tools to do this, which include genetic and molecular tools. Second, we need to use this understanding to reduce the uncertainties in extrapolating from an animal model to humans, so that we can increase the certainty of the predictions of safety and efficacy. And lastly, we need to constantly seek to improve the reproducibility of animal model studies by eliminating and minimizing pain and distress and other sources of variability. In summary, I believe that the One Health approach has demonstrated its value and is critical to future progress. This future progress will require fostering greater collaboration, coordination, and communication across disciplines and organizations, and that this be done locally, nationally, and globally. We also need to vigorously integrate and leverage the interconnectedness of animal, human, and ecosystem health across all sectors of research, medicine, and public health practice. In doing this, we will achieve more optimal and sustainable health for people, animals, and our ecosystems. Thank you for your attention, and please feel free to contact me if you have any questions. I've enjoyed being with you today and wish you a successful conference. Have a wonderful day.
Thank you, Dr. Williams, for the presentation. We'll be moving on to the next one. The next presentation is by Dr. Mohan Arvani, Dean Academics and Scientist G, NCS Pune. The topic is stem cell therapy in animal model of rheumatoid arthritis.
So, thank you, LASA organizing team, for having me here in this wonderful conference. So today I'm going to talk on the stem cell therapy in animal model of rheumatoid arthritis. My lab basically works in the area of cellular and molecular pathophysiology of autoimmune and inflammatory diseases. Particularly, we are concentrating on these three important diseases: rheumatoid arthritis, osteoarthritis, and osteoporosis. And we are working in the area of osteoimmunology. We are checking the immunological crosstalk between the cells of the bone and the immune system. And we also work on the stem cell biology and regenerative medicine, particularly the stem cell therapy in these three important diseases. So you know why the stem cell therapy is important in diseases. In rheumatoid arthritis, osteoarthritis, osteoporosis, and also in the bone metastasis of breast and prostate cancer, the osteoclast number. Osteoclasts are the cells which resolve the bone, they eat the bone. their survival is also increased, their bone resorption function activation is increased. And in addition to that, there is an increased production of several pro-inflammatory cytokines. And also there is an imbalance between the Tregs and the Th17 cell. That is why when you see the increase in osteoclast number, you will see the increase in the bone loss. So not only osteoclast number is increased, but the osteoblasts, which are the bone forming cells, their number is also decreased, and these osteoblasts are defective, and therefore the regenerative potential of bone is poor. So in this, the present drug, they actually prevent further bone loss, but they do not regenerate whatever bone loss happen. So the stem cell therapy is very important in diseases. There are many students are there in the audience. I just want to give the brief introduction of the stem cell biology. So you know that the stem cell are the foundation cells, and they have two important characteristics. They are unspecialized cells that renew themselves, and under proper condition, they can be stimulated to develop into specialized tissues and organs. And that is why this is a new definition, regenerative medicine. That's a treatment using stem cell to restore the function of damaged organs and tissue. And this is the new way to treat diseases for nearly complete cure. One of the most challenging and exciting field of the modern biology is stem cell therapy and regenerative medicine. However, at the same time, one of the most controversial field because of the complexity of the subject. So, although it looks very lucrative, but there are many things we need to know. So, there are different types of stem cell. I'll not go into the detail. You people know that there are three types of stem cell: embryonic stem cell, adult stem cell, and induced pluripotent stem cell. So the adult stem cells, generally they are mesenchymal stem cell, and they can be isolated from different tissues: bone marrow, adipose tissue, dental pulp, or dental follicle, and gingiva. So today I'm going to talk about the mesenchymal stem cell. So mesenchymal stem cell, the first characteristics of mesenchymal stem cell that they have the fibroblast type morphology, and the initial passages you will see the heterogeneous population because of the presence of many hematopoietic stem cell, but after passage 2 or 3 you will get the homogeneous population of the mesenchymal stem cell. The second characteristics of mesenchymal stem cell that they grow in the form of fibroblastoid colony. So initial passage you will see the formation of these colonies. Okay, so and this you can easily stain with the hematoxylin. So this actually number of colonies suggests how many stem cells are there in your sample, and generally it is 1 per 10⁴ or 1 per 10⁵. So number of stem cells in this bone marrow sample is very less, 0.001%. So how to characterize, because they look like fibroblast type cells. So how to differentiate them from the fibroblasts? So they should be positive for, by FACS analysis, they should be positive for the CD105, CD73, CD44, and many other surface molecules. They are negative for hematopoietic markers like CD45, CD34, CD14, and so on. And they also do not express many adhesion molecule. I'll not go into detail of all this because of the time constraint. Then how to characterize? That's by FACS, and here you can see that these cells show the strong expression of CD90 more than 95%, CD44, CD73, and CD105, and here you can see that they are negative for CD45 and CD34. Then the next characteristics is these immunological characteristics that MSC they express MSC class 1, but they do not express HLA class 2 antigen, and that is why these cells can be used for the allogeneic transplantation. Then before using this stem cell for transplantation, either in animal model or human, you need to see the karyotype of the stem cell. They have normal karyotype. If they are abnormality, you cannot use this stem cell for the transplantation. Then you should also check whether they induce the tumor, has any tumorogenicity in the animal model. So we use this nude mice, and here the positive control is we injected HeLa cells, which has induced the tumor. And when we inject a mesenchymal stem cell, you don't see the tumor. And this study was done for 3 to 6 months. So these cells that your cells are good for therapeutic applications. Then the last characteristic that they should differentiate into different cell lineages, and minimum they should differentiate into 3 lineages. One is osteoblast, the adipocytes, chondrocytes, and osteoblasts. If this mesenchymal stem cell are differentiated at least in these 3 lineages, then you can see that they are mesenchymal stem cell. Controversial results are there that they can differentiate into the neuron or endodermal lineages such as hepatocyte, beta cells. But what is most important that they should differentiate into 3 lineages. And this differentiation, I have shown how we induce this mesenchymal stem cell into bone osteoblasts. Here you can see these are the control. We add different growth factors. I will not read this. These 3 factors we add, and then you get the beautiful bone nodule formation in vitro within 21 days. And this you can confirm by the quantitation of how much bone matrix is synthesized, whether do they express all the osteoblast specific markers. So here you can see that they clearly expressing this osteoblast specific genes. Similarly, we do it for adipocytes. So we add these 3 factors, and then you get the accumulation of lipid-rich vacuoles. These are the adipocytes. And again, confirmation by gene expression study. Then the third is that they should differentiate into chondrocyte. For chondrocyte differentiation, we use the pellet cell culture, and we add TGF-beta, ITS, vitamin C, dexamethasone, and here in 20 to 28 days, you get the beautiful formation of the cartilage tissue in vitro. Here you can see that the size of the pellet in the control, and here you can see the size of the pellet in the treatment group. You can see there is an increase in size. It means that it has generated cartilage in vitro. But there are certain lacunae in the stem cell culture model in vitro. So they do not actually provide proper niche of microenvironment. So what the stem cell field is fast moving towards the translation to the clinical practice and is becoming increasingly dependent on the animal model. So animal models are the most important thing in the stem cell therapy. So there are different clinical trials are going on globally with the mesenchymal stem cell in different diseases, including graft versus host disease, Crohn's disease, SLE, which is autoimmune disease. And there are several diseases where clinical trials are going. So currently all these are experimental stages. Don't believe what people are saying, giving the advertisement that we can cure these diseases with stem cell. Only hematopoietic stem cell therapy is standardized globally, but not for this. So this is all again experimental condition. So what is the mechanism on how this mesenchymal stem cell therapy regenerate the tissue? What are the different mechanisms? So these are the 4 mechanisms still identified. These stem cells migrate and home to the sites of injury. These secrete cytokines and growth factors that may help to enhance the repair of the damaged tissue. And these MSCs also inhibit the release of several pro-inflammatory cytokines and promote the regeneration of the damaged tissue. And MSCs also, as I told you, that they do not express MSC class 1. So they induce the peripheral tolerance and migrate to the injured. So these are a known mechanism for the how MSC therapy works in viral condition. So I'll just briefly tell what we have done, the stem cell therapy in the rheumatoid arthritis animal model, mouse model, and some studies we have done on stem cell therapy in the clinical cases of the canine osteoarthritis. So I will not go into detail. You know that rheumatoid arthritis is an autoimmune disease and multiple joints are affected, and there are several immunomodulatory changes are there. So it's a known autoimmune disease. So I'll not go into detail. And this is the difference between osteoarthritis and rheumatoid arthritis. This also, you know that osteoarthritis is where only there is a degeneration of cartilage, but here is the inflammatory condition. And multiple joints are affected in rheumatoid arthritis, and there are several symptoms are other tissues are also affected. So I will not go into detail. So the current therapy for rheumatoid arthritis is conventional anti-rheumatic drugs to reduce the inflammatory cytokine and painkillers. So however, for protection of against structural damage and also to prevent the immunomodulatory changes, you need a combination therapy. So one therapy what we have tried is a mesenchymal stem cell therapy in animal model. So we have used the collagen-induced arthritis mouse model in DBA1J strain. So again, we inject collagen type 2 on day 0 and day 20, booster on day 21. And then after we observe the different symptoms of arthritis up to day 36, and then sacrifice the mice and do the different assays by different techniques. So here you can see the inflammation, the grades of the different inflammation, 1, 2, 3, and then in the joint histopathology, here you can see that there is a degeneration of cartilage and the subchondral bone. These are the soft X-rays of this affected joint. Here you can see that there is swelling of the soft tissue. So these are the parameters we use. And we also do the microcomputed tomography. This is a machine which analyzes all the cortical and cancellous bone parameters. So I'll not go into detail. This automatically machine detects whether your bones are weak or strong. So, and then we first confirm that MSC inhibit the activated T cell responses. So it has the immunomodulatory properties. Then we confirm that MSC inhibit the osteoclast, which are the bone resorbing cell. And here you can see this stem cell in a cell density dependent manner, they inhibit the osteoclast differentiation. Again, this is confirmed by the RT-PCR that they inhibit the expression of osteoclast specific genes. Then we checked whether MSCs, this stem cell can inhibit the Rankel-induced osteoclast differentiation in a contact-independent manner. So we wanted to check whether they can secrete some factors and then inhibit. So we use the chamber assay, and in that assay also we confirm that this MSC inhibit the osteoclast differentiation. And the condition medium, which is secreted condition medium after 24 hour of collection, we checked whether that condition medium also inhibit. So we found that yes, that significantly inhibit the osteoclast differentiation. And the most important thing is that I told you that in rheumatoid arthritis there are accumulation of several pro-inflammatory cytokines, including TNF alpha, IL-17, IL-1 beta. So in presence of all these pro-inflammatory cytokines, this mesenchymal stem cell inhibit the osteoclast. So it shows that it has a potent anti-inflammatory, immunomodulatory properties. Then we check the in vivo in this model. Here you can see there is a significant decrease in the mean arthritis score. There is a significant decrease in hind paw thickness. Here you can see these are the figures. These are collagen-induced arthritis, and this is treated with the mesenchymal stem. You can see there is a more than 60% reduction in all these symptoms. Again, proved by the histopathology of the joint, the inflammation score, and by microcomputed tomography. Here you can clearly see that these are the control bones, and in the arthritic, you can see there is a loss of bone, there is a loss of microarchitecture deterioration, and this MSC therapy has prevented this bone loss. Again, this is confirmation by the microcomputed tomography that all the parameters of the cancellous and cortical bones are improved. So this, and we also check the other bones, including tibia, femur, and interestingly, here you can see in the next slide that it can also prevent the damage in the vertebrae. So these are the pictures of the vertebrae. Here you can see the damage, and it is prevented. Then we wanted to know what is the mechanism. So we found that this mesenchymal stem cell, they increase the regulatory T cells. So the regulatory T cells has the immunomodulatory properties. This suppresses the inflammation. And in another study, we have found that this MSC therapy decreases the TH17 population. That data have not shown. So this finding we published in Journal of Immunology. And we, our research findings were highlighted in the Nature Reviews Rheumatology. We also checked their effect on the Breg cells, and we also found that it increases, it shows the improvement in the Breg cells in arthritic mice. And again, in vivo investigated mechanism, we found that these MSCs, they secrete, they inhibit the number of osteoclast precursor in CI mice. So now what is important, what these studies we have done in a small animal, but what is important is because we cannot do the long-term studies, the lifespan of the mice is only 2 years. And even in that 2 years, you cannot inject before like 3 or 4 months. So here you can just do the short-term studies. So what is now important is to use the large animal model to know the many things of the stem cell therapy, whether they are toxic, they are tumorigenic in long term. Because if you use the large animal model like sheep, goat, or dogs, the lifespan is over 15 to 20 years. So you can do the long term studies in detail. And then I have 2 minutes. I'll just go through this. We have done this mesenchymal stem cell therapy by injecting in the osteoarthritic dogs model. So we have done about 10, 12 animals, canine clinical cases, and we injected intraarticularly 5 to 10 million cells on day 0 and day 30. And then we ask the owner, because we may be biased, so we ask the owner that you evaluate the symptoms in the animal. So they found that the dogs which were unable to climb the stairs, or which were unable to jump, there was a lot of improvement in those symptoms. So it indicates that there is a improvement in the arthritis. Then we wanted to confirm by the MRI scan. So we did the MRI scan. However, in MRI scan, we found that there was no regeneration of the tissue. So it suggests that it has shown the anti-inflammatory activity. It has not actually regenerated the tissue. So this may be because we injected only few million cells and it was short-term study. So this, but the findings are encouraging. We are doing the long-term studies in the these osteoarthritis dogs. And in addition to, we have found that interleukin-3 also has this activity. So now we are doing the combination therapy of stem cell and the interleukin-3. So I think so why large animal models are important? Because they have large span, and most of these large animals tissues, they are structurally and histologically mimics the human tissues. Like here in a horse cartilage structurally and histologically mimics the human cartilage. So for human cartilage research, this is the best model. That is why this is a cartoon that these animals are saying, you help us, you treat our osteoarthritis condition, and it will be ultimately will help you in human beings. So now I'll stop here. So this future medicine is combination therapy and the personalized medicine, so that we are working. Because of the time constraint, I had to just rush through it, but I think I have covered whatever I wanted to say. So there are different challenges are there, stem cell challenges for clinical use. This is important slide, so I'll just read it. So what is important, we still do not know how many cells to inject into the body, right? We know how much antibiotic to, but we still do not know how many cells to inject. We still do not know whether transplanted cells are safe, whether they maximize the tissue compatibility, and that this transplanted cell must integrate and function properly. So now veterinarians, they have to play important role to actually do detailed investigation of stem cell therapy using the large animal model. Thank you very much. And I would like to acknowledge all my PhD students and the postdoctoral fellow. This stem cell work was done by Gayatri, and other students also helps. And our lab is working, main work is on the role of interleukin-3. So we have got many research leads with interleukin-3, and that interleukin-3 and stem cell therapy. Now we started with the osteoarthritis model. We are going to do in other animal models. Thank you very much. And thank you for listening, patiently listening. And now I can take some questions.
Thank you, Dr. What happens if osteoclast and osteoblast
both
are gone and not working properly?
No. In all these diseases, osteoclast number increases. That is why in.
No, I was asking because neither Makesh was there nor Dr. England, both were gone. And this hall also looked like osteoarthritis because in the beginning it was filled with bone cells, and now there are a lot of evacuations.
Yeah, I'm sorry to say that half of the hall is empty. Maybe they were hungry.
No, it's good. Very wonderful presentations. It's open. If you have any question, you can ask.
Yes. Yeah.
Dr. Amit.
I have pretty similar questions that I asked earlier. So in that canine model, what was the origin of cell that was injected? Is it in,
No,
interspecies
we had
rejection?
used the mouse adipose tissue derived mesenchymal stem cell.
And they don't react. I mean, there's no antibodies or rejection thing when you inject
No.
mice derived cells into large animal. Is it?
No,
There's no issue.
no. Sorry,
Or
you're confused. In animal model, my mouse model, we use the mouse cells. Okay. In a canine model, we use canine MSCs. Okay.
Hello.
Yes.
Sir, what about the angiogenesis? Whether the MSC form angiogenesis?
That we are studying. We have still not optimized that. That's our microcomputer tomography also evaluate the angiogenesis, but we have not yet optimized that.
Sir, in case of this, where is the homing of this MSC? Where does it home finally?
No, there are. I told you there are different mechanisms. Some of the cells, like all the cells, will not go into the damaged tissue because I forgot to tell you because of the time constraint. 80% of the injected cells goes to the lungs because they're trapped into the lungs. Okay, so we are investigating the molecule which can induce the migration of this stem cell into the damaged site. So we are working on that, but what you said is very important questions, how to. And then these cells secrete some cytokines or other growth factors, and that is helping in inducing the regeneration of the endogenous tissue.
Okay, Dr. Taru.
Yeah, so Dr. Nagarajan, as you asked, so yes, they do help in angiogenesis, and that detailed studies we have done. And what we have done is VEGF levels are very high compared to other mitogens. So I just shared a small work. So VEGF level is very high, and especially there was a ITBP dog and 2 police dogs. When we were doing this work, before giving it to them, the canine origin cells, same animal cell we gave it to them. So that time we have done all this preamble work of the stem cell, not of the secretome. So that's how they help.
We need to do very long-term studies in large
Very
animal model.
long-term
Yeah, then
studies.
it will prove.
First, we have done in a small animal model through student theses, and then since they were important ones, so we have done the same thing. We replicated using same animals like Otto.
Who has the questions?
Yeah, so my question is, so when you have in vitro data, you showed on suppression of CD4 T cells. If you co-culture them with
CD?
CD4 T cells.
No, I showed the T-rex cell population is increased.
MSC's co-culture with CD4 T cells inhibits basically the proliferation of those cells. That's one, right? And second was
CD34. You're talking about CD34 or CD?
In vitro assays that you showed, where you actually demonstrated that these cells that you are transferring, so they are able to inhibit this the proliferation of your T cells.
Yeah, activated T cells, right? That was why you wanted to check whether they have immunomodulatory properties. That's the experiment we did. Yeah,
that's one. But you also showed some data that in the recipient animals, so you actually get more number of regulatory T cells.
Yes, and less TH17, which I have not shown.
Yeah. So now, which
Shravan, you can continue talking during lunch because organizers are having heart attack. So I thank the leftover audience, lost, gone audience, and the speakers for this particular session. It was very lively. Thanks to all. Thanks to organizers.
Thank you, Chair and Co-Chair.
letting us chair.
Thank you, sir. I request Ramchandra sir to present a memento to Dr. Subir. Dr. Subir. And and request Dr. Mahesh to present memento to Dr. Nagarajan. With regard to the next session, we'll be having an international speaker coming in all the way from Japan. And he had insisted on having the presentation to start by 2:20, but we have requested him to start it by 2:30. So it would be a humble request from us to see to it that we are back from lunch and be available here by 2:20. We'll be starting by 2:30. And the poster presentations are on. All the students are requested to be there at the posters so that you can clarify with the judges for this. Excuse me, with regard to the oral presentation, due to a time constraint, we are rescheduling it. We will be letting you know the timing today itself. Thank you. Sir. It's not your pleasure. Ah. అందుకని మంచిగా తీసి పెట్టుకో एक बार चेक कर लो सर yes sir yes yes yeah it's not
That's a different shoe. Presentation is good. ये इधर ही लगा दो इधर ही लगा
ఎందుకంటే చేంజ్ చేసి ఓకే
HDMI కేబుల్ పెడితే అట్లా అయింది.
ठीक है, यही है, 1 मिनट, यही है, मैं बताती हूँ। लासा कॉन्फ्रेंस करके आई, रुको अभी, आप एकदम कट पेस्ट मत करना, एक स्लाइड में वो कलर्स गड़बड़ हो रहे हैं, वो मैं ठीक करता हूँ, जस्ट करेक्ट इट। అది అవ్వలే వాళ్ళు ఇచ్చిన यार इसी में रहने दो, कॉपी इट।
Time of your presentation, it's on the desktop. And open the file and open it. Stand by.
Hello. 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 Dr. Nobu, can you open your link? Dr. Nobu?
Yes, I can hear your voice.
Hello, Dr. Nobu, can you open your link?
Yeah.
Good afternoon, sir.
Yes.
Yeah. Good afternoon. Yeah.
Good afternoon, everybody. Thank you very much for having a quick lunch and assembling back. For the second session in the afternoon, we'll be having the topic care management and quality standards of laboratory animals. To chair this session, I invite Dr. K.V. Patel, Chief Veterinary Officer, LBS, New Delhi. The first topic of discussion today afternoon is infectious diseases and microbiological monitoring in mice and rats. It's going to be presented by Dr. Nobi, Director I-Class Monitoring Center, CIA, Japan. Dr. Nobi. Dr. Nobi, please unmute yourself.
Yeah. Sorry. It's my great pleasure to give a talk to you. I'm Nobuhito Hashimoto from Central Institute for Experimental Animals in Japan. I would like to talk under the title of Infectious Disease and Microbiological Monitoring in Mice and Rats. Since the schedule is late, I will talk a little short. Just a moment now, I share my desktop.
afternoon, everyone. Until the presentation sets in, this is a kind of a post-lunch session, which is really challenging to handle. And I'm sure Dr. Nobu will do the best. And in the morning, first session, this is the second session, in fact. In the first session, we have talked about animal model. And, you know, animal models can be set up when someone can standardize it. And later on, for better consistency, there are quality controls needed. So this session is about that. And now it seems Dr. Nobu is ready. So we will listen.
Can you see our slide? Can you see
please,
our
Nobu?
It's okay.
Yeah, it's fine.
Okay. Today, I would like to talk under the title of infectious disease and microbiological monitoring in mice and rats. These are contents of today's talk. First, I would like to introduce our activity. Next, I will talk about changes in the microbiological positive rate of mice in the facility of academia over the past 10 years. Then I introduce bacterial infection in TG mice and immunodeficient mice. First, I introduce our activity. Our institute is a public interest incorporated foundation in Japan and founded in 1952 by Dr. Nomura. The number of staff is about 180. The Korea Japan, one of the largest animal breeder in Japan, is an associated company. Also, temporary staff recruitment agency, JSC, is an associated company also. Our institute is CIA located a newly developed science park, especially for life science. The area was named as King Skyfront. There is located in front of Tokyo Haneda Airport. So many institute and life science companies joined the area. The goal of this area is development and manufacturing of innovative pharmaceuticals and medical devices and creation of health-related industries by global companies that respond to era of personalization and preventive medicine. So our center, ICRAS Monitoring Center, is a part of CIA. Our center was assigned as ICRAS Monitoring Center for Genetic and Microbiological Quality Control of Laboratory Animals by ICRAS, International Council for Laboratory Animals Science, in 1979. We tested 33,461 samples in last year, including living animal, serum, feces, etc. from in total over 7,000 clients in Japan. This slide shows a breakdown of our samples received from our clients in Japan in last year. Most numerous samples are live mice. The number is 17,308. Then serum samples of mice were followed. In total, we received 33,461 samples from our client. Recently, the number of rat specimens is decreasing in Japan. It has decreased by nearly 1,000 samples in the last 3 years. The reason is not clear, but I think that mice are space-saving and easy to breed, and the genetic engineering technology of mice has advanced in recent years, making it relatively easy to produce mice that match the purpose of the experiment. I think it has something to do with it. This slide shows our selection standard of microbes. We categorize test items from A to E. A is zoonotic pathogen like Salmonella, LCM virus, hantavirus. Category B is a pathogen fatal to animals like the Mycoplasma pulmonis, ectomegavirus, mass hepatitis virus. Category C is a pathogen not fatal but can cause disease in animals and affect their physiological functions. These categories including Corynebacterium cutteri, Cytobacter rodentium, T-cell organisms, Streptococcus pneumoniae, etc. Category D is opportunistic pathogen for animals, like as Pasteur pneumotropica, currently Rodentibacter, and Pseudomonas aeruginosa, Staphylococcus aureus. Category E is indicators of the microbiological status of animal or colony. This category is including most of intestinal protozoa, ectoparasite, and pinworms. This is our test result in last year in mice. The denominator is the number of facilities tested, and the numerator is the number of facilities that were positive. Please note that it is not the number of the individuals. The results are displayed separately for pharmaceutical company and academia. First of all, you will notice the pharmaceutical companies have a lower positive rate than those of academia. In particular, intestinal protozoa were rarely positive. Many positive cases were Staphylococcus aureus. On the other hand, animal facilities in academia tend to be positive for intestinal protozoa. In particular, there were many positive cases of amoeba, octomitus, and trichomonas. There were also some positive cases for Pasteur pneumotropica, Staphylococcus aureus, and Pseudomonas aeruginosa. Helicobacter hepaticus and MHV are also positive, though not in large numbers. This slide shows results in labs. As with mice, there were few positive cases in the animal facilities of pharmaceutical companies. Staphylococcus aureus positive cases were the most common in academic facilities, followed by Pseudomonas aeruginosa and Pasteur pneumotropica positive cases. Furthermore, positive cases of pinworms, which was characteristic. Next, I introduce change in the microbiological positive rate of mice in the facility of academia over the past 10 years, based on our results. Sixteen items that were positive multiple times: Helicobacter vitis, Helicobacter hepaticus, Mycoplasma pneumoniae, Pasteur pneumotropica, Pseudomonas aeruginosa, and etc. Were targeted in this time. The number of survey facilities varies depending on the test items, but the maximum was 27,181 tests for mouse hepatitis virus. As a result of comparing the positive rate in 2011 and 2020 and performing Fisher's exact test for all items, a significant decrease in the positive rate of following items was confirmed: Helicobacter hepaticus, Pasteur pneumotropica, Staphylococcus aureus, mouse hepatitis virus, murinorovirus, and amoeba, octomitus, trichomonas. Aspiculosis, Staphylococcus aureus had the highest positive rate in 2011 at 21.45%, while it was 57% in 2020. The next highest was murinorovirus, with a positive rate of 9.38% in 2011 and 3.33% in 2020. On the other hand, the positive rate increased significantly in Mycoplasma pneumoniae and Pseudomonas aeruginosa, which had relatively low positive rate in 2011. This is a change of positive rate of parasite. In Japan, intestinal protozoa are microorganisms with a high positive rate in mice and rats. As I talked in the previous slide, we have seen significant decline in entamoeba, octomitas, trichomonas, and aspiculosis. Next, I'd like to talk about bacterial infection in TG mice and immunodeficient mice. There is a bacterial or fungal infection we recently encountered in immunodeficient or TG mice. The title is bacterial infection disease, but it also includes fungi. Not only opportunity pathogens, but also bacteria in the environment can cause infections. The first is Pneumocystis murina. This fungus has recently been reduced in infection in Japan. The positive rate is less than 1%. Weakness and death were found in LAG2 knockout mice from University A. It was kept in the same room as SPF grade mice, but subsequent hearing revealed that they are not being tested for Pneumocystis murina. Here's a finding at autopsy. Grayish-white changes and subinvolution of lung were found. This is a characteristic of Pneumocystis murina infected regions in immunodeficient mice. In his pathological examination, foamy substance were found in alveoli. This foamy substance is trophozoite of Pneumocystis murina. I'd like to review pneumocystis a little here. The positive rate is very low in Japan today. And last year, there was only one positive case in mouse. However, positive cases are seen every year. This fungus is classified as category B, a microorganism that causes fatal infection in immunodeficient animals, but is a category D opportunistic pathogen in immunocompetent animals, so that infected mice are known to be Pneumocystis murina. And those that infect rats are known to be Pneumocystis carini. This microorganism causes interstitial pneumonia in immunodeficient animals and causing symptoms of dyspnea. The test is generally performed by PCR. Take the lung as a sample. This is a Pneumocystis murina infected nude mouse with a systemic weakness called wasting. Cyanosis is also seen because of respiratory lesions. However, cyanosis can be difficult to see in mice with hair or colored mice. This is a lung Pneumocystis murina infected mouse, lung of Pneumocystis murina infected mice. In autopsy, healthy lungs contract, but Pneumocystis murina infected mice do not. This is because Pneumocystis murina increases in the lung and causes inflammation. Also, the lung of mice infected with Pneumocystis murina became stiff and resistant to cutting with scissors. Confirmation tests are mandatory, but the proficient autopsy person can determine that the mice is a Pneumocystis murina positive by simply dissecting. There are other, next is a Staphylococcus aureus infection found in mutated knockout mice. The main symptom of this mouse was torticollis with some deaths. Later hearing revealed that he had not been controlled for Staphylococcus aureus. This mouse was also bred in the same room as SPF grade mice. This photo shows a formal fixed brain. The dilated ventricle was filled with pus. Staphylococcus was isolated from the pus. Histopathological examination revealed otitis and otitis media. Otitis media can cause torticollis in mice. In fact, torticollis was confirmed in these mice. Next is a Staphylococcus aureus infection found in NOG mice. Energy mice show severe immunodeficiency because they lack T cell and B cell and have low NK cell activity. Mice had a scale on the skin, and some were debilitating and some died. Histopathological examination revealed hyperkeratosis, in which a mass of cocci was visible. In addition, otitis was seen and the presence of cocci was confirmed. Staphylococcus aureus is a bacterium that is resident on the mucosa membranes and skin of animals. It is also present in water and soil. It is extremely rare to cause infection in humans, and no infection have been reported in mice or rats. Next is Corynebacterium bovis infection. This was also seen with energy mice as before. Skin scales were seen, and some dead individuals were also seen. This is a photo of an infected mouse and a photo of a histological examination. The hair of the mouse became coarse, and the scales were also confirmed. Histopathological examination revealed hyperkeratosis. Next is Helicobacter MIT 016451 infection found in energy mice. This bacterium is now named Helicobacter japonica. At our center, Helicobacter hepaticus and Helicobacter berries are included in the test items from past pathogenicity reports. However, infection caused by Helicobacter other than these two species are sometimes observed. These Helicobacters are included in the optional item as Helicobacter spp. The mice was tested for diarrhea and death. Autopsy revealed thickeness and edema of the lower gastrointestinal tract. Histopathological examination revealed colitis. In addition, in the special dyeing that stained the bacteria were confirmed in the crypt. There were also cases of Pseudomonas aeruginosa infection in energy mice. This bacterium is also found in Japan and can cause fatal infection in immunodeficient mice. The mice were frequently debilitated, and autopsy revealed redness in the lung, liver, and kidney. Pseudomonas aeruginosa was isolated from blood and major organs. Histopathological examination revealed interstitial pneumonia and nephritis. This is the last slide in the presentation, but it should be noted that depending on the degree of immunodeficiency in the mice, bacteria in the environment can cause the infection. This also applies to TG mice that have been engineered with gene in the immune system. This is a conclusion. In recent years, mice with characteristics that have never been encountered have been created. Maintenance of those mice may be inadequate with normal rearing management. In particular, immunodeficient mice may need to be controlled by environment-derived bacteria, depending on the degree of immunodeficiency. Instead of thinking that the quality control of all mice is the same, it is necessary to carry out quality control suitable for the characteristics of the mice. Thank you for your attention. I look forward to seeing you in the near future. Thank you.
Thank you, Dr. Nobu. Now the session is open for the discussion, if any question. Dr. Nobu, if none from the audience, I have one.
Yeah.
In a first slide, in a statistics, you have shown that mice samples are almost 26,000 you have received for health screening, and rat samples around 3,000. So what could be the reason for that disparity of samples that way?
Sorry, bad environment with Wi-Fi condition. Please ask me again.
Yeah. So my question is, mice samples for health screening, you have received 26,000 plus.
Mhm.
And rat samples for health monitoring, you have received only 3,000 samples.
Yes,
so what could be
yes.
the geographic reason there?
Oh, so I don't know actually, but as I talked, recently rat sample is declining to receive in our center. The reason is I don't know actually.
Okay.
How about your country?
Yeah, in our country, also the mice health monitoring and rat health monitoring is kind of different, but we do not have an institute like you where we collect the data. Thank you.
Okay,
Any
thank
other
you.
question?
Can I know, is it possible to eradicate MHV in your colony or any other colony? Mouse hepatitis virus?
Sorry, please ask again.
Okay. Is it possible to eradicate MHV, mouse hepatitis virus?
MHB.
Yeah.
Yes, I think it is difficult because our in our center positive case is very low of MHB, but sometimes happened outbreak. I don't know why, but I think it's very difficult to eradicate from animal facility.
Okay, thank you.
Have you came across any spontaneous diseases while doing the microbiological monitoring at your center? Spontaneous diseases.
Oh, in Japan now is microbiological quality of animals is very good, and it's difficult to find any disease. And we just have only intestinal protozoa and Staphylococcus aureus.
Okay.
Yeah.
Thank you, Dr. Nobu, for excellent talk and giving us an insight about the immunodeficient and nude mice colony, the risk of health, and what kind of measures you are taking. Thank you so much.
Thanks so much. Bye-bye.
Thank you, Dr. Nobu. Now we pass on to the next presentation of the day, deciphering the genetic monitoring techniques of laboratory rodents for quality standards by Dr. Arvind Dingle, Scientific Officer H and Officer in Charge, Laboratory Animal Facility and Histopathology, ACTRIC, Tata Memorial Center, Mumbai. Dr. Arvind, thank you, sir.
Thank you for giving me an opportunity to share my experience of the genetic monitoring. Mr. Chairman, Co-Chairman, I will be deciphering the genetic monitoring code for laboratory rodents.
Microphone, I think, it's audible?
Am I audible? Yeah, right. So to start with, I will be covering the animal use. Everyone knows the use of animals is inevitable in the laboratory research, and for that, quality laboratory animals is the prime requirement. And when we have the genetic mixing or the mutations, it is very difficult to find out the reasons. I mean, unless we check it. And there, the diagnostic importance of the genetic monitoring lies. We have the genetic monitoring conventional method, biochemical method, PCR method, and I will be also talking about what we achieve by genetic monitoring. So as we know, animal species are mammals, reptiles, birds, marine animals, and in that, mice and rat constitute the 90% of the junk if you see worldwide literature. So I will be restricting my talk to mice and rat. So when there are animal research going on, what are the variables? Variables are microbial, environmental, and genetic variables. And as we know, bacterial, viral, parasitic, and in genetic, we need to know the source
source may be contaminated, and there may be mutations, and environmental, all these conditions. So my talk will be restricted to the variable genetic monitoring. So what is genetic monitoring? It is any character determined by one or multiple genes that can be measured and remain uninfluenced by environmental changes, and that can be monitored as a genotype. What is the need of genetic monitoring? It is for validation and verification of closely related strains. And this is because we have a lot of spontaneous mutations. There are some breeding errors, sometimes genetic contamination, forced or unintentional, and sometimes residual heterozygosity. And why we need is because many of the strains are closely related. In some of my slides, I will explain how they are closely related. And when there is genetic contamination, and because manpower, time, and money is saved when we timely diagnose the genetic contamination, so and save our colony so that we can replenish with the new one. So now the challenge is we have to identify and deal the variables. So in that genetic we must know the genetic status of the animals and from which source we are getting the animal, whether it is contaminated and mutation. Based on that, the colony is built up. So what are the genetic monitoring tools in available? Morphological, immunogenetic, biochemical, cytogenetics, and molecular, or what we call DNA methods. Out of these, cytogenetics is somewhat complicated. We don't employ it, but all other we are employing them. And in my talk, I will be covering all of them, what we do at our place. Of course, another monitoring tool is technicians. Our technicians, they are one of the tools, and I consider them as the best tool if we teach them some of the deviations like litter size or body weight or some weird behavior in the animal. So that is one of the indications for us that we should check the genetic integrity. So one of the parameter is erythrocyte alloantigen loci. So these are the antigens coded on erythrocytes, and they are detected serologically by hemagglutination. And there are EA1 to EA9. Several of us, we import the animals from outside Jackson, Charles River, and other techniques, whatever source. We issue the quality control letter along with that microbiology, genetic monitoring. If you see that EA is 1 to 9 is mentioned in there, we don't, pay attention to that. But this is one of the immunogenetic marker being tested. And where is the this is full is C57 black 6J and 10J. So these are two different strains. They are identical for 23 isoenzymes, have a black coat, and both are H2B. However, they differ at the erythrocyte antigen EA9. So C57 black 6J has the antigen, that is EA9A, and 10J is lacking, so it is 9B. So this is the difference for the erythrocyte alloantigen loci. Other method is the skin grafting. It was on the S2 factor, so it is most sensitive and widely used techniques around the world, and it is a gene difference by mutation and outcrossing. And when there is a mutation and outcrossing, we can detect this one. And it is spread on several chromosomes. So at a time, we are cross-checking several of the chromosomes, fortunately. And it can be done by graft, by tail, ear, or pinna. And this is how the technique is done. I don't want to go in detail, but I just wanted to highlight here that we must have, you see this graft size, graft size must be similar. So it is a fit test. Fit graft, fitting graft. If it is this similar type, there would be mismatch, and it is likely that the animal may not accept the graft even if they are homozygous. And once the animal accept the graft, you can see here the hair growth is in opposite direction, whereas the tail hair graft is this direction. Here also you can see this is the graft accepted in black mice. This is in Swiss mice. And next method is biochemical marker, wherein we have several of the markers on all the chromosomes. but we have to see that at least one marker from each of the chromosome is selected for the biochemical marker. And here also we have to have the critical subset. So consider I have these 6-7 strains, C57, BALC, C3H, DBA, Swiss Bay, and ICRC. So how to identify it? So I have these strains, and then I do one of the parameter wherein there are single band in these C57 and ICRC, and so all other are diffuse band. So I have to differentiate these two strains. So what I do, I check GPD1 marker, wherein C57 has A allele, whereas ICRC has B allele. Next IDH, which will differentiate these remaining 4, wherein BALC C3H is similar, DBA2 and Swiss Bear is similar. Then I do another set wherein BALC and C3H gives the glucose phosphate isomer as different alleles, and again, if you see DBA and Swiss, they give the different. So that is how we have to work out the critical subset. And the procedure is simple. You have to have the sample, maybe based on like liver, kidney, urine. So these are these hemolysis you have to have, and you separate the proteins on the cellulose acid at the electrophoresis, and you stain it so the complex is found, and that is to be visualized this way. So there are 2 different alleles if you see here, and here hemoglobin beta chain, you can see this is single and diffuse bands. These are different strains. For paucity of time, I am not going through all the details. And where it is useful, when their differences are strain specific, and this isoenzyme determination is quick, technically simple, readily reproducible, and inexpensive. Any lab can attain and perform it. But the consideration here is we have to consider all chromosomes. There are some age-dependent markers, some sex-dependent markers like the seminal vesicle protein, and nutritional status like AK1, and also tissue-specific expression. And of course, you have a limitation of storing these samples for a long time. Next method is molecular genetic marking monitoring, wherein we have we call DNA fingerprinting also. So there are microsatellites, mini satellites, and SNPs methods. So SNP is basically a single nucleotide polymorphism, wherein if you see there are 2 different strains, only single base pair is single base is differing. So we have to have the primer which will detect the sequence ending T, and here sequence ending G. So A and G. So we have to see that the primer sequences will have A and G respectively, so that there is a identification of this SNP. And this is how, because there are only in one either C or G, you have to express the reaction. If you see here, there are like only in one sample, and because this is combination, both these reactions will have the band, and single, again single, and BDF1, because that is combination that will express in both the reactions. Here also we have to have the critical subset, otherwise there are so many markers and it is difficult to include each and every marker, but at least critical subset is including minimum markers to differentiate all our strains. So these are our strains. So what we do, like these are the markers we selected, and each one, if you see in 1609, there are DBA, BALC, FUB, C3S, Swiss, and AJ mice. They all have T ending, whereas C57 is C. So we include this first marker, and you will differentiate 5 strains from this strain, C57. Then for the rest of the T, you go to the next marker, you have different allele, and that's how you go on doing the each marker. And minimum 6 marker will differentiate 6 strains. If you add some more strain, it is likely that they will also have similar pattern. And with if there are 10, 12 strains, it is likely that with 6 to 7 markers only, you can differentiate all your strains. Next is microsatellite marker. So microsatellite, is a simple sequence length polymorphism. So simple sequence is like the sequence, consider C57 black strain. Simple sequence is CGA, CGA, CGA 3 times, whereas in case of Balsi, it is CGA, 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 CGA 4 times. So definitely based on the how much repeats are there, the product size will vary. And accordingly, we have to have the primers which will differentiate the each of the strain. And it is the database is available for even biochemical marker, SNP or microsatellite marker, and you can use that database and identify your strains. So this is how, because there are different simple sequence length polymorphism for each of the strains. Our strains have these 3 different alleles when we do the gel visualization. Recently, what we did is one marker at a time. It takes a lot of time, manpower, money also. So we tried to combine 2 markers, in one reaction. So this is combining 2 or more markers in one reaction. But challenges are here. You should have optimum annealing temperature. You have to do a lot of R&D, and then you succeed in giving both the bands in one reaction. There are sometimes change of combination, because these different combinations you are doing. Sometimes the product size is too small. You cannot identify they are merging. Sometimes the different product size is available in literature. For the simple single marker, there are different product sizes, so we have to also rule out that. And sometimes if there is a deviation from literature, so we have to have the interpretation, how to interpret the standard literature, say one product, but we are getting different product size. That also we must keep into mind. And ultimately, sequencing is the last resort in case there are some confusing results. And this is how we did the multiplex. If you see here, 2 different reactions, 2 different markers we took, but here second is not reflecting, I mean not expressing. So we did it again. In these strains we could get, but here if you see, there is very weak expression. Again we tried, again we got, but you can see there are some non-specific type bands. And then here also, this is very good, but again I could see there are some non-specific bands. So finally, then we could, with lot of attempts. Now here you see there are much difference in 2 different products if you see, and it is very easy to read because they are not merging. Otherwise, what happens? Like this marker, it is very close, and with experience, if you know the product size, then you can say, okay, these are 147, 160. Of course, sequencing is the last resort, but at least this much difference must be there while selecting the markers. This is the paper we published recently in Agriculture Science Digest, an associated journal, and this is early this year. Now the question is, what should be the frequency of monitoring? So if you have the foundation stock, expansion stock, and then production stock, different categories of breeding pairs, then in that case, foundation stock should be tested every alternate generation, because that is very critical and we is very isolated. And production can be twice a year, and expansion can be twice a year, and production quarterly. So at least 3 monthly you should have the program. And of course, sample size depend upon how much is the expertise and our what you call the reproducibility of the results. Finally, what we achieve by genetic monitoring. So we can get the quality animals if we have the program in place, and we use the reduce the dependability on the supplier, and we reduce the hassles of import. Everyone knows how difficult it is, and we also reduce variation in results because we have the in-house stock, and there are no variations in batches to batches. We reduce the animal number because they are pure animals, and if you are inbreeding them, then there are homozygosity to 98.6%. We increase the reproducibility of results by doing so, and ultimately we also take care of 3 R's of the Russell and Barge. With this, I thank you for patient hearing. Thank you.
Thank you, Dr. Ingle, for giving a nice talk about genetic monitoring. Now, topic is open for a discussion. If any questions. Thanks, sir.
Yeah,
Hello.
please.
So for space-specific monitoring, what about homologicity? In addition to skin grafting, is there any other risk? And how frequently you do it?
See, when you talk about the homozygosity, it is the relative term when you know that you are inbreeding the animals, then the homozygosity comes. Very few people may be doing homozygosity, but the main objective is having mixing. If the animal strains like Balpsi, Swiss are being maintained in one room, and if they are contaminated, the production would be albino only. It is very difficult even for me after 30 years of experience to identify whether it is contaminated unless I do. So basically the genetic monitoring is for contamination of two strains. And if at all you are concerned about the homozygosity, then you must keep the record of your inbreeding. And what is inbreeding is like everyone knows mating brother, sister, or the related animals. And that's how you can identify how much homozygosity is there. If you attain 20 generations, then 98.6%, and you cannot go beyond that one. So basically not for homozygosity, but with the, for the, the mixing of the genetic mixing of the strains, it is useful.
Instead of homozygosity, we can use many microsatellite markers on a particular locus.
Right.
Yeah, for example, that will be the best thing rather than
Yeah, but you have to have include too many
markers.
markers.
Each chromosome will have a particular, allele. We can select a particular microsatellite, and we can see whether that particular. Otherwise, we can't see the mutation of a particular.
Right. But as you say, on each of the marker, suppose you consider say SNPs. So there are hundreds of markers on each chromosome. So it is not possible to include say 100 all markers and then into 20. It is huge work and it is very difficult. Even Jackson or the Charles River, I don't think I will.
Then how will you find if your inbred strain is getting some mutation or not?
Yeah, so when there is a mutation, of course, if it is expressible.
Not in the phenotype, I'm saying in the genotype.
Genotype, the last resort is sequencing. And if your experiment is too critical, unless you do the sequencing, it is very difficult. Or if it is expressible in any forms of the either protein or the phenotypically, otherwise it is difficult to get the mutations.
Just I was seeing your biochemical markers, whether you are able to distinguish between C57, BLS, BSJ and N using biochemical markers?
Yes, there are differences. Since we are not maintaining, we are maintaining 6J, what we do, we include that. But when I have different markers, I also have the literature wherein these N or the J, they show different alleles. So I have to include that marker and then I can identify.
PCR we can use this inherent gene is there, but I'm just asking about this.
Yes, biochemical is also possible.
Okay.
Yeah.
Right. Thank you. In the interest of time, we are not taking any more questions. Dr. DA want to ask one quick question.
With the permission.
Yeah, quick question. Yeah, with the experience, you're having the experience of almost 30 years of the animal breeding. So, do you come across any inbreeding coefficient when we are maintaining the inbred lines?
Yes, yes.
And
So
what are the actually methods you
overcome
to do the avoid the inbreeding
So
coefficients?
all of us, we procure the animals from outside, maybe internally or outside. So what we do, our funda is when we receive the animal, say from a source, international source, we consider it as a zero generation. So what we do, we start from that as our inbreeding. And in 2 to 3 generations, we see a lot of mortality or there are no breeding and this stunted growth. So what we do, whatever we can rescue the animals, we have to take extra care of them. So those only animals we take further for breeding. And everyone will undergo this, inbreeding depression. So those which are sturdy animals, you bank on them only, rather, targeting all the colony and take them further. And after 3 to 4 generation, then you are done. Then they are established unless there is variation in either food, environment, or handling. Otherwise, they become stable after 3 to 4 generations.
So can you vouch on some microsatellite markers which can be actually considered?
So Dr. Diget, thank you. Now we will not be able to take any further question. You can discuss during the break. Thank you, Dr. Ingle, for giving a nice talk on the genetic monitoring, and it has sensitized all of us to take attention and take care of the genetic monitoring as well. Thank you.
Thank you, Arvind sir. It's always a privilege to have you on the stage with us and giving your knowledge to us. As a token of appreciation, we would like Dr. K.V. Patel to give a moment to Dr. I invite Dr. Mohan Wani to provide a memento to Dr. K.V. Patel and Dr. Ravi Krishna to provide a memento to Dr. Rahul Taru. For the next session, we'll have Dr. Swapnil come in and give the details for the same.
Thank you, Dr. Thomas. Dear all, now we are going forward for the next session. The topic is ethics, welfare, training and education policies on animal experimentation. So for this session, I would like to invite as a chairman on a DIAS, Professor P. Prakash Babu, Senior Profession, Department of Biotechnology, University of Hyderabad. And as a co-chairman, I would like to invite Dr. Pranjali Pure, CDFD, Hyderabad. So in this session, we'll start with the first topic, CPCSA aims, rules, function, and recent notification of the CPCSA for nominee and organization. For this topic, I would like to invite Dr. Vivek Tyagi, Senior Consultant, CPCSA, New Delhi.
Yeah. Yeah, very good afternoon, all of you. I thank the organizers for giving us opportunity as chairperson and co-chairperson. At the same time, Dr. Mahesh and Dr. Hongle, both of them, they have provided a wonderful lunch. That is difficult for people to sit on either side. And it's very difficult to the speaker to convince the people to awake. Hope, I think Dr. Tyagi, Vivek Tyagi has been there in CPCSA. I don't think any introduction is required for Dr. Vivek. He has been associated with this, and all CPCSA nominees are all the pharma and biotech industries knows him. He has been serving this in various capacities, and he has been an instrumental in running the actual show, and we are really grateful to him. Now we will listen to him about this particular regulatory aspects of this CPCSA.
Thank you, sir. Just a minute. So, a very good afternoon to all of you. I am really grateful to the organizers for inviting me here to discuss the guidelines of CPCSA during this presentation or conference. I can see the pain for organizing such conference at a big location. So I really congratulate all the organizers, especially Dr. Mahesh sir. Then without losing the time, any problem is there? So, CPCSA is a statutory committee of the Government of India, and it is constituted under Prevention of Cruelty to Animals Act 1960. This committee has the aim to prevent the infliction of unnecessary pain or suffering on animals. And to achieve this aim, the committee has been constituted under Section 15(1) of the PCA Act 1960. Now there are 19 members in the present committee, where our Joint Secretary Dr. O.P. Chaudhary ji is the chairman of CPCSA, and Joint Commissioner in Husband Dr. S.K. Datta ji is the member secretary of CPCSA. One of the senior member of CPCSA is also here with us, Dr. S.G. Ramchandra ji. Dr. Majumdar sir is also here. No, it's fine. No? Under the PCA Act 1916, some duties and powers have been given to that committee. Since I already explained that CPCSA is a statutory committee. Statutory means it has a legal powers to regulate the experimentation on animals, to control and supervise the experimentation on animals. And for this purpose, this committee has formulated one rule. It is called Breeding of and Experimentation of Animals Control and Supervision Rules 1998 to regulate the experimentation on animals. All the requirements are there in these rules. The rules have been further amended in 2001 and 6. Under the provision of above rules, any establishment who are engaged in biomedical research, including testing of herbal drugs on animals, are required to get themselves registered with CPCSA to constitute their IAEC. The mandate: registration of the establishment conducting experiments on animals, registration of the establishments engaged in breeding of animals also, and approval of animal house facilities for small and large animals, permission for conducting experiments on large animals, conducting awareness programs like conferences, workshops, and seminars, etc., and training programs for nominees of CPCSA, who are the representative of CPCSA at the regional level, at the institutional level. Now, one Rule 3 is there, which says, Rule 3 of breeding rules, that no establishment shall carry out any business of breeding of animals or trade of animals unless it is registered with CPCSA. Under its sub-rule, the provision of registration is there. Nutshell, we can say anybody who wanted to conduct breeding of trading of laboratory animals, they are required to get themselves registered with CPCSA. Further, Rule 4A says experiment on animals. If somebody, some organization is conducting experiments on animals, again they have to register with CPCSA. One interesting fact is there: if somebody wishes that they can continue the experiments on animals, and what if the registration is not this thing required, or registration is not happened with CPCSA? Such establishment, it is provision under rules, breeding rules and act. Such establishment shall stop performing experiments on animals or breeding of animals or trade of animals for use in experimentation if the registration is refused to it by CPCSA. If anybody is not maintaining the facility as per the requirement and they are not following the guidelines, the registration can be refused and they need to stop at any work. Then some documents are required for registration that can be seen on the website of CPCSA. For saving of time, I'll skip it. Some specific documents are required. They are to be submitted in a specific format through the web portal of CPCSA. Then IAC. At the time of registration of animal house facility, there is a requirement for constitution of IAEC at the regional level. Anybody who are having the CPCSA registration, they have the Institutional Animal Ethics Committee approved by CPCSA. The duration of this IAC is for a period of 5 years, and which will be required to be reconstituted every time at the time of renewal of registration with the new members. What is the composition? One biological scientist is required in this committee. 2 scientists from different biological disciplines are required. 1 veterinarian involved in the care of animals. It is mandatory from the institute. 1 scientist in charge of animal house facility of the concerned establishment is required. The chairperson and the member secretaries are to be nominated from the above 5 members. They can be designated. Some member can be designated as chairperson, and other one can be designated as the member secretary of the IAC. The important point is, in any case, the chairman should be from the institute, and the member secretary should be from the institute of the concerned animal house facility. Since the chairman and member secretaries are administratively responsible for the activities of IAC, we receive some applications where people are nominating other members from the different institute to chair the IACs. It's not a good practice, because they are the responsible person for the activities of IAC. They should be from the institute only. Having a veterinarian in the IAC is mandatory for taking care and handling of laboratory animals. After receiving the 5 names from the institutes, we constitute the IAC with our nominees. Most of the nominees are sitting here in front of me, and they know the composition of the IAC from the CPCSA side comprises main nominee, link nominee, scientists from outside of the institute, and socially aware nominee. Link nominee is the substitute of main nominee, and he or she can be invited if the main nominee is not available for a particular meeting. However, once in a calendar year, it is mandatory to invite link nominee to update him or her about the activities of the IACs. Requirements. The duration of IAC is for a period of 5 years. Revision can be made in the IACs in the deserving cases where the requirement is there as per the requirement of the institute. 1 confidentiality form should be signed by the IAC members. Conflict of interest to be signed by the IAC members. And SOP, it is very important point. We are receiving so many calls from the institute, what to do in this case. PI is not presenting, the student is asking this thing. These are not our issues. We have framed the IAC at the institutional level. Now you need to manage the things yourself. Then we are asking the establishment to frame the SOPs as per the requirement of a particular institute. The requirement of a CRO is different, the requirement of a pharmacy colleges are different, and the requirement of veterinary colleges are different. As per their requirement, they need to frame the SOPs within the IAC members with the consent of chairman and main nominee of the IAC. Please ensure who are the nominees of CPCSA to ensure that SOP should be framed. Quorum of the IAC members is 6 members, and once in 6 months the meeting is minutes to be sent to CPCSA by the establishments through the online portal only. Inspection report of the animal house facility is to be sent to the by the nominee once in a year. It means annual inspection report. Foreign nationals shall not be accepted in the IACs of the establishments. Now functions. The function of the IAC is to review and approve all research projects involving use of small animals. Small animals up to the level of legomorpha. Above that level, the IAC can only scrutinize the protocol and send to CPCSA for the final approval. That has to be taken care in the institutional level, that the protocols where large animals are being used are to be sent to CPCSA for the final approval in any case. Some exceptions are there. Dr. Kripali madam will discuss later on. Some minor non-invasive surgery are allowed in ICAR institute, in central government funded institutes. Some procedures are allowed where minor blood collection is required. That procedures can be approved at the level of institute. Then after 5 years, renewal application is to be submitted to CPCSA. Again, 5 members are required to renew the registration and reconstitute the IAC. And after receiving the application, we renew the animal house facility. Condition is that the inspection reports of previous years and the minutes of IAC of previous years and the annual statement of large animal use where large animals are there are to be submitted prior to application of renewal. Now some different procedures are there: submission of research protocols, revision of IAC, change nominee. I'll not go in detail. These can be seen on the website. Interesting point. Recently, we have issued 1 or 2 notification where clarity is required to be given. Number 1 point, the notification is issued on 31st August 2021 to clear some doubts. Number of research protocols to be placed in the IAC meeting should be decided by the chairman of the IAC with the consent of the consultation of the main nominee. We'll not look into it. Somebody is saying that your PI is submitted, your institute is submitted, member secretary is submitted 21 protocol, but our rule is to recommend only 20 protocol. Can we hold the again IAC for 1 protocol? This decision has to be taken by the institute. They know the thing, and people are asking CPCSA, they are sending letter to us that he is not considering our 1 protocol since limit has crossed. This number is to be decided by the chairman of the IAC with consultation of the main nominee. Then, to solve this issue, the research protocols will be sent to the members of IAC at least 15 days in advance so that they can see the things, they can review the protocols in advance. All the establishments registered with CPCSA should convene minimum 2 meetings in a calendar year. In case of no agenda or protocol to be discussed in the IAC meeting, the meeting should still be convened to check the status of already approved research protocols. Sometimes we see that there is no requirement. We are not conducting any experiments on animals this year. What is the requirement for IAC meeting? Then you please invite the members to update them about the already approved research. What is going on? And this is very important point. Now we are taking strict action against the establishments which are not conducting the IAC meetings. We are receiving the letters and we are asking them, if you are not conducting any experiments on animals and requirement is not there, you please send the application and then we will cancel the registration. There is no requirement of registration. Nah? Then with reference to the disclosure of name and classification of the compound, however, Kripali madam will discuss in detail, some basic information is to be submitted to the IAC. Not exact, but to know the mode of action of the compound. Such basic information is to be submitted to the IAC. Then seating fees. The main problem. Why to go to the IAC meeting? I am not receiving requisite fees. I am expending from my pocket. The finance ministry has issued one circular, and the people who are working in the organizations funded by the central government, they are bound to follow that order. Therefore, we have also issued one guideline to facilitate the institutes that as per this circular, sitting fees cannot be provided to the people who are working in the central government. But we know that something is required. Nobody will go without any expenditure is required. Nobody will go with their own pocket. What to do? Like we are giving the fees to the examiners. We are inviting examiners in the vivas, na? And we are also inviting the lecturers in the different lectures. Everybody has some specific fees for these purposes. That's why we have given one point to solve this issue and to facilitate our establishments and nominees. Then the institute can frame their own policy and guideline to provide the remuneration for scrutiny of the protocol and the inspection of animal house facility. This is a very clear point. But some friends are there, they are this thing utilizing this order, and they are showing that we have no policy. No policy is there in our institute. Hence, it is not required. So it is my request to such members, kindly frame some policies, because this is for facilitation of your work only. So some establishment which are not having such policies, you please frame your own policies to tackle these situations. And one more important point, just I'll take half minute more. We have also issued one standard pro forma for submission of minutes of the IEC meeting. Some basic requisite information is to be submitted in that pro forma. Please have a look of this pro forma. It is available on the website. Since this much information is required to be submitted, and it has to be there in the minutes of the IEC meeting. In addition to this point, you can also add your own points. And one more point is there. Nowadays, people are conducting online meetings. In case of online meetings, the minutes are to be submitted to CPCSA. No signature is required. People are just copying and pasting the signature on the minutes. Since it is understood that meeting is conducted through online, then how can we sign? So nothing is required. You just take a screenshot of that meeting, ask your nominee to give his comment through email. And we have that database of the nominee. We can see that Dr. Arvind Ingleji has given this comment to Dr. Rahul Thoratji, for example. You ask your nominee, sir, as per meeting so and so date, deliberately I'm telling this language, this is very much required, and we are facing very problems in this situation. Sir, so and so meeting has been held on this date. Now I am forwarding the draft minutes. Kindly review and give your recommendation. Main nominee will again reply the email that I recommended protocol number 2345, and with regard to protocol number 7, this is my suggestion, kindly incorporate in the minutes. And that paper, that email is to be submitted to CPCCL in place of signature sheet. No signature is required. It is clear? Then thank you. Thank you for giving me the opportunity. I think I conveyed my message in a short time. If you have any question, then I'm happy to give the answer.
Yeah, thank you, Dr. Chagi. I think your points are very clear and loud. I hope all our members and the people must have heard of it. Yeah, please, one or two questions, please.
Yeah, I have one question. What is the definition of small animals? This thing is, does it include?
Up to the level of legomorpha, sir.
Sir, the two insects come under small animals. Suppose if I want to do research on mosquitoes.
Sir, invertebrates are not covered under the CPCSA guidelines. The definition is there in the experimental guidelines. We are dealing with the laboratory animals. If you wanted to conduct any experiment on Drosophila, the recommendation of IEC is not required since it is not regulated under CPCSA guidelines. But the point is that whenever you will go for the publication, that journal will ask the IC number. This is the problem.
Yes.
And we are receiving so many calls that please also regulate invertebrates. We don't want to regulate invertebrates, but this is the requirement of the scientists. They want to regulate because they need to publish the research publication. It is not mandatory. The conducting experiment, you can conduct the experiments, but we will not ask you to get the recommendation of IC. Please come, Dr. Kripali, madam, since we have to rush to the flight.
Yeah. Chairperson rightly said that message was loud and clear. I have one query regarding the annual inspection report. You know, since the pandemic began in 2020 and 2021, so it was not possible for the nominee to inspect the facilities during these 2 years. So how do you just go with for renewal?
I understand. If no inspection has been carried out during the pandemic period, there is no need to submit the backdated report. You just visit the facility in the current actual period and you submit the report of the current dated. We will not ask you to submit the backdated report. You please, honestly, you mentioned that due to pandemic period, the inspection is not conducted. However, I am submitting the latest report and will consider it. Thank you all. Wish you all the best.
So thank you, Dr. Vivek. Yeah, madam, please. So the next speaker is Dr. Kripali Pandey. So she is also very well known to the community here, and she has been associated with the this kind of training for a long. And wherever there is a training, actually these two people are actually attending and giving us the latest information and the new changes if there are anything and small clarification required. So with this few words, I think.
Thank you, Dr. Vivek Tagi. So, sir, I request you, Chairman, to present our memento to Dr. Tagi. So, I would like to invite one more time Dr. Tagi.
Dr. Vivek, please come.
Will accept this memento, sir. With this continuation, I would like to invite Dr. Kripali Pandey.
Good afternoon, all of you. So I congratulate the organizing team for organizing such a beautiful conference. I'll be starting off. Yeah. So I'll be just taking the very main points which are expected out of a CPCA nominee or any establishment. Won't be taking much time. So I'm going to just take the CPCA guidelines on animal experimentation and the Form B, which is the most important form because all the research protocols, be it on the small animal or the large animal, they are submitted in the Form B. The Form B for small animals is maintained in the establishment. However, the Form B for large animals is submitted to CPCCA for approval. So first of all, I'd like to take the guidelines. There are few guidelines that have been issued by CPCCA. The first guideline is for the laboratory animal facility, which has been revised in the year 2015. Then there are few guidelines for the care and management of equines, which are being used for the hyperimmune plasma production in the country. These have been framed in the year 2001 and they have been revised in the year 2005. Then there are some guidelines which have been recently framed, like the CPCA guidelines for poultry and bird facility in 2020. Then there are very important set of guidelines for the reuse and rehabilitation of large animals post-experimentation in 2020. There's also a guideline of CPCA for experimentation of fishes, which have been framed in the year 2021. And Dr. Ramachandra sir was played a very vital role in framing the guidelines. All these guidelines, they are available on the website of CPCCA. You can just go and visit them anytime. And it will be always better while you are making the construction of an animal, before the construction of any animal house facility. Also, during the time the IACs are conducted, it is always better to just go and visit these guidelines. So today, I'll be just talking about the guidelines on regulation of scientific experiments on animals. Under these guidelines, we have few principles. So there are 5 principles. The principle number 1 talks about the experiments on animals. So a lot of people have a lot of confusion that what is experimentation basically, how to differentiate experimentation from, how to define experimentation. So experimentation has been defined as in the breeding rules. And you can just go through and you can see that whatever is written here, everything is considered as experimentation. Sometimes the institute has query like, we are just using animals for taking 0.5 ml blood. Will this be an experiment? Sometimes they think that this won't be an experiment. But then later when they go for publishing the journal, then the student faces the problem because they ask for the animal ethics that number. So then it becomes a problem because then you can't go for backdated approval. So better to consider this definition. Principle number 2 talks about the use of animals on the lowest phylogenetic scale first. But whatever model we are using, it should be kept in mind that it is being chosen, keeping in mind the scientific validity of the result. Experiment should be designed with minimum number of animals, but not just blindly going with minimal number of animals. The statistics should be proper. It should give a statistically valid result at 95% level of confidence. Alternatives should be given preference. However, if alternatives are not being used, then proper justification should be provided. Now, this is the, somebody asked what is small animal. So this is the relative sentience of different species, and according to which the animals are considered here. So you can see that anything above the higher the level of invertebrates in terms of level of sentience, they require regulation. Thus, anything like rat, mice, fishes, birds, they are all small animals. And above the level of lagomorpha, they are considered as large animals. I know in veterinary colleges, we use the term large and small in very different context. For us, small is like which looks small, and big is like which is big. We also have small ruminants and large ruminants, but in CPCA, we'll just go with the level of sentience. Then principle 3 talks about the minimization of pain and the use of anesthetics in any experiment. So we should always keep in mind that the procedures that are causing pain or suffering to human beings will also cause similar kind of pain and suffering. I mean, this should be the ethics in ethical point of view. It might not appear logical at times, but it should be ethically considered. So there should be proper use of analgesia and anesthesia during designing of any protocol. Principle 4 talks about the moral responsibility of welfare after the experiment is done. So CPCCA has come up with certain conditions wherein euthanasia is allowed. First, when the animal is paralyzed and it is not able to perform its natural functions, it becomes incapable of independent locomotion and or can no longer perceive the environment in an intelligible manner. So you can see how what are the condition of the animal after any experiment, and accordingly you can take the decision. Secondly, during the course of experimental procedure, the animal has been left with severe recurring pain, and the animal exhibits obvious signs of long-term extreme pain or suffering. Even I would like to include here that in case of studies which are continuous in nature, particularly hyperimmune plasma production from the animals, be it equines or sheep and goat are also being used. So we need to, if after CPC is giving annual approvals to them. So the main reason for giving annual approvals is that so that every year before the start of the next cycle, at least the veterinarian report is there about their blood. All the blood reports are there. All the testings are done. All the biochemical parameters are checked, and then only the animal is taken up for the next cycle. And if the animal is, it is learned that the animal is really weak and is not responding, they should be rehabilitated. And if the animal is suffering with pain, with the permission of, on the advice of veterinarian and with the permission of CPCCA, you can always go for euthanasia. In situations where non-termination of animal experiment experimented upon would be life-threatening to human beings or other animals. So third case, where in case of any safety or potency test, for example, if any zoonotic organism or any infectious organism has been tested and non-termination would be life-threatening to the human beings or the other animals, in such cases, euthanasia is preferred. So the cost in aftercare of rehabilitation, it should be part of the research cost. And of course, CPCCA has given its guidelines based on that. And you can consider, you can see the, look at the guidelines for the cost. Costing is also being given there. Principle 5 talks about the proper care, handling and use of experimental animals. So it basically talks about the veterinary care that is to be given. The living conditions should be appropriate. Housing, feeding care, it should be directed by a veterinarian who is trained and who is dedicated. In all circumstances, veterinary care shall be provided as necessary. And CPC has already given the circular that 24 hours veterinary care is mandatory for any establishment to get registered. There is a small exemption that the CPC SEA committee has given. Most of the large animal research protocols have to be sent to CPCCA. However, the research protocols dealing with withdrawal of or below 0.6 ml per kg body weight of blood from large animals on a weekly basis for the purpose of experimentation on feeding trials, breeding experiments, livestock management studies, which require blood collection from experimental animal to further study the clinical parameters and for the purpose of clinical disease diagnosis, field studies or thesis studies, they may be approved by IAC. But you have to see that the said study should fall under these studies, and this is applicable only for ICR and ICMR, veterinary and agriculture universities and government funded institutions handling large animals. So we should keep this in mind. And basically this has been given, this exemption has been given for the master's thesis work. So I will just take the Form B because as the National Committee members are also here, there is a lot of lacuna still which comes up. The form is getting screened by the nominees also. The IAC is doing its work. Yet when it comes to CPCCA, sometimes some of the forms are so frivolously filled that it appears as if nobody has ever gone through the forms. So the form is very, very clear in itself. The points speak, and the questions that are put in the Form B, they are very clear. And sometimes the people just omit the questions which they do not feel like responding to. So this kind of tempering should be avoided because it is something which has been published by the government of India. It shouldn't be taken so lightly that, okay, I don't want to respond to, like for this one. Now, if somebody doesn't want to fill the registration number, they don't just feel like filling it, they'll just remove point number 2. So this kind of thing should not be done. It is something which should be filled properly. So the point number 1 is very, very clear. You just have to mention the name and address. The registration number is to be mentioned, which has been given. I don't know why is this so difficult. Some of the forms we receive, they write some other registration number, like their company registration number. Now, what is CPCA going to do with your company registration number? I don't understand. So this is very clear, and it should be filled up as the way it is being asked. Date of registration number, date of the registration. Then also sometimes during renewal, like the organizations must have been registered long back, but during renewal, there might have been some amendments in the registration number. So it is requested that you write the present registration number, latest registration number. Don't write the registration number of the time when you were renewed, maybe in 99. So don't write that. Just write what is the present in the latest renewal letter, what has been given, what has been provided. It should be mentioned here. Then the date and number, name, address and registration number of breeder from which the animal is acquired. Even if it is from your in-house animal, then also just mention it. So here also we encounter this thing that people just don't feel like filling. They think that, okay, CPCA knows that we are registered for in-house use. Let's not fill this, just omit this point. So let's just avoid all these things. Then place where animals are presently kept. In this section, you should write the address of the animal facility. Place where experiment is to be performed. So here you should write where the experiment is carried, and if it is different from the above, then just mention that address also. Date and duration of experiment. Now this is the entire date and duration that you are taking for the experiment. However, there will be one more point which will come, the date and duration of the animal experimentation. There you should mention what would be the animal experimentation duration. Then what is the type of research work involved? We have already given it all the choices are given. So you just need to select one. Then this is a section 2. Now the Form B has 2 sections. Section 1, the one I have just discussed is section 1. Section 2 is this one. Now the first point in section 1, section 2 is project title. It is, please, as a nominee and also as an IAC person, just see that the topic which is coming, which is appearing in the Form B, should be the same topic that has been recommended by the IAC. Sometimes what happens is a broad study is approved in the IAC, and a part of that, of course, that is approved, but a part of it is sub study is written in the section 2. So just avoid this. Whatever is the topic which is being discussed in the IAC should be the one which is being proposed in this Form B. Then principal investigator, here we need to write complete details about the investigator along with the designation, department, contact number, email ID, everything. Funding source is very important. There should be, we have written that please attach the proof of the funding source. However, I don't think we have ever received a protocol with the proof of the funding source. So it is a request that if it is written, then just abide by it. In this section, there should be a brief note on the source and address of the funding agency. And you should write it, whether it is in-house, whether it is government, whether it is private. It is needed to know. Then the duration of the animal experiment. So here you tentatively you mention. So exact dates, we don't ask for the exact dates. You can just write that the date of initiation maybe once we get the approval from CPCCA, and then the completion like after 6 months. So not like exact dates, we cannot, we don't actually expect also, but this should be at least 6 months or 7 months or 8 months or 1 year, it should be written. Describe the details of the study plan to justify the use of animals. I don't know for what reason we don't get proper study plans, because of which we have to again and again go back to this establishment and ask for the study plans. Ultimately, they give us the study plans, but then it is unnecessarily delayed. Now, CPCA is really trying hard to process the requests very fast, but because of unnecessary questioning, the protocols come back to us and we ask for the things they don't give in the beginning. Ultimately, they give it, but by the time they give, already 3-4 months expire, and then they say that, oh, CPCA takes like 6 months to clear the protocols. So this is not the way. If you give everything properly, it will be done in a month. So in this section, the investigator should briefly mention the objective of the study. The detailed study plan should be there, along with the proper classification of all the groups of animals, justification for the use of animals. They should be in a layman language. It might not be in a very technical language. It should be in an easy language. And too many scientific terms should be avoided, because everybody in the IAC at least should understand what the study is. So the primary aim should be convincing the IAC. And for IAC also, the primary aim should be to be so tough that even to ask the PI or the person to explain the study properly and then recommend it to CPCCA. Now, animal species required. The detail of the species and its common name should be provided here. Age and weight, we never get the age and weight correctly. We have to again and again ask them what is approximate age, what is the approximate weight. The gender, it should be properly written. Number, it should be year-wise breakup. Number of days. Why is animal usage necessary for the study? You have to briefly mention. References should be mentioned and cross-checked. Whether similar study has been conducted, you should write it. Yes, it is conducted. Nobody is going to do it. Yeah, just 2 minutes. Why are particular species selected? You have to write why the specific species is being selected. Give the justification for that. Why is estimated number of animals essential? Justify. Are similar experiments conducted in the past? If similar studies are conducted, you have to give. Accordingly, in point number 9, you should mention all the potentially stressful procedures. And also, you should write what is needed there. Will the survival surgery be done? Please give all the details of the survival surgery here. Protocol 12, it is very important to mention if it is being rehabilitated, you mention that it is being rehabilitated as per CPCA guidelines. And accordingly, you respond for euthanasia also and carcass disposal. 13, you give if the animals are being transported from somewhere, give the details of transportation. And 14, if it requires any organism which is infectious agent, you first you get the permission from IBSC and then you submit the protocol to CPCCA. These are the investigation declaration and certificate which should be signed properly. It is very clear. So this is all about Form B. I have exceeded my time. I hope it is clear and we receive better Form Bs now on. Thank you.
Thank you, Dr. Kupali, for wonderful talk. And I don't think any doubts you have because she made it very clear. Okay, thank you very much. So she don't have time actually. They have to go to.
In section 1, under serial number 6 and section 2, serial number 5, what I understand is proposal is the project and experiment is a set of experiment. So if you can modify it under section 2, serial number 5, duration of animal experiment, it should be duration of project. Or in section 1, you can modify either proposal and here the experiment, and that will solve the problem. Thank you.
Yeah, ma'am. I request chairperson, please release it.
Yeah, I think somebody can, yes. Yeah, next speaker is Dr. Ramchandra. He's eminent and experienced person. Yeah, he is also the main.
So I would like to invite Dr. Ramchandran.
Yeah, so
Thank you, Dr. Kripali. Thank you, Dr. Venkateshwar. We can understand your arrest.
Thank you.
So now I'm going to hand over to Dr. Ramchandra.
Yeah, so Dr. Ramchandra is the director of NORF and he is one of the instrumental in organizing this conference. And also he is also instrumental in making a lot of guidelines also in the CPCSA. I think any one of you having a doubts also at the end of his lecture can be clarified. So Dr. Ramchandra.
Okay, so good afternoon, everybody. So I have been instructed to finish within 10 minutes. Okay, I'll try to justify. I think most of you are from industry or GLP accredited facility or ALAC accredited facility, so you know the importance of the training. But still, some academic institute really would like to work hard on training their animal care personnel. So I'll quickly go through that. So why training is required? Basically, the quality of research and welfare of laboratory animals greatly depends upon the competence of those who are handling the animal or caring the animals. So hence, a comprehensive training is very much important for the employees in any laboratory employees. If you don't train them properly, then the error can happen in any place, even for the animal facility itself or even for the scientists also in the outcome of their research. So basically, training is an important prerequisite to work with laboratory animals and animal facilities. Even the CPSA guidelines, the previous speaker also said. So even CPSA guidelines also suggest that there should be proper trained personnel in the animal facility, and they should be properly trained before handling the animals. So several organizations already emphasized this mandatory training prior to the use of animals. So most of the facilities are now abide by this rule. But still, there is some lacuna in some of the facilities. So only for those, I think that they can give more attention on this rather than others. Okay, and there will be there should be different level of training program in animal facility because there are different sets of people will be involved in taking care of animals or conducting research in the facility, like animal care technicians, supervisors, veterinarians. So hence the training cannot be uniform for all the people. So they should be at different levels. And again, so as I said, the animal care personnel or supervisors, scientists, investigators should be trained in the relevant field to perform the procedures based upon the kind of work what they are intended to. And so according to that, the institute can formulate proper training program. And again, certification, a lot of organizations have come up now. So the training and certification, they are giving for the different kinds of people in the facility. And so it has also evolved as a career path for professionals nowadays. So this I'll skip it. Again, some of the large facilities, they do have a separate unit called quality assurance unit. So there will be trainers will be there. So they'll keep on training different kinds of people. Where in small facilities, we don't have many people to train the staff. So depending upon the size of the facility, so you have to employ a trainer also, and it should be a continuous program. You should not stop after one time training. Okay, and even CPSA guidelines suggest that institutions should employ trained people in laboratory field, and formal on-the-job training is necessary. And even AVM, American Veterinary Medical Association guidelines also suggest that organization mission and commitment is important to engage and provide professional training in terms of newer methods and techniques along with availability of materials for their research. So there are certain different countries have different guidelines, but whatever the country it may be, but the training is mandatory for before handling the animals. So this one already. So actually, so there, so institute can collaborate with other organizations, and then they can train their people also. There's also with either national organization or international organization. So they can collaborate, and then they can either on the job or in the continuing education program off the site also is possible. And again, training requirement in education or animal-based research and experiments. So hence, a new employee needs initial training based on their specific role, as I said earlier, and their participation in the training workshop is very important within 1 year of employment. So experienced staff or the seniors can help them, and they have to participate and they have to supervise in the area of their expertise. So the basically primary goal should be to include the basic biology of laboratory animals. So irrespective of their cadre, they should know what's the biology of the animal and the importance, how to take care of, how to maintain the animals. So that should be the basic training, and then subsequently you can go for advanced training depending upon their specialization. So learning is actually a continuous process, and one should attain higher levels of knowledge and understanding by training and developmental opportunities, which in turn provides a better care for animals. So this also strengthens workplace or animal care program, and also proactive training framework with periodical sessions will help the animal care personnel also. So even WHO also suggests that there should be a good training program should be there, and even national research guidelines also recommends a suitable format or seminar or lecture should be formatted for training their officials or personnel. Okay. So it's again essential that the institution should assess the current level of the staff proficiency and required to be a suitable framework, and it should be a continuous program. It should not be one-time training program. And there are many methods of training. So one is a continuing education program. So it's basically it's applicable for scientists, investigators, and study directors, and also on-site program and sometimes workshop also will be organized by various organizations like FELASA. I think Taru is having a tie-up with this FELASA, and they are conducting one program. And again, ALAS also is conducting regularly the training program. And a lot of institutes in India are conducting the training program. I'll come to that in subsequent slides. And again, you can also comprehensive give training by visiting other vivariums. You can send your person one-to-one training program also is possible. And again, training on laboratory notes by veterinarians and investigators on-site specific requirement is also possible. I think yesterday I've seen Dr. Anup and Dr. Sharma, they were actually demonstrating the surgical techniques, the implantation. So it's highly skilled technique, and this kind of training is possible only with one-to-one training. Otherwise, mass training would be very difficult for that kind of operations. So that's also possible depending upon the need. So you can send your personnel to the respective institute and get them trained. So then the next speaker is going to talk on actually some of the international programs, training programs are available. So both on-site and off-site are available. So I'll just brief them about that. One is FELASA, it's Federation of European Laboratory Science Association. And the next speaker is going to talk about the FELASA, so we'll not touch upon that. So they have different training programs for different categories, like category A, B, C, D, for different personnel in the animal facility. So I think he's going to speak on that. And next one is ALAS, so American Association for Laboratory Science. They also have a lot of educational programs and certification programs. So a lot of programs. You see, you can become either a member to this ALAS and you can get all the information. Or even some of the LASA members also have access to this because LASA is a member for the e-library. Few people have access to this material. Large number of information is available in ALAS library. So one can go through that. Otherwise, you can directly become a member and learn all this. And they have various programs for technicians, like assistant laboratory animal technician program and laboratory animal technician and laboratory technologist. This is basically for technicians. So a couple of people from India also have already obtained this certification from ALAS. And in addition to that, they also have management certification because running the animal facility is a highly skillful job actually. So for that also, the higher level person or manager can be sent or given proper training as per this program. So ALAS has a very robust program for managers also. And similarly, so Canadian Council for Animal Care also has a training program. So if you go to their website, so you will get all the information. So you can browse through that, what are the program available. But these are all international programs and it costs a lot of money. So that's why, so I think it's better you look into this section. So training opportunities in India. So we do have a lot of training opportunities, but only one constant what we have is right now. So at one portal, all the information is not available. So hence it may be very difficult for the people to browse through and know where exactly what program is going on. So probably I think in another 2-3 months, we are going to have one portal from RBR, so wherein we are going to keep all this information. So if you log into our website, you will get all this information on the training opportunities, or job opportunity, everything. So in our portal, that's our plan. First one is the LASA. I think LASA is regularly conducting workshop and conferences like this. So they are also conducting regional workshops. So I think if you go to their website periodically, so you will know. So for different parts of the country, they do conduct some workshops with the local institutes. So people from that area can get benefited from these workshops. And National Institute of Nutrition, NCLAS, actually has a very robust training program, and it's the oldest training institute in the country. I think today morning, Dr. Suresh is telling. So they started way back in 1970 or something. So now actually one training program is going on, and that's 52nd laboratory technician course is going on from June 1st. This is a 30 days course for technicians. And they also have a training program for supervisors and also for veterinarians. So depending upon the need, so you can approach the NIN and get trained. And apart from that, Actrec Mumbai is also conducting a lot of programs, observership for 15 days and summer training program. I think it's not very clear, I'm sorry. And short term training program for 1 to 3 months. So Dr. Ingle is here, so you can catch hold of him and then you can find out so when is the next training program. And similarly, this Tanuvas is again organizing two program this month in association with the FELASA. This is for scientists and also veterinarians, 10 days program from June 21st to 29 and another 12 July to 22nd July. So those who are interested, then they can really get registered and get trained. Okay. So Dr. Ramesh is here, so you can contact Dr. Ramesh for further information. And NCVS Bangalore also is organizing one course on the basic biomethodology of laboratory mice and rats, starting from July 4th to 8th. This is 1 week training program. So every year they are conducting, and this one really it's very useful. So 1 week people can go there and then get trained. And next, CSIR also is organizing in Mysore every year 1 week program. Probably I think this year it's got postponed. I think Dr. Muthukumar is here. So I think this I saw their website yesterday. So this is also a very robust program. So every year, I think around 25 to 30 people get trained in that program, I think. So it's really a good program. So see, most of the time, so it's logistic is also very important because people from North India, it's very difficult to come to South India. So that's why the program at different regions really helps in sending the personnel and get them trained. So in a way, it's very good. Actually, a lot of institutes are conducting a training program. So hope so. One day, so we'll have a robust program all across the country and harmonized training program. And CDRI also, again, Lucknow, so they also have a program, but I could not get the dates, but in their website, it says that they have different types of course. I think you can contact CDRI if there are any one-to-one training is also required. So certainly they'll help. Dr. Rajdeep is in charge for this training program. And so we are the new institute. So we are also planning to start our first training program from July 11th to, it's a 2-week training program for animal care staff. So soon we are going to announce this in another 3-4 days. So we are also going to start one program. And Indian Institute of Science in Bangalore also is conducting a laboratory knowledge management. Basically, it's a proficiency course. So in the last 10 years, so I was the coordinator for this program, and so trained more than 500 people. This is only in the evening. So this is actually, it was an offline course. No, only the last year they started online course. Otherwise, it only in the evening 2 hours every week. So for 6 months course. So I think more than 500 people got benefited from this course in the last 10 years. And IMTech Chandigarh also, I think, conducting one training program for animal care staff. Every month, I think they're conducting, and it's for 5 weeks, and only 5 seats are available for each month. And there's one more institute in Pondicherry. Let's see, Balaji Vidyapith. So they also have a small animal facility. They are also conducting, but I don't know whether this year they are going to conduct. But a couple of years they have been conducting regularly the training program. And ILBS in New Delhi, that Dr. Patel is also conducting a regular training program. It's again 1-week training program. Basic. Oh, okay. Okay. So there are a lot of benefits in training the people. So one is improved animal welfare. So we will give much attention to the 3 Rs, and then again there will be a decreased errors. So if the personnel are trained, and then obviously there will be less error in either handling or research outcome. And again, employee engagement is very important because, so if you see in GLP or allied accredited facility, attrition rate is very less because they give more attention for their people and they keep on training them and then give a lot of incentives. So if you don't keep them in good mood, then attrition rate will be more at this animal care staff level. So that's why you should give much attention to that also. And again, long-term interest and personal development is also very important to keep them motivated and do their job passionately. And also, you should make the training program fun. If you just give this PPT presentation, they may not understand. So that's why always it should be interactive training, at least at the animal care staff level. So we have to give much attention to that also. And lastly, so these are the people. Actually, 30 years ago, there are no this hi-fi kind of training program. So only these people, they are the first generation lab animal scientists. They actually struggled a lot in their time period, and they dissipated the knowledge to the next generation. So one is Dr. Nayak. So few of them are no more now, and Dr. K.R. Bharadwaj from CTRI Lucknow, and Dr. T.P. Suresh from Bangalore, and Dr. Hariharan from NIN, and Dr. Srinath BR from IAC Bangalore, and Dr. Suresh, so you know him. So I think he must have trained more than 1,000 people in his, I think, career time. And Dr. Fernandez from Sri Chitra Trivandrum, and Dr. Marathe, and Dr. Sai Baba from CFTRI, and Dr. Deshmukh. So these are all the, I think, giants in the laboratory of science in India, and they struggled a lot, and they really, so they have contributed a lot to the laboratory of science. Thank you.
So thank you, sir. Maybe 1 or 2 quick questions. Yeah, please.
And I think from CPCSA side, there is no regulation on these training programs. No. Each institute is conducting a training program with its own methodology.
Yeah.
Do you think there should be some uniform regulation in the country for across all these institutes in these training programs?
Regulation is not possible. Harmonization is possible. So regulation is difficult because it depends upon the type of animals what you are using. So some people may be using dogs, some people monkeys. So then you can't apply the same yardstick to everybody. So you can harmonize what should be the minimum content in the training program. You can do that, but CPSC I think don't interfere in this.
That's what I'm wanting to know about. At least some harmonization should be there, because each institute conducts its own way. Some on management, some on ethics, some on welfare, some on practical training. And what is the authenticity of the institute to conduct a training program in such a way?
Correct, I agree with you. So
there needs to be some, if not a regulation, some harmonization is needed.
Correct. Somebody has to take initiation.
Somebody has to take initiative. Then only the training programs will be meaningful. Correct. Some are online, some are offline, some are 2 days in a week for 6 months.
Otherwise, what happens? This program will die on its own.
That's what I.
So to sustain for longer period, so like how N9 is doing for the last 50 years, so you should have a robust program, and then you should take it further.
Some are charging a lot of fees, if I am to mention that, and students are lured into going for that by paying heavy fees, just thinking that I'll get a certification.
So my question is, do you have any program to educate IAEC members not to exceed the mandate? I'll tell you one thing. One of my studies now involved animal dissection. So it went to ethics committee, and the ethics committee says that no, only veterinarians should do the dissection. I have been doing this for 30 years, and then they said you have to hire a veterinarian to do the dissection. So this kind of things happen. No, this is just one example.
Dissection can anybody can do, but interpretation is difficult for everybody.
So that's okay, sir. No, what I'm saying is no, this is just an example. There are so many things on the IAC that exceeds their mandate, or they do not know.
No, actually,
they do not know, and then they insist no. That's just to do in a particular.
CPCC is planning to conduct a refresher training program for all the IAC members now. Probably I think it may happen because of the pandemic, so they could not do a training program for refresher and refresher training. So probably they are going to start, and then they are going to tell all this. Yeah.
So if there is a website now where we can now write this problem to CPCSA, it'd be good. So that CPCSA will come to know that there are problems with IAEC, so that they can make some.
Unless you write to CPCSA, they will not realize it. So you have to write to CPCSA. So all the problems.
No, if there's a website now, we can write it in the website. We can post it on the website.
Sorry to interrupt. Actually, it's not a question. It's sort of suggestion, because there are several trainings are being conducted in India, throughout India. But what happened? No professionals or students, they are unaware where exactly the training is this year. So what I suggest, under the LASA website, we can have one training tab, so that anyone can visit on the.
That's what I mentioned. Now, in NARBIAS, being a national resource facility, so we are going to have a portal. So in that portal, we are going to have all these things. We are going to concise.
So under that tab, the training.
Even LASA can also have a hyperlink for that.
Yeah, entire country, it can be displayed in a single tab.
Okay, thank you. Another speaker is actually foreign speaker. He is online. Thank you, sir, for your wonderful talk.
Okay.
I request to Dr. Pranjali, please present to Dr. Ramchandra, sir. One more session. There is also announcement for the poster presentation. The poster presentation is judging is started. I request to those are involved in those are the participant. Please go to the poster presentation area.
Yeah. The next speaker is online, right?
Yeah, next session will be online.
Yeah. Dr. Chris, are you there?
Yes, I'm here. Do you hear me?
Yeah.
Okay, perfect.
Wonderful. Yeah. So the next speaker is Dr. Chris Ganeshakan. She will be delivering a talk on skill training and assessment in laboratory animal science courses. So Dr. Chris, please.
Okay, thank you for the invitation and giving me the opportunity to share some of our insights that we have gained by auditing as a FELASA Education and Training Board different lab animal science courses. Now I will try to catch up with some of the time by skipping through some of the slides, but I think it is nevertheless important that you are aware of how the different courses are organized within the European
yeah, Dr. Chris, 1 second, sorry to interrupt you. So you have to, there's a time limitation is there. I think 15 to 18 minutes.
Yeah. I will try to consider it. Yeah.
Thanks a lot.
Okay. Yeah. So within the European Commission, there's a European directive that gives the specifications for education and training in laboratory animal sciences. And they now have shifted a little bit from the category system to a function system. So we have 4 different functions that are listed here. Function A, carrying out procedures. B, project design. C, taking care of animals. And function D, killing of animals. And within this European directive, it is stated that all staff shall be trained for a specific function prior to staff carrying out these different functions. Now, what they have also mentioned are different modules that should be covered. And they make a distinction between 3 types of modules. We have a core module, which is compulsory for all the functions. Typically, it's legislation. That is something that everybody should learn being involved with laboratory animal sciences. Next to that, we have function-specific modules. For instance, function D is killing of animals. Well, then you need to have a module that is devoted to killing of animals, a module that is less necessary for instance, project design. And then we have some additional task-specific modules. Typically, this is anesthesia. Now I have made an overview again of what these modules are here. So this is the list of the core modules. You see that for the different functions in the table A, B, C, D, all the boxes are ticked. That if we move to the function-specific modules, you see that the number of crosses is less and is not in all the functions equally represented. And you see that even in these function-specific modules, we make a distinction between modules that can be purely theoretical ones, not involving working with animals. Typically, this is project design. There's a lot of statistics in those modules. But we also have modules that involve skill training. And for the remainder of the talk, I will focus on those modules. Now, so the directive states that there are different functions. Each of these functions has modules that they should cover. And this directive also states what was also presented in the previous, or was presented by the previous speaker, that you cannot be fully competent after a course of, for instance, a week. This course is typically step 1. It's educating and training a person. Then such a person moves to a lab environment, a work environment, and starts working under supervision. And it's only after carrying out the procedure over and over again, repeat doing an IP injection 1,000 times, that you only can reach full competence. And this is step 3. So typically step 2, step 3, they are carried out while a person is working, whereas step 1 can be part of a training program. Now, this is also another way of representing what was shown in the earlier slide. So we have the training program. This is the course that a course organizer needs to design. Then we move to working under supervision, and then we have reaching fully competence. And then we also have this continuous professional development, CPD, that increases the level of competency, but also gives a deeper learning and critical thinking characteristics to the staff. Now, in this European directive, they also make a distinction on a task that has no or limited impact on animal welfare. There you can offer a course, a training course, purely theoretical, and then have the person moving to working under supervision. Whereas if you want to train a task or a procedure that has an impact on animal welfare, part of your training should also include an assessment. Now, what should we offer in this training? Well, in this training, the European directive does not tell you how many hours you should teach on law or how many hours they should restrain or manipulate an animal. No, they define learning outcomes. What does a student needs to be able to do after having completed this module? And this can be knowing something, that's theoretical knowledge, or be able to do so. Now, what are the learning outcomes of these skill modules? Because that was the focus of my talk. Well, they are listed here. So you see that I've highlighted a lot of words in these learning outcomes, that being able to approach, handle, pick up, and restrain an animal, demonstrate how you can confirm that, perform minor techniques, but again, under supervision. So this is something that you should, that a student should be able to do at the completion of the course. Now, how do we then start constructing a course that will reach these learning outcomes? So we want the student to be able to demonstrate how to perform an IP injection, for instance. Now, how can we train this student? Well, ideally, we include living animals in this training, because in the end, this student should be able to do an IP injection on a mouse, for instance. But where does that start? And this is something that really differs between courses, because it's on the one hand also based on what the legislation allows in a certain country. Now, how do we assess this? Well, we on the one hand can make an activity or a training program to have a student being able to do this IP injection, which is outcome driven, but we also should design our assessment, because at the end, the student gets a certificate that states that this student can perform this technique sufficiently well to allow this student to work under supervision. So it should be all in line. In case a student has only watched a video on how to perform an IP injection, we cannot in an assessment ask a student to perform an IP injection on a living animal. We should really make sure these things are in line. Now, how do we then make such a kind of an assessment? And then I'm compiling a little bit of pyramid with this light bulb of Bloom's taxonomy. And here you can see that within this view of application, comprehension, and analysis, you get some verbs that you can use to design your assessment, just to be able to apply, to employ, to operate, to practice, to point out, to select our levels or our verbs that we can use to design our assessment. Now let's turn back a little bit to this scheme, and I'm going to give you some examples on how some of the courses that we visit have organized it. So in Europe, we make a distinction between tasks with no impact on animal welfare and tasks with an impact on animal welfare. And typically, and I fully agree, you can discuss on the impact on animal welfare of a wrongly carried out restraining procedure, but this is typically a task with no to limited animal welfare. So in the end of module 3.2, a student should be able to approach, handle, pick up, and restrain an animal. Now, what are the 2 points of attention, so to say? That is that as soon as you use a living animal in education, it should be discussed whether this is a procedure that needs to be approved by an ethical body, or is it a procedure that needs no approval of an ethical body? And this is something that can differ between regions. So this is sometimes a bottleneck for some course organizers, that they are not allowed to perform training on living animals. Now, also what is for all skill assessments often a debate, how can you measure that a student has a good attitude and a culture of care towards working with animals? So this remains a little bit of a, not a problem, but an issue that we should be aware of. So how can this be done? What is typically done in a course is that students are shown a video, or the course organizer does a demonstration using living animals. And after that, having watched that, having perhaps answered some questions on that, a student can perform these restraining techniques on these dummy animals. You can also buy them in a shop with children's toys, perhaps. You can be really inventive with it, but you can also use, for instance, dead animals' bodies to give the students a safe environment to in an easy way, not too difficult, because the mouse is not wriggling and trying to escape, to gain some confidence in restraining the animal. And then, depending on whether or not it is allowed, you can progress towards applying this technique on living animals. Now, what is a little bit a debate here is that, should we assess this or not prior to having the student progressing to working on the supervision? Now, ideally, you do an assessment, and this assessment should tell the trainee that he or she is able to run this task. Now, what is nowadays really, and it stems a little bit from medicine and veterinary medicine programs, is that we give the students this task in what is perhaps an objective, structured examination, but translated to a laboratory animal setting. So we say to the students, for instance, you need to change the cage of these 2 mice, and you do it in a good manner. And then we have these lists, what we abbreviate by DOPS. So we break down all the different steps that a student should carry out. And then we check whether they do these different steps in the right order, in a confident manner, in a correct manner. And by using these DOPS, and there are more examples on the 2 links that are on the slide here, they are freely accessible and you can play around with them and make your own. It allows you to give, in a way, structured and objectified feedback to the students. In case you say to a student, well, it was not that good. Yeah, what was not that good? On which part of this task should I train more? It also allows you to make a distinction between students that are natural born talents, so to say, and those that really are not that good at all. And it also gives you the possibility to indicate what we call fatal flaws. If a student, for instance, let the animal dangle by its tail or grabs the mouse by the tip of the tail, you can say, stop, you failed it, return to start, or you do it again using a mock animal. Where you do this assessment, it can be part of your training, of your course, but it can also be part of working under supervision already in the lab where the person is working. And you can use that then to decide whether the supervision can be lifted or not. Now, a similar structure for those tasks that have an impact on animal welfare. So here, this is certainly a regulated procedure. So again, it can be allowed or not allowed in certain regions. And it is really important that within a course, the assessment should be done that you say, this is somebody who can start working on the supervision. It's not that that person at that stage is fully competent. What are examples? Again, you can show students videos or demonstrations. You can use these, very often they are expensive, models, dummy materials. Here you see an example of a rat with a transparent thorax and abdominal cavity. So you can, for instance, check the position of the gavage needle. You can do blood sampling. But you can also use, again, that animals' bodies. You can then even progress to living animals, but you do not place the injection really. You work, for instance, with a syringe without the needle. And then you can, again, move towards using living
Please, you have
animals.
to wind up, please.
What?
Yeah, time is up.
Okay, I'm nearly there. So you can have another check. Now here we can use again these dots with the same fatal flaws and to give feedback and to allow a distinction. And this is my final slide, which what I think is really important, a multi-tiered approach. I think these dots are really helpful. And I want to conclude by thanking the other members of the FELASA ENT board. Okay.
Thank you, Dr. Chris. Wonderful talk. Yeah. Any quick question from the audience? Yeah, please.
Hello, Chris.
Yeah,
so my
hello.
question is that in the section D, you mentioned killing of animals.
Yeah.
So I would rather suggested to mention euthanasia of animal. So it's a animal welfare point of view that saying the word also not appropriate to use the word killing of animals.
Yeah.
So you can use the euthanasia of animals.
Yeah, it's a debate that is ongoing. So we say humane killing of animals. We try to refer to euthanasia in case a person, typically a human being, can agree.
Yeah,
that is why they make a little bit of distinction. I cannot change the wording of the European Commission, unfortunately, but they have dropped euthanasia and instead have replaced it by humane killing because the animal cannot agree to the procedure.
Yeah, and in your training program, do you include the pain and distress topic also? So the how to identify the pain in the animals, so that because all the training which is really essential for know the pain for the person who
Yeah, in one of the modules, I think it is module 5, it is the observation of different pain signals, the behavior of animals, observation of stress signals in the animals. So that is also included. And there it can be a theoretical approach. And depending on some courses, they also have like a practical approach that animals should observe certain experiments and do like a Grimmage scale assessment.
Yeah.
Thank you, Chris. I think we're running out of time. And
Yeah.
if any further questions are there, we can email her.
You can
send
always
us the
contact
queries.
me. Yeah.
Yeah. Thank
No
you so much, Chris.
Okay.
Thanks a lot for your brief presentation.
Yeah. Bye-bye.
Now there are. Okay. Yeah. I request Dr. Ravi Krishna sir to please come on the dais to felicitate Dr. Prabhash Babu sir as a token of appreciation. And then I request Dr. Upendra Bhatnagar sir to felicitate Dr. Pranjali sir, please. Thank you, Ravi Krishnan sir, and thank you, Prakash Babu sir. Thanks a lot. I request Dr. Upendra Bhatnagar sir to felicitate our co-chair, Dr. Pranjali. I have 3 announcements here. Please listen carefully so that there is no last-minute confusion. We are merging oral presentations into the tomorrow's oral presentations. So there are no oral presentations today. It will be taken care tomorrow. The slots and timing will be communicated. Second thing, the gala dinner arrangement is there. The hotel is 25 kilometers from this destination. So I request the speakers who will be there into the next session, I request them, if it is possible, please try to squeeze your presentation in 12 minutes. And one more thing, what we could say, that if the presentations are done on time, we can start here by 6:30, I guess, 6:30, 6:45, so that we can reach there by 7:15. Right, sir, Balaji, sir? So the distance is 25 kilometers. It will take 30, 40 minutes. So please be on time. One more humble request, those who are going to the exhibition areas or the lunch areas, please take care of the belongings. We found one missed bag there. We handed over to the concerned person. So please take care of the belongings. Thank you so much. So we are breaking for tea, and I request, please come back within 5 minutes. Thank you so much.
सगळं नाही सगळं रूममध्ये पाठवून आता तुम्हाला काही पाहिजे आता खाली आहे ना म्हणून आमच्या लोक म्हणून काय त्यांना म्हणतात बोलावलं मी मेसेज टाकला बघितला तुमचा मेसेज करून घ्या त्यांचं द्यायचं टेन्शन झालं मॅडम म्हणतात उद्या पुन्हा मला पाठवून ज्याला द्यायचे असतील आम्ही देऊ नो प्रॉब्लेम ట్రే ఉందని ట్రేజ్ ఉందని వీటి తీసుకెళ్ళండి ఇది కూడా తీసుకెళ్ళండి ముందు ఇది ఉందని లేకుండా రేపు నాలుగు పట్టుకుని ఇంకొక పట్టు మంచి పట్టుకుంటాను ఏం లేదు
Good evening, all. I request all participants, please gather in auditorium. We are about to start next session. Hello, everyone. Hello, everyone. Welcome back. Now we are moving ahead for the next session of animal models for research on vaccine development. For this session, I would like to invite as a chairperson, Dr. Nagendra R. Hegde, scientist EH, NIB Hyderabad, and co-chairperson, Dr. Pradeep Kumar Das, Assistant General Manager of Biologically Limited, Hyderabad. Welcome, Chair and Co-Chairperson. So we'll start with the first topic, animal models of influenza disease, pathogenesis and vaccine development. For this topic, I requested Dr. Renukar Daja, Professor, Center of Food Animal Health, Department of Animal Science, Ohio State University, USA. He's going to deliver his knowledge on this topic. Please continue, sir.
So hi, Dr. Aradhya. Good morning to you.
Hello, thank you.
Yeah, so we welcome you, and because of the shortage of time, if you can actually run through the not so important slides and try to complete in 15 minutes, we would highly appreciate that.
Yeah, I'll try.
Yeah, over to you to talk about animal models of influenza disease pathogenesis and vaccine development.
Okay, thank you. Yeah, can you see my slides?
Not yet. Yes,
What
we
about
can
now?
see it now. Yes.
Yeah, thank you. Okay. Thank you for the invitation to participate in this meeting. This is my pleasure to address today you and share a little bit what my lab has been working on animal models on influenza, disease pathogenesis and vaccine development. So influenza in humans and major source of evolution, most of you might be well aware of it. So it is the disease of the respiratory tract and is a global problem, having millions of people succumb to the disease, and pig has been the intermediate host for the influenza along with birds. So this is just to outline how in the backyard forms the influenza viruses can transmit among the different species of birds and then to swine and also directly to humans. This is how the influenza virus transmission has caused opportunities for virus to evolve and cause more disease every year in the US, more common, and also globally, and with the pandemics happening every now and then. So it is a disease of the respiratory tract with high morbidity than mortality, found in both humans and domestic animals. There are A, B, C, and D influenza types. A and B are the concern for humans, and C is a very mild disease, not much concern, and D is in cattle. And influenza virus, as you know, is widespread not only in humans, also reported commonly in birds and other species of mammals like swine, horses, cats, dogs, and bats. And but influenza A virus is the major concern globally, is because of the high degree of genetic variability and infectivity to host. There are various animal models used for influenza disease. People have used like mice, ferrets, guinea pigs, rat, hamsters, and including pigs and macaques, and other including hamsters and chicken also. But the selection of an animal model is very critical in terms of the susceptibility to virus, and also the readout for viral infection should be clear. And mouse model, though, is widely used because of low cost, size, and availability, and also the tools and reagents, but it is not a natural host for influenza. Most of the viruses may end up in causing mortality, but that is not the outcome seen in humans and mammals. So, however, ferrets, pigs, and macaques are the disease pathogenesis and vaccine studies kind of closely mimics the human flu infection. So in ferrets, with respect to clinical signs and pathogenesis, goes like in humans, and both A and B viruses of human origin are infectable to ferrets. But there are drawbacks also there with the ferret model. There's a lack of availability of inbred and specific pathogen-free animals, and the cost definitely much higher compared to other rodent species. And especially if you want to study intranasal vaccines, ferret cannot be a suitable model because of the anatomy and mucosal responses. They do not quite mimic the human airways. So as a result, there are larger animal models are definitely having advantages. So my lab has been working extensively on the mucosal immune system, how we can improve the local immunity in the respiratory tract for influenza from over a decade. And if you all not so familiar with the mucosal immune system, so just underneath a single layer of epithelial cells, close to 80% of the body immune cells are in the mucus-associated lymphoid tissues and in the lamina propria area. So that means activating this bulk of the body immune cells is possible if you have a good mucosal vaccine. To study this kind of vaccine development and evaluation, we need definitely a suitable animal model. So this is where my lab has been interested in working pig as a model for the intranasal vaccine research. So just you'll see in this schematic in the swine, the tonsils in the respiratory tract, kind of the location of them quite similar what happens in humans. Since influenza is mostly an upper respiratory infection and rarely also involves lung, so pig model is quite suitable. So I don't want to go in depth, a lack of time. So just to give a comparison, the human lung versus the pig lung is, if you compare the body weight, match the body weight on the pig and a man, and then take the lung and see they are quite similar. So it's difficult to say which one is human, which one is pigs. And the structures of the physiology and anatomy and immunological responses in pigs quite similar to what noticed in humans. And it has been used, is definitely is a natural host for influenza, with the susceptibility and disease pathogenesis is 100% similar what he noticed in humans. And the pig has been extensively used because of many advantages and high homologies to human, more than 80% contrast to mice, just 10%. And immune responses are more closely resemble in human than mouse responses. So, however, still the immune reagents available for porcine system are improving now, but still we need more. So to address the intranasal vaccine delivery, what my lab has been using in the pig as a model, so I have some data to share today. So my lab has been trying with the how we can efficiently deliver the inactivated virus antigens or the subunit or a peptide a cocktail of antigens of influenza by intranasal route. We use different types of polymer based nanoparticles and then have the data to show each one of these type of polymers have the ability to improve the immune responses to the vaccine cargo. But each type of polymer we could delineate clearly that type of immune responses, either Th1 biased or Th2 biased or Th1 Th2 balanced type of responses can be induced efficiently to intranasal vaccines delivering the influenza virus antigens in the pig model. So this is what has brought us to having more publications and the US patents to prove this kind of technology is possible, and using pig as a preclinical animal model having the advantages. And for that kind of study, we have been using the whole inactivated virus and then also the conserved peptides of the pandemic influenza virus, and consistently we use the similar virus for the vaccine formulation, and for challenge always an heterologous virus which is highly genetically different. So kind of within the H1 virus, you know, if it is a 77 to 80% H gene identity is considered as highly heterologous. So we have been using this kind of model system to see how the heterologous protection can be induced by to intranasal vaccines in the pig model. So I don't want to go in depth about this nanoparticle. You must be aware it is a very efficient vehicle delivery system for mucosal vaccines, because the vaccine cargo has to be protected before it is taken up by the immune cells. So this kind of studies we have done extensively, showing even the antigen cross presentation, induction of the CD8 T cell responses, which is rarely possible if you use the subunit or an whole inactivated virus without the proper delivery system. And so just to show these particles are capable of delivering and having the entrapment efficiency of around 70%, and then the size is around 100 to 500 nanometers, suitable for dendritic cells uptake, and they are quite stable, can have the vaccine cargo for a month without much loss of the vaccine antigens. So but when you go intranasally, first 2-3 days, whatever we give as in the particle form are taken up by the immune cells. So this is how in case of pigs we can use as a model for intranasal mixed type of vaccine mixed delivery, which is can efficiently deliver to the lymphatic tissues in the respiratory tract, and we have the data to show when you do intranasally after 12 hours in the tonsils, tracheobronchial lymph nodes, we can see our vaccine particle, the fluorescent particle shows the delivery of the vaccine through intranasally in the pigs can reach the mucus associated lymphatic tissues in the respiratory tract, which likely capable of inducing adaptive immune responses. So just I'm showing a couple of data slides how intranasal delivered vaccines in the pig model can induce peptide specific T cell responses in the lungs of pigs. So each peptide, whatever we have in the x-axis here, were used to in the vaccine formulation. There are 5 different peptides, and then re-stimulated with the same individual peptides from the lung mononuclear cells of the pigs after 2 doses of vaccination, followed by the challenge with the heterologous virus, showing that the peptide specific T cell responses can be induced in pigs. And further to improve the breadth of immunity, we ended up using the whole virus as the antigen, whole inactivated virus. If you see the clinical signs, if you watch carefully, brown and the maroon and the red color bars showing the body temperature of the control animals, 4 to 5 days they have fever, and then but if you give an intranasal vaccine with the nanoparticle delivering the whole inactivated virus, right after 1 day the animals clinically were normal. The good part is we could induce robust T cell specific the CD8 T cells and also interferon gamma secreting CD8 T cell responses in pig lungs, showing that these whole inactivated virus also can induce robust T cell responses to intranasal vaccine. So to induce, but that particular the polymer failed to induce antibody responses, the PLGA. So then when you switch to chitosan, we could able to elicit robust mucosal IgA responses and also serum IgG responses to an heterologous virus antigens. The whole respiratory tract in the nasal passage and also in the bowel fluid and lung lysate samples. So this clearly demonstrates that pig can be used as an efficient animal model for intranasal vaccine studies, can induce the immune responses in the respiratory tract and also in systemic and reduce the clinical flu symptoms. And this is what I'm showing, the nasal viral load and the lung viral load, both are close to 2 log reduced. So as per the published literature so far for influenza, if you achieve 1 to 2 log, around 2 log reduction in the virus in the upper respiratory tract is definitely is an accomplishment to show that the local respiratory responses are crucial in reducing the viral load and also viral transmission. And just by there's always a possibility to improve the vaccine formulation and check in the pig model for intranasal vaccine just by adding a mannose, which is a ligand for the mannose receptors on the dendritic cells. We could further improve the level of T cell responses to chitosan based nanoparticles delivered intranasally in pigs. If you see this tracheobronchial lymph nodes and then the peripheral blood mononuclear cell T cell responses. So just having the mannose chitosan, having the inactivated influenza virus antigens versus without mannose, we can further improve the level of T cell responses in addition to the secretory IgA responses in the nasal passage and the lungs of the animals. So that means we have the pig using as a preclinical model for the intranasal vaccine seems to be quite beneficial. And further to go on, there are associated Th1 and Th2 responses. And then if you have another delivery system called a lipid-based liposomal nanoparticles, also we tried, and I'm showing here the peptide-specific responses to even the liposome-based vaccine delivery system. That in this slide is a busy slide just to tell you the PBMC is harvested from the pigs after 2 doses of vaccination and challenged with an heterologous virus and re-stimulated with the individual peptides and also with the pooled peptides. You can see a peptide individual 1 to 10 with the liposome-based vaccines delivered animals. We have an adjuvant or a no adjuvant with just the liposome delivering the 10 conserved influenza virus peptides. We could elicit the T cell response, specific T cell responses, and also we can modulate the type of immune responses by adding an additional adjuvant. So which balance the Th1 and Th2 responses. So if you look at here carefully, if you can measure the secreted interferon gamma after re-stimulating the PBMCs of the vaccinated animals, just by adding group 4 and 5, if you see carefully, like this is the 4 is having the liposome delivering the conserved 10 peptides with the liposome delivering the conserved 10 peptides with the adjuvant. So we can see the adjuvant can switch towards the Th2 response. That means there is no interferon gamma, very little compared to without. So this clearly indicates pig can be used as an efficient animal model for intranasal vaccine studies. So to conclude, as you know, influenza is a disease affecting mainly the upper respiratory tract of humans, mammals, and birds. And induction of the local mucosal immunity is the choice if you have a good vaccine formulation. However, at the moment we do not have any good intranasal vaccine available. Flu mist is practiced in the beginning in the US, but now it is no longer used, mainly because of pre-existing immunity in the upper respiratory tract or in the systemic. He is not allowing the temperature sensitive virus replication further, so the immunity levels are not very satisfactory. However, if you go with this kind of novel vaccine formulations and then test well in the proper animal animal models and then take to the macaques and human studies, having a huge promise. And there are various types of nanoparticle mediated delivery of influenza antigens. My lab has been involved in the pig model, and we are now trying to take up to the next level. And the preclinical trials in mice is absolutely fine to begin with, to understand the mechanisms involved in the pathogenesis and the initial studies. However, further studies using the appropriate models like including ferrets, pigs, and before you go to macaques will be highly helpful. And we have a facility even to work with the BSL-3 pathogens like SARS coronavirus 2 currently we're working on, and also the H5N1 IPATH influenza viruses. So thank you. I would like to acknowledge all my lab people who have been involved in this work from over 10 years, and the funding source from multiple agencies, and there are many collaborators helping in this study. And thank you. If you have time to take a couple of questions, I'm okay with that.
Thank you, Dr. Aradhya, and thank you for keeping abreast on the time. And congratulations on developing this technology and also patenting it. If there are any questions, we can take a couple of questions.
One question from my side. That we have shown the log2 reductions before in control animals versus the vaccinated animals. What of challenge you have given after 2 doses or 1 dose only?
The challenge is only 1 dose. The challenge after 2 doses of vaccination. The animals were given vaccine when they were 4 to 5 weeks old. We tried both in the SPF animals and also maternal antibody positive animals. In both the cases, intranasal vaccine are equally effective because they don't get interfered compared to when you have a parental vaccine. And then this is after 2 doses of vaccination and then challenge with an heterologous virus. We did both intranasal, only once challenge intranasally and also intratracheal. You want to have a good infection both in the upper respiratory tract and also in lungs. So we have a model which clearly gives a very severe lung pathology in the control animals versus the vaccinated.
Thank you, Dr. Aradhya.
So looks like we don't have any other questions, so we'll move on to the next one, next presentation by Dr. Dharani Ajitos.
So next speaker will be Dr. Dharani Ajitos. He is from Director of Pathology, Regeneration, Pharmaceuticals, New York, USA. So I request to Dr. Dharani, please start.
Dr. Ajitos, if you can finish in 15 minutes, will be highly appreciated.
Hi, yeah, good evening. Can you see my presentation?
Yes, we can. If you can put it on slide mode. Yeah, thank you.
Okay. Yeah, I try to run through as much as possible. Good evening, everybody. And my name is Dharani Ajitas. I'm a pathologist working at Regional Pharmaceuticals. And today I'm going to talk to you about preclinical animal models of COVID-19. And just to start with the disclaimer that these presentations are of mine and the contents are not approved by my company. So today's agenda, I briefly talk about the SARS coronavirus 2 and then human disease. I think it's important to understand the disease process in humans first so that we can see what is replicated in animal models or not. And the second, I will talk briefly about some of the models available. Specifically, I will focus on NHP and then hamster model. Then I will use a case study next to show you that how these animals models are utilized to test the efficacy of drugs and then vaccines. And if time permits, I will briefly touch up on the ADE, VRD that's been a big concern for COVID treatment as well as for the vaccines. So first about the virus and the human disease, and most of you are familiar with this virus. So this is SARS coronavirus 2 that has been first found in December 2019 in Wuhan, China, and thereafter it spread very quickly throughout the world. prompting the WHO declaring the pandemic in March of 2020, and then still the pandemic's ongoing. As you can see that more than 50 crores of people are affected with this virus positivity, and almost 62 lakhs of people died. And the cases are going up currently, both in US as well as in India. There are different types of variants, including alpha, beta, Delta, and Omicron is currently the dominant variant that has been circulating throughout the world. As the cartoon shows here, there are several proteins on the surface of the virus. The most important being the one on the red. Notice the red that's kind of projecting from the envelope. It's called a spike protein, which actually binds to the receptor called ACE2 receptor in human cells. And that's the entry for the virus to get into the cells and multiply and cause other disease problems. In humans, as most of you are familiar with, the age is an important factor. The more the advanced the age, our people are more susceptible to the infection. And predominantly, if you take up like 100%, about 81% either show no symptoms at all, which are the asymptomatic, or show very mild disease, mainly the fever, fatigue, and dry cough. They might have a pneumonia, but they usually recover. However, about 14% will develop a severe disease that includes a dyspnea, and usually they have some coexisting disease process like diabetic and hypertension and so forth. Only about 5% of people go into ARDS, which stands for acute respiratory distress syndrome. They will have acute cardiac injury and multi-organ failure. This results in the death. So just to show you that currently the animal models will be mostly replicating what has been seen as a mild disease in humans. We do not currently have a very good model that can mimic all the severe and critical disease that has been seen in human beings. Just to give you a flavor of where the virus actually replicates and causes the disease process, as the virus enters through the nasal cavity, predominantly in the asymptomatic and mild disease patients, the virus replicates in the upper respiratory tract, mainly in the nasal cavity. And in mild cases, they can go into the lung and cause disease, but they usually recover. But in severe and critical patient, the virus replicates in the deeper lungs. As I shown, the virus travels from the nasal cavity through the trachea, goes into the bronchi, and then bronchiole, and finally rests in the alveoli. So the alveoli magnified here has two types of cells, one is type 1 cells, alveolar cells, and type 2 cells. So the virus infects both the cells and then causes a lot of inflammation, which I will show in the next slide. This cartoon shows how the virus replicates. So the left portion is the normal lung, and then the right is the affected one. So the once virus enters and then start replicating within the alveolar epithelial cells, resulting in death of these cells. Once these cells die, they can release a lot of inflammatory cytokines, which can result in the breach of this alveolar septa, and then the blood vessels will start leaking. So the damage to the alveolar epithelial cells predominantly results in edema, fibrin, hyaline membrane formations. The hyaline membrane formation is a very key process that's been seen in the diffuse alveolar damage. So any patients with the ARDS will have this diffuse alveolar damage resulting in inflammation. So how does it will look in human patients? These are some of the sections I'm showing from the COVID-19 patients, and which we evaluated the tissues. As you can see, the alveolar spaces is now completely gone and replaced by this pinkish to purple thick fibrinoused membrane, which is the hyaline membrane. And also in the right side, you can see there are a lot of inflammatory cells, predominantly neutrophils, but we do have macrophages and lymphocytes. And once these cells die, and type 2 cells has some stem cells like property, so they will try to replicate, and they will try to reform the alveolar spaces. Oftentimes, this happens in advanced stage. And one another feature that we commonly see in these human patients is the syncytial cells. This indicates that because of this S protein, they can actually form a fusion activity between the infected and the uninfected cells, resulting in this multinucleated syncytial cell. So how does, now we understand the disease process, how does it translate into the human animal models of COVID-19? So first of all, the question is, why do we need to have an animal model? Obviously, because this is being a human virus, we cannot study using human subjects. So we have to have an animal model. Second, the in vitro there will be a limitation to the in vitro models. Because there is no immune system, we cannot study them. And that's why we need the animal model, so that we can have a complex virus host interactions, and then also finally to evaluate our drugs and vaccines. I'm really a favorite of this quote by George Bossy, the statistician, who once told that essentially all models are wrong, but some are useful. This is regarding to the statistical model, but I think this is applicable to human animal models as well. Animal models are not going to replicate exactly what is happening in the human beings, but there are some useful features that could be studied. And there are several research questions we could ask from the virus point of view, or also from the host point of view. For example, for virus point of view, how virulent is the virus can be studied. From the host point of view, what does the disease process or pathology we see, and what type of host response is happening to this virus. And this cartoon shows that there are a number of animal models available, including the NHPs, hamsters, and ferrets, and then the more common friend, our common friend, mice. I'm going to focus mostly on the NHP and then hamster, because these are the two commonly used models. The mouse models are useful, but the only thing is that except Omicron, none of these variants are, for example, including Delta, will not infect the mouse, wild type mouse, because of the mouse AS2 receptor will not bind the virus S protein. However, there are some transgenic models that can be permissive to SARS coronavirus, but these are very expensive and very limited to some research laboratories alone. So I'm going to focus mostly on the NHPs and then hamsters. Just to show you that, as I mentioned before, any of these models, most of these models actually will develop an acute, transient, mild disease. So currently, we don't have any model that have a severe pathology or severe disease of COVID-19. So when we started looking at the models in early June 2020, so we at the time, we didn't know which animal is going to be susceptible. So we have tested in multiple monkey species, including the old world monkeys and new world monkeys, including rhesus, cynos, baboons, and African green monkeys. Cynos are predominantly used for non-clinical toxicology purpose, and rhesus is most commonly used because of this. We have known biology, and also commonly used for other respiratory viruses. So we tested this and then published in our very extensively in one of the Nature Microbiology paper in early 2021. So we looked at different species, including rhesus, baboons, and marmoset. So this shows the viral dynamics and viral titer of the virus in these species. So some of the highlights from this study is there are no major clinical signs supporting that this is a very mild disease in this species. No fever, no weight loss. However, consistently in all three species, the virus load peaked on day 3. And we did not see in this particular study, there was no difference between the viral load between the old and young animals. And we did not see any viremia. However, there are some inflammatory cytokines, including IL-6, interferon gamma, all elevated. So when we looked at histopathology, this is a section of lung here. And unlike in humans, where almost 70 to 100% of the lungs are affected, in monkeys, there are only few spots, like a focal or multifocal. So this is a section here, only this region is affected. And if you magnify here, this is a very classic case of interstitial pneumonia, where the inflammation is mostly focused on the perivascular spaces, also the septa, and some of them are spilled over to the alveolar spaces. This is very characteristic of interstitial pneumonia. And in addition, we have seen there are some minimal to mild type 2 pneumocyte hyperplasia syncytial. So these features are very commonly seen in humans as well. However, we did not see the hyaline membrane, very classic for the human disease. There are some reports they claim that they have seen, but in our hands, we haven't seen this. And when we compare to the rhesus and bubons, the bubon seems to have a slightly more severe disease than the rhesus. However, the virus load, when we looked at it, there was not much difference. The problem currently is there is a huge shortage of monkeys in US as well as in the rest of the world, mainly because a lot of scientific community, both from the industry as well as academia, they're trying to use as this the model. And also China, and starting in 2019, they stopped importing monkeys to US and rest of the world. Because of that, there's a huge shortage of monkeys to use, and people were looking for some other alternative methods. And if you're in a regulatory position, you may want to look at this FDA document where they are giving some consideration in face of the shortage. The second model we have looked at is the hamster model, which is the Syrian golden hamster, very commonly used nowadays, and including and there are some dwarf models of hamsters also used. And unlike the monkeys, the hamster seems to develop severe pathology, but not the disease process. And especially Roborsky recent times has shown that these animals can actually have a very lethal infection compared to other animal models. And one of the major clinical signs in hamsters is the weight loss. You can see this is a mark infected on the black, and the SARS-CoV infected in the red. As you can see, by day 2 or 3, they lose weight up to 10%. However, this is again a very transient disease. They gain the weight back by starting from day 10. Unlike the NHPs, the hamsters, you can see that almost 70 to 80% of the lungs are affected here, and they predominantly have a lot of interstitial pneumonia with the mixed cell inflammation, including neutrophils, lymphocytes, and macrophages, and also very prominent type 2 pneumocyte hyperplasia. It's interesting, if you leave this animal, they all completely recover from this pathology. The other additional features we have seen in this model include the type 2 pneumocyte hyperplasia, syncytial cell edema, and hemorrhage, which is also seen in human beings. The Omicron variant does not cause this much severe disease. There is an attenuated virulence in this hamster model, especially with the Omicron. So I'm going to show you one example of how this has been used to, these models are used to evaluate the drug and vaccine. So in our company, we developed a cocktail of antibodies, 2 of them called Castivimab and Hamidivab. So these antibodies will neutralize, and they will bind targets, non-overlapping epitopes of the spike protein. So probably some of you are familiar with, this is a drug that President Trump took it in October 2020 when he was positive for COVID-19.
Dr. Ajitas, if you could hurry up, would be appreciated.
Okay, so yeah, I'll quickly mix it up. Yep. So this just to show that in the pneumonia area with the treatment with the different dose level, there's a clear dose response. And not only as there are different vaccines also tested in this macaques, including the Covaxin that you guys are most familiar with. And just to summarize, animal models are very important for understanding the COVID-19 biology. Our rhesus and Syrian hamster, those are the commonly used, but they develop very acute but transient disease. Currently, we don't have a very severe model. We are still looking for the animal model that can replicate the severe disease. With that, I'd like to acknowledge folks here and also LASA conference organizers, especially Dr. Sakti Devan. Thank you.
Thank you so much for this very crisp talk on animal models of SARS-CoV-2 disease. We all know that we don't have a really appropriate model for human disease, but it's a progress nonetheless. So if there are any questions, we can take 1 or 2 questions, please. Looks like we don't have any questions. So once again, thank you so much for enlightening us on the animal models of SARS-CoV-2 disease.
Yeah, thank you.
Thank you, Dr. Dharni. Now, next session will be conducted by Dr. Cassandra Tansey from US Center of Disease Control and Prevention, USA. So I would like to say, Dr. Cassandra Tansey, please start your presentation.
Dr. Krishna, can you unmute yourself?
Hello, everyone. Can you hear me?
Yeah, we can hear.
Wonderful. Well, good evening, and thank you so much for attending this presentation. My name is Cassandra Tansey. I am a laboratory animal medicine veterinarian with the Centers for Disease Control here in Atlanta, Georgia. And today I will be discussing some One Health investigations of SARS-CoV-2, the virus that causes COVID-19 that we've conducted over the last couple of years.
Dr. Krishna, one request, if you can summarize your all the details within 15 minutes.
Sure, absolutely. I received my doctorate of veterinary medicine from Texas A&M University before I completed a laboratory animal residency here at the Centers for Disease Control and Prevention. I then stayed on first as a senior clinical veterinarian with our comparative medicine branch, and I am the current deputy branch chief of the comparative medicine branch. In my role, I oversee the daily operations of our program of animal care and use, as well as providing veterinary and research support for our high containment labs. So first up, we all know that the health of humans is connected to the health of animals, plants, and our shared environment. One Health is the collaborative effort of multiple disciplines and sectors working locally, nationally, regionally, and globally with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plants, and our shared environment. Partners are key in successful One Health investigations, and these are just some of the partners who were involved in the One Health investigations that I'm going to talk about. Since the emergence of SARS-CoV-2, increased attention continues to be placed on the One Health aspects of the pandemic. And these, again, are just a few of the most recent news headlines that we have seen here in the United States. As a laboratory animal veterinarian, I was involved in many aspects of the CDC's One Health response to COVID-19, including investigating zoonotic transmission of SARS-CoV-2 between people and animals. And the goals of those investigations were to understand transmission dynamics between species and identify the role of animals as hosts and potential reservoirs of SARS-CoV-2. And again, that is what I'm going to be speaking about today. But first, why do we care about animals with SARS-CoV-2? besides the fact that we are all veterinarians. And for many reasons, these investigations allowed us to better understand the host range of the virus, identify potential animal reservoirs, assess the risk of transmission between animals and humans, understand spillover events, and provide evidence-based guidance to protect human, animal, and environmental health. So what have we learned so far? First, we will talk about companion animals. And I want to go back to what we knew in March 2020. We knew at that time that all known human coronaviruses had originated from mammalian hosts, which suggested that SARS-CoV-2 was a zoonotic pathogen that had the potential to spill over to other animals, such as pets. Previous studies on SARS coronavirus back in 2003 indicated that cats were naturally infected with SARS coronavirus, and that both ferrets and cats could be experimentally infected and transmit to members of the same species. We also knew that research on the receptor binding domain of SARS-CoV-2 suggested that amino acid residues in mammalian ACE2 receptors were biologically conserved in cats, ferrets, pigs, and non-human primates. This suggested that these animals had cell types that were permissive to viral entry, and the information on species susceptibility highlighted the gaps in knowledge about companion animals and SARS-CoV-2 at that time. In late February, global news of the first companion animal testing positive for SARS-CoV-2 in Hong Kong was reported after having contact with a confirmed human COVID-19 case. The CDC had already begun a human COVID-19 household transmission investigation in households with at least one person with laboratory confirmed COVID-19 infection. And we defined that as human household members who were positive by PCR on nasopharyngeal or nasal swabs or had SARS-CoV-2 antibodies detected. The primary purpose of this One Health component of the household transmission investigation was to assess SARS-CoV-2 infections in mammalian pets residing in households with laboratory confirmed human COVID-19 cases. The results from this investigation would help inform guidance and decision-making during this pandemic and for future preparedness efforts. So remember that I said that partners are key in a One Health investigation. This first investigation included local, state, and federal partners, as seen listed here. CDC's One Health Working Group of the COVID-19 response deployed 2 veterinary field teams to join our colleagues in Utah and Wisconsin who had already started a household transmission investigation. Any of the households in Utah and Wisconsin that had one or more mammalian pets living in the household were included for recruitment into the One Health component of this investigation. Pets were enrolled into this investigation if the owner consented, a questionnaire was completed by a household member, and at least one sample was collected from each pet. In this picture, the lucky person holding that cat that is wrapped in a towel is me, and my colleague John is collecting a nasal swab from her in this picture. You might be wondering why a laboratory animal veterinarian was involved in this field investigation. And I would say as a veterinarian, as a laboratory animal veterinarian who already routinely provided support to high containment laboratories, I was already enrolled in an occupational health program. I was already fit tested for N95s for respiratory protection. and I knew how to safely don and doff the required PPE that we were going to need to wear for these investigations. As a laboratory animal veterinarian, I am familiar with the regulations and requirements for conducting animal research. So I wrote this portion of our field investigation that involved animals. I was able to provide guidance to my colleagues on proper handling of samples and blood draw limits and safe handling, keeping everyone safe. So we collected oral, nasal, fur, and rectal swabs and fecal samples from 56 pets total. Swabs and fecal samples underwent RNA extraction and real-time quantitative PCR testing, then if positive, sequencing and viral isolation. Oral, nasal, and rectal swabs and fecal samples were all negative for SARS-CoV-2. We were able to collect blood samples from 47 of the 56 pets. Blood samples were tested using a SARS-CoV-2 virus neutralization assay. Of the 47 pets, 4 dogs and 4 cats, were seropositive with titers ranging between 1 to 32 and 1 to 128. The results from this One Health household investigation transmission systematically evaluated pets residing in households with laboratory confirmed human COVID-19 cases and suggested that human to animal transmission in this setting occurred more frequently than was previously recognized. And these results prompted us to begin a larger investigation that eventually identified 146 companion animals in the United States who tested positive for SARS-CoV-2. Of the 146 companion animals who tested positive, 77, or about 53%, were asymptomatic, while 57 animals, or 39%, did have clinical signs. Unfortunately, we do not have information on whether the remaining 11 animals had clinical signs, and if so, what they were. However, of the 57 animals that we have specific information on clinical signs for, most animals, about 60%, had respiratory signs consisting of dyspnea, sneezing, and ocular or nasal discharge, while about 28% had nonspecific signs like lethargy, fever, and inappetence. About 12% of the animals had GI signs such as vomiting or diarrhea. As SARS-CoV-2 variants began circulating, there was interest in tracking mutations and variants in animals as they had the potential to affect severity, transmissibility, diagnostics, therapeutics, and/or vaccine efficacy. On February 10th of this year, a female pet owner tested positive for the UK variant of COVID-19, B117. Her 2 pets, a 15-year-old dog and a 12-year-old cat, were sampled 2 days later on February 12th. The samples were sequenced and matched UK variant on March 9th. At that point, our partners at Texas A&M University resampled the pets on March 11th. Both of the pets had respiratory signs at that time. When the pets were resampled again on March 15th, the clinical signs had resolved. Swabs collected at that point were negative, although viral RNA was present in fur samples. And this is the first known COVID-19 UK variant that was found in animals. However, the One Health investigations did not just focus on companion animals. There were also multiple field investigations of mink farms with confirmed SARS-CoV-2 infections. As of the end of April, we are aware of 474 mink farms in 12 countries that have had animals test positive for SARS-CoV-2. As you can see, the majority of the affected farms tested positive in 2020, although we do continue to see cases reported. In the United States, there are 16 mink farms in 4 states that have had confirmed SARS-CoV-2 infections. In late 2020, I led a team that investigated an outbreak at a Wisconsin mink farm to determine how people, mink, and other animals were involved in the spread of the virus. Mink, which are related to weasels and ferrets, appear to suffer similar COVID-19 symptoms as humans with very high mortality rates. In addition to performing an epidemiological investigation in the human workers, we collected samples from the mink and other animals on the property, including cattle, dogs, and cats. We also designed a protocol to evaluate the stability of SARS-CoV-2 on mink pelts in storage. We trained local mink producers on worker safety and evaluated a pelt processing plant for potential hazards and critical control points. The results of that investigation confirmed that mink are highly susceptible to SARS-CoV-2, that they can spread SARS-CoV-2 to mink and other animals in the farm environment, such as dogs, cats, and wild-caught mink living around the farm, and that extra precautions must be taken
Sorry to interrupt you. If you can summarize your findings, 1 or 2 minutes.
Sure. So our findings were collated into these animal health and public health recommendations that recommended that for farm workers specifically, there is a higher risk for people working with mink farms, and that they should follow available guidance for farmed mink and other mustelids to prevent introducing SARS-CoV-2 to mink on farms. Mink farm workers with COVID-19 should avoid contact with animals, especially mink. And I did just want to quickly mention that we do now know much more today about SARS-CoV-2 in animals than we did in early 2020. So here is a list of animal species that have been experimentally infected with SARS-CoV-2. Those with an asterisk have also been documented to transmit to animals of the same species, such as cats, ferrets, mink, as I mentioned, and hamsters. Similarly, we've also identified many species that can be naturally infected with SARS-CoV-2. And as of the end of this April, there were 282 animals from 26 countries that have been confirmed positive for SARS-CoV-2. That is not including the individual numbers of farmed mink. Of special interest to the laboratory animal veterinarians in the crowd, and building on the previous speaker's presentation, hamsters have now been reported to be naturally infected with SARS-CoV-2 in Hong Kong. No other species at that pet store tested positive, and both genetic and epidemiological information strongly suggest 2 separate hamster to animal or hamster to human transmissions within that pet store. We are also seeing the first cases of the Omicron variant in animals. This was a study of white-tailed deer on Staten Island in New York, where 131 deer were opportunistically sampled, and 19 of them were found to have COVID neutralizing antibodies. So we have this map that details where outbreaks in animals have been reported to the World Organization for Animal Health, and the size of that dot does correspond with the number of outbreaks. I do have just a couple quick highlighted One Health publications for those who are interested. And again, I just want to emphasize how these results really contributed to these key messages that we now use to educate the public on animals and COVID-19, which is that at this time, there is no evidence that animals are playing a significant role in the spread of COVID-19 to people. But of course, as with other health concerns, everyone should speak with their veterinarian if their pet gets sick or if they have questions about their health. And as you can see, One Health approaches are critical to addressing zoonotic and emerging infectious diseases. Laboratory animal veterinarians are uniquely positioned to share information across human and animal health sectors and have the skills and expertise to collaborate in One Health investigations. And strong One Health investigations allow us to have the biggest impact on improving health outcomes for people, animals, and our shared environment. I would like to take a moment to acknowledge my wonderful partners, the One Health Federal Interagency COVID-19 Coordination Group and subgroup members, our state, tribal, local, and territorial partners, my colleagues at the CDC One Health Office, and of course, many others. And with that, I am happy to answer any questions that you may have.
Thank you, Dr. Kachinta, for your wonderful presentation. From audience, if anybody wants some questions, we can take one or two.
Dr. Tansey, I just have a small question. Given the widespread occurrence of SARS-CoV-2 infection in humans, don't you think the number of samples in the household surveys anywhere is low? What is your inference from that?
It is low. I expect that there are many more animals who have been exposed and have mounted an immune response that we are not catching. And I think a part of that is because we are, to an extent, we are resource limited. So a portion of this depends on active surveillance, since so many of the animals that we are seeing are not showing clinical signs. So unless we have the resources to proactively go out and sample animals, whether or not they have clinical signs, there is going to be, what I imagine is a fairly large population that we are just not seeing.
Thank you, President, once again for your wonderful presentation.
Thank you, Dr. Cassandra, for your presentation on investigation of SARS-CoV-2 infection. Thank you so much for being there online with us. And we'll see that if anybody have any question, they can email to Cassandra to clear their doubts. Thank you. Thank you. Thanks, Cassandra.
Thank you so much for the invitation.
I and my partner in crime thank the organizers.
Thank you, sir. Thank you so much. I request Dr. Ramesh, Head of the Department of Pharmacology, Veterinary College, Chennai, to give token of appreciation memento to Dr. Nagendra Hegde. Thank you, sir. And then I request Dr. Balaji to be here on the dais to felicitate our next co-chair, Dr. Das. Thank you, sir. Thank you, sir. I thanks chair and co-chair to head the sessions. Thank you so much. Thank you, sir. There's an announcement now. It's a time for announcement. So many announcements. Buses will ply from the entrance of this auditorium sharp by 6:30 to the venue. The location is shared on the LASA group, right, sir?
Yes.
You want to say something?
No, we've shared the location.
Fine.
And we expect all of you to come and have
So
fun.
the request is that those who are LASA registered member will be assembled here in the auditorium. We are proceeding with the AGB meeting, annual general body meeting. And those who are non-LASA registered, which are not registered member, they can board the buses by 6:30 and try to reach the venue. Our volunteers are there, Mr. Prashant, Dr. Ravi, and Dr. I forget his name. Dr. Ravi and Dr. Anil and Mr. Ravi will be helping you to board the bus to identify the locations. So those who are not registered, they can proceed to the exhibition hall, and those who are registered member, they will be staying here and will be continuing with the AGB meeting. Thank you so much. I request all the members to conclude the meeting within sharp 1 hour so that we can reach to the venue.